application to the person, like to apply some ointment or a cream, anything like that. So then there is some absorption known as percutaneous absorption. So that absorption basically happens from this pilosebaceous unit. That is why it is important. So it has all these functions. So these are our mainly the skin appendages: hairs, hair follicles, sweat glands, nails, pilosebaceous cyst, hair follicles, all these things. Erector pili muscle. So erector pili muscle is basically an involuntary muscle. So when your body is you are in a very high temperature where you're staying, so body has to adjust to the to the cold environment. Then there is something known as contraction of this muscle. The muscle contracts involuntarily, the hairs will stand straight, and that helps in thermoregulation. So that's how these appendages become important for us. So apart from that, let us take the hairs first. So hair is known as an appendage as well as an accessory organ. So it is basically made up of keratinocytes. So there's a dead cells known as keratinocytes, and there are few hairless parts in the body, like on hands, soles of the feet, lips, labia minora, and glans penis. So basically this has three structures. The structure of the hair can be taken as three. One is the hair follicle, one is the root, and another is the shaft. So base of the hair, we call it as the hair bulb. From the hair bulb, it gives out a shoot like the substance known as the hair follicle. So this is one hair follicle which is going to connect to the skin proper. So that is hair shaft. So from the hair shaft, it is connected to the directly to the surface of the skin. Okay, so like that, there are three structures for the skin, for the hairs: hair follicle, root, and the hair shaft. Okay, so all of these three structures have different disorders of their own. Okay, it's not only in general when you are saying, you talk about hair loss, hair damage, etc. things. So it is like general. So you will not be going in detail about the disorders of the hair follicle, disorders of the root of the hair, disorders of the shaft of the hair. So that is what is my intention of today's presentation, to go in little detail and just to know you the names of those things which we neglect often in our practice. For example, if you take the functions of the skin, I mean the hair, so on the head, the hairs which are there on the head, they protect you from UV rays. It acts as a cushion for the trauma. It acts as an insulator. So when the hairs are present in the nostrils, ear canals, eyelashes, they help in restricting the entry of the foreign material. When they are there, the body hairs all over your body, they are there for detecting your senses. So when the roots, hair roots, so hair roots have a network of plexus known as hair root plexus. So they also help in detecting the senses and help in signaling to the brain. So this also has different functions. Erector pili muscle, as I said, it helps in the contraction purpose, like that. So these are the things. And introductive facts, I want to just highlight on one thing here. So human hair, they take it as a vestigial remnant, but it's not so, because it has both the functions, psychological as well as physiological functions. So physiological functions we have seen in these slides, all these things we know that. Then how psychological? So because when there is any skin disorder or when there is any hair disorder, so it is also an embarrassment to the patient. Okay, it is an embarrassment to the person also. If it is too much, or if it is inherited especially, then he may also go into a state of depression or an embarrassment. So that's how it becomes like psychological also. So it has both psychological and physiological functions. So around 100 hairs are shed every day. Okay, so then other than that, clinical significance of the hair. So we are going to read this clinical significance under two headings, one in the form of hair loss, and another is in the form of the like complete hair loss, partial hair loss, and other conditions like where the phases are disrupted, where the hair cycles are disrupted. Okay, in that case. So this is often accompanied by psychological strife. That is what the patient goes into the state of depression. Okay, stupor also when he suffers from the hair disorders also. So this and all is not needed. So for example, let's move to the clinical significance. So we divide this hair disorders basically into two categories. One is effluvium and another is alopecia. So effluvium is the broad term. Effluvium is the broad term that describes you about the hair loss in an enormous way. That is, in an increased hair loss is known as effluvium. So it is like continuous falling of the hairs. Falling out is the word that is used for effluvium, whereas alopecia describes hairlessness. Okay, so patient may describe, so it may be patchy or it may be the total. So totally, in toto, it is known as hairlessness. So you are going to read the disorders of the hair under these two headings. So apart from that, I said you like follicles. Hair follicle also has some disorders. For example, simple example I can give you is folliculitis. When there is an infection to the root, that is to the follicle of the hair, it is known as folliculitis. When there is an infestation of the lice, then it is pediculosis. All these things are at the level of the hair follicles. So hair color, just I want to show you one thing. So as you know, melanin is the main pigment which is responsible for giving the color. So apart from that, other than this, so dark colored hair, some will have very dark colored hairs. There are different categories of hairs in different races. So white hairs, black hairs, blonde hairs, okay, bronze colored hairs, okay, streak hairs, like that. So many varieties of hairs are there. So that is because of different pigments that are present in our body. So for example, the people who have very dark hair, that contains a lot of melanin in them, they have a true melanin content in them. So for example, if they have a blonde hair and a red hair, so you might have seen the Western people who have more of this blonde hair and the red hairs. So they also have, the basic content is melanin, but there is some variation in the melanin as such. So that is which contains, if the melanin pigment is containing more of iron and sulfur, then the hairs look red and blonde. So similarly, when you see the premature graying or a normal graying of the hairs, then that is because of the decline of one enzyme. So that enzyme we call it as tyrosinase. Tyrosinase is the name of an enzyme. So as and when the age advances, this enzyme starts to deplete or it starts to decline. So because of that, our hairs turn into gray. So like this, because of multiple variations and the enzymes that are produced in the hairs, there is difference in the color of the hairs. Now I would like to go into the names. Please be to just a familiar, I don't think we would have heard about these names. So telogen effluent. So before this, I would just like to brief you about one thing. So hair is having some, how our hair grows, where when our hair growth starts. So this hair growth is basically into three categories. One is the anagen phase, one is the catagen phase, and one more is the telogen phase. So anagen phase is basically the active phase, that is growth phase. So where our hair growth is rapid. So it is the fast growing phase of the hair. So usually in this phase, there is no there is no hair loss as such, because it is the active growth phase. You shouldn't see the hair loss in this condition. If at all you are seeing hair loss, then that person may be taking some anti-cancerous drugs in that case, or he might be exposed to some harmful chemicals. So only in that case, the anagen phase will be disrupted. So coming to the next, that is catagen phase. So this is in between anagen and the telogen. So it is not active after certain weeks. After 3 weeks, the hair growth stops. There is a stoppage of the hair growth after a certain period, say about 3 weeks. After this, we have the ultimate phase known as the telogen phase. So telogen, the word itself tells you that it is the end phase or the resting phase. So it is opposite to the anagen phase. So absolutely there is no hair growth. So it is resting phase. Your hairs will be there is decline in the growth of your hairs. So for example, when we see the black hairs, when we see the graying of the hairs, so it is totally decline in the hair growth like that. So that is again because of this physical stress or any chemical exposure in that case. So like this, because why I told you these names, because the disorders are classified as per these phases. So for example, if you take this telogen effluvium, so here there is total disruption in the normal hair growth and the rest cycles. That is, disruption is there in the growing phase, in the normal hair growth, and in the rest cycles. That is what I called it as resting phase. So that leads to excessive hair shedding and excessive hair loss. Okay, so how is it caused then? So usually when one pulls the hair very strongly, when you have when a hair is pulled very strongly, so that is you're physically stressing that person. Okay, so because of that physical stress, or if the person is basically suffering from any protein deficiency disorders, then he usually is malnourished. So in that cases, you can see this condition known as telogen effluvium. You can see in the diagram. So it's not like patchy or anything like that. Some of the hairs have been pulled out. So it has been pulled out. So you, wherever it is pulled out, there you can see the hair is lost in that particular area. So this occurs usually in this telogen phase, where the hair growth has completely stopped. Coming to the next, alopecia. So you know two things in alopecia. One, the first diagram what you're seeing in the slide. So there is patchy hair loss. So this patchy hair loss is known as alopecia areata. So where there is, it's not complete baldness, there is patchy hair loss in this condition. So in the second diagram, you can see it is totalis. Totalis or universalis means completely almost 90% of the scalp is bald. There is no absolutely the hair growth in this area. So basically these are autoimmune is what they have told. There are autoimmune diseases in this condition. So alopecia areata and alopecia totalis are the two conditions in this condition. So apart from that, we have hair disorders classified into two hairs. So when there are more hairs, we call it as hypertrichosis. When there are less hairs, we call it as trichodystrophy. Dystrophy is when it is shrinking in size, when it is going atrophy. Okay, or when the like the hair growth is not in a proper phase, then we call it as trichodystrophy. Like this, we can classify the hair disorders as scarring and non-scarring. Scarring and non-scarring, basically the words will refer to, so there is some hair issue, there are some disorders of the hair. So in that hair disorders, finally you will see the scar tissue that is left. Okay, but whereas in some of the disorders, there is no scarring. So for example, just now I showed you the alopecia disorder. So in that, there is no scarring that is left. You cannot see any scar tissue left there. But whereas in lichen planus, morphea, and cancerous conditions, or there is any injury to the scalp, you can see a scar tissue that is left in that condition. So apart from that, you have androgenetic alopecia. So in this, we commonly classify this as male pattern hair loss and the female pattern hair loss. So this is also a kind of baldness. So usually this is hereditary in nature. Androgenetic, the word itself will tell you it's genetic in nature. So for example, if you go for the male pattern baldness, so when it is starting at the temples at this site, so it looks like M shape. So it looks like M shape. In the female pattern, it is slightly thinned out, and you can see the parting of the hairs. Just a minute. ಹೋಗ್ತೇನೆ ಒಂದು ಶುಗರ್ ಕ್ಲಾಸಲ್ಲಿ ಇದ್ದೀನಿ ಮ್ಯಾಮ್ ಪ್ಲೀಸ್ ಒಂದು ಅರ್ಧ ಗಂಟೆ ಬಿಟ್ಟು ಬನ್ನಿ. Female pattern baldness. So there is thinning of the hairs, and when you see the partition here, there is slightly balding at the center in the female pattern, whereas in the male pattern baldness, it is M-shaped in structure. Okay, so this I have told you. Traction alopecia is, so when the people are trying out different varieties of hairstyles, so there is actually the physical exertion is there in that condition. So they pull your hairs when they're doing some beauticians, when they put you some different hairstyles, actually they're stressing you physically also there. So because of constant pulling of the hairs, so it is like a traction, it is giving a traction there, it is giving a stress to your area, and there may be some amount of hair loss in that condition, that is known as traction alopecia. So when the person is nervous or anxious also, in that condition also you can see this. Then anagen effluvium. Anagen, as I told you, so it is the growth phase. So when there is hair loss in this condition, so for example, these are all the pictures when the people have undergone chemotherapy. This is the pattern of the hair loss that they will be having, anagen effluvium. So in our practice, we actually see these things, like we hear that people are undergoing radiotherapy, chemotherapy, etc. But we never know this name as such. This is anagen effluvium. These things we are not coming across, these things, these medical terminologies we are not familiar with. So next is hair shaft breakage. When there is that's what you call the split hairs, right? So that is nothing but technically known as hair shaft breakage. So that is the bond is broken between the root and the terminal hairs. So from at the base or the root till the terminal hairs, in between what we have the hair is known as hair shaft. So there is a discontinuity in that. That is what causes us known as split hairs. So that is one thing. So apart from that, excessive hairstyles, chemical exposure, hair straightening, and putting different dyes to the hairs, all these lead to this breakage of the hair shaft. So next we'll go to the sweat glands disorders. So sweat glands is again a part of skin appendages. So basically we have apocrine glands, eccrine glands. So apocrine glands only seen in some sites, axilla, groin, nipple, and genitals, whereas eccrine is seen all over the body. You can see it abundant on the skin surface. So apart from this, even in the apocrine, eccrine glands, we have these disorders. That is why my intention, as I said today, my intention is to just know you the names, because we might have seen these conditions, but we might have not studied these conditions actually. So for example, apocrine gland, bromhidrosis, chromhidrosis, Fox-Faraday disease, hidradenitis suppurativa. These are the names of the apocrine disorders. Ecrine disorders, hyperhidrosis and hidrosis miliaria. So one by one, briefly, I will tell you about that. So just I'll show you the picture first. See, this is the first picture, blue shirt person. He is bromhidrosis, where there is foul smelling of the sweat. So he himself is not able to tolerate the smell of his sweat. So that is known as bromhidrosis. So we might have felt this, we might have experienced this, but I don't think we might have known the name of this till now. So it is the foul smelling body odor. So usually when there is unhygienic measure or when the patient has a lot of fungal infection in that sweat, so unpleasant odor can be precipitated. So apocrine gland secretion will be disrupted in that condition. The third diagram, it is in the genitals, that is in the inguinal area. So any of these areas may be disrupted because of the painful lumps that are there under the skin. So they break open and tunnels are formed under the skin. So when there is friction between them, when there is skin rubbing, when there is friction, so usual friction takes place in these areas only. So that is why he develops the lumps there. It is painful in nature and it increases at the time of puberty, and gradually also it will decrease on its own. But definitely it is embarrassing situation to the patient also. Next is Fox-Faraday disease. So this is usually seen in the woman between young females like 13 to 35 years of the age. So this is like physiological. You might have seen this kind of conditions, right? Small pimple-like appearance in the axilla and even in the groin region. So again, because of the excessive excretion of the apocrine glands, you can see it in the form of raised bumps. Okay, 13 to 35 years is the age group, and this increases during the menstruation, and this spontaneously decreases at the time of menopausal stage. So this is somewhat we can tell it as physiological. So it increases during menstruation and tends to disappear during pregnancy. That means one thing what you can understand here is it is because of the variation in the hormones, female hormones. So as and when there is increase and decrease of the hormones, then and there you can see this increase and decrease of this disease condition. So this is also a disorder of the apocrine sweat gland. Next is hyperhidrosis. Just observe the palms, they're so glossy and it is so much excessively sweated. See the legs, see the axilla, these pictures, excessive sweating. It is totally like when you open the tap and when the water starts running. So that is how the person starts sweating. So hyper is excess, hydrosis is sweating. So it is too much that it soaks his clothes sometimes, and it is very difficult to carry out his routine. So usually in axilla, hands, feet, you can see this. So even when he is awake at that time also, he is sweating in this area. So usually sometimes, most of the times it can be hereditary. Sometimes when the patient is very nervous, very anxious, then also he can have this hyperhidrosis. Apart from that, when he is chronic diabetic, menopausal stage, so then it is physiological. If he has thyroid, if low blood sugar, MI, if he has suffered from myocardial infarction, in all these conditions, he can have hyperhidrosis. Anhidrosis, A means no, right? Negation it is. So inability to sweat, there he was excessively sweating. Here hardly he sweats. He sweats. That is why, because he sweats very less, or no you can say, so that is why there is water content is decreased in the body and he can have this skin cracking, okay, or he can have this psoriatic kind of lesions. See this here, she is exposed to a lot of chemicals and this is what whitish appears. What you're seeing is typical case of anhidrosis, where they are unable to tolerate this overheating or heat strokes. So then the body cannot cool on its own. So because of that condition, it will lead to this condition known as anhidrosis. The next one is miliaria. So this is also the inflammation of the eccrine sweat glands. So this is also one such condition, tropical condition. When there is a very hot and humid climate, the patients are unable to bear it. The persons who are already there in that from the beginning, for them it's not a problem. But the persons who are actually new to that area might suffer from this disease, miliaria. So it's known as a sweat rash or a prickly heat, in other words. I can show you the diagrams also. See these diagrams here. So this is how prickly heat, you use the prickly heat powders, right? Nycil and Dermicool, all these things. So why you use that? Because of this condition. Okay, so like that, there are different types in this crystallina, rubra, and profunda. I do not want to go to that because I don't have that much of time to tell you about those things. That is one thing. So apart from this, so general line of treatment, you will not give the medicines and all in this condition. Sufficient rehydration should be there. So well ventilated, cool bedroom. Avoid excessive clothing, and white color is the preferred clothing. Excessive soaps and detergents, irritants has to be avoided, and remove and don't wear the cloth when it is partially wet, and always give cool compressions when you are staying in a hot and humid climate. And maximum you can use is, you can take some abhyangam or massage as a routine. It's not only when you're affected with some disease you have to go for those therapies. So simple abhyangam or massage is also helpful at least once in a month if you are taking. Try to avoid these steroid medications. Okay, you can use some natural antiseptics and antibiotics when it is worst or when it is intolerable as such. So apart from that, this just I want to refresh your memory, like modified apocrine sweat glands are three in number. One is ceremonous glands, which is produced in the auditory canal. You can see in the diagram, earwax. We call it as earwax commonly. So next is mole glands between the eyelashes. I'll show you the diagram. Next is mammary glands. See here in this diagram, it is there between the eyelashes. Between the eyelashes, you have a glands known as mole glands. Mammary glands, I need not tell about that. Next is sebaceous gland disorders. So basically, sebaceous glands is a part of pilosebaceous unit. So there is also a disorder in regard to the sebaceous glands. So usually if it is not working properly, so it's also known as oil glands because they secrete some oily substance known as the sebum. So sebum is secreted, and that itself, when it is not produced or secreted properly, then it gives rise to a condition known as sebaceous cyst. You might have seen also, and you might have excised this cyst also. So we see it on the trunk, face, and the neck. So it is filled with a cheesy material, okay, that cheesy like matter, and it is usually painless. Until and unless there is a severe infection or recurrence, you will not be seeing any symptoms. So otherwise, it is usually asymptomatic, but the cheesy like material is always there. Okay, so that is sebum will be blocked. Swedavahas will be blocked there. That sebum will be blocked. Once it is blocked, then it develops a pouch-like substance in that. So that is the cheesy like white substance what is there. So that is basically the keratin itself. Okay, it's just the transformation of the keratin from physiological to pathological way. So you can see the slides where are different sites I have shown, behind the ear, on the nape of the neck, face में है, पीछे भी है, like on the below the nape of the neck. These are the different sites of the sebaceous cysts. Okay, acne vulgaris. Why I have put this slide is, you know, the acne yavana pidika. This is also a part of your kshudra rogas, right? So many kshudra rogas, which is told by our Sushrutacharya, are a part of appendages of the skin disorders. That's why I just wanted to bring it to your memory there. Acne vulgaris. So this is also a disorder of the basically the sebaceous cyst itself. Details you know about that, but I just wanted you to remember that like it's a part of sebaceous gland disorder itself. So it can be seen in the face or on the complete back in this way. Okay, next, nails we have. You have to know little about the nails. So usually what we know is clubbing of the nails, or we know leukocylonia, like spoon-shaped nails. Only 2 or 3 diseases which we are very familiar. So this also has some structure. So this is also an accessory organ. It is also made up of keratinocytes. In hairs, it was dead keratinocytes. Now in nails, it is hardened keratinocytes. Okay, so like this, you have the structures. In this diagram, you can see the structure of the nail. So the tip, we call it as the free edge of the nail. The central part, we are going to call it as the body of the nail. And on the sides of the nail, we are going to call it as the lateral fold of the nails. Lateral fold of the nails. And if you see, look at your nails, there is a white colored moon-like structure, right? That is known as lunula. That is known as lunula. And the base of the nail, we are going to call it as eponychium, or the cuticle of the nail, nail cuticle. So this, you have to know basically this structure of the nail. Why this is important is because at any site there can be a acquired or congenital nail disorder in connection to this structure of the nails. So for example, I'm just giving you some examples. See this diagram. you can see this transverse depression on the body of the nail, right? Body of the nail may it transverse depression is there. So that is also hardened. If you touch it, it will be harder. So usually in coronary artery diseases, we might have not thought of its name as such, or we might have not thought about like what to call that. Like हम कहाँ देख सकते हैं ये? Means doing the namkaran will be difficult. Like whether it is at the center part, whether it is at the eponychium part, whether it is at the lunula part, like this, it is difficult to give the name because we are not familiar with the structure, right? So now once you know this structure cleanly, so free edge of the nail, body of the nail, on the either sides, it is known as lateral part. White colored one spoon shaped part is known as the lunula. Eponychium is the cuticle part. So just remember the structure so that when you are listening about the nail disorders, it will be easy for you. So similarly, onychomadesis, shedding of the nails. So this is detachment of the nail plate from the proximal nail fold. You can see that. So proximal end of the nail almost looks detached from the nail bed. Okay, so that is known as nail shedding. That is known as nail shedding or onychomadesis. Nail pitting. So there is dot-like substance on the nails, but it will be hardened. And sometimes if it is deeper, it will be painful also. So punctate depressions. These dots, we call them as punctate depressions on the nail plate surface. So all over the nail, you can see this pit-like things there. So in common, when the person is suffering from nail psoriasis, so this is one of the sign that you can appreciate. What is that? Nail pitting. Okay. Next, onychoresis. So this is longitudinal ridging. If you observe the nails closely, you can see the vertical lines in that. There is some cracking of this nail plate. So that longitudinal fissuring, we call it as onychoresis. Okay. So in lichen planus condition, this is the common presentation. Okay. And even in the degenerative aging process also, you can see the formation of this longitudinal ridges. So onychia is the nail matrix will be inflamed and it will turn into yellow matrix and it will become hard and stiff. So if there is any previous history of infection, then usually he will suffer from this onychia, onychia or onychia, whatever you call. So inflammation of the nail plate. This is the most common one, Kunakha. You might have learned this in our Kshudra Rogas. Onychogryphosis. So you can see very well, hardening is there, yellowish pigment is there, it is very stiff and it is claw type in appearance. So thickened, the nail plate is drastically thickened. That is why it is very difficult. Passively, if you try to lift also, it is not easy to lift. So the curve, there is curving. Inside there is curving of the nail plate. So usually this requires surgical intervention itself to relieve the pain because it is totally stiffened, it is totally thickened, nail plate is totally thickened. How much ever you tell him to keep the water in the salt, etc., or your Kvata preparations, Panchavalkala, whatever it is, so it will recur again because the pathology itself is like that. So you have to go for a surgery in that case. So this is one of the common things that we come across. Pincer nails. So long-term RA cases, long-term diabetic people, smokers who are chronic smokers and alcoholic, you can see the curvature in the nail. See this is like an arch, come on. So like an arch, it is curved. This free edge of the nail is curved like an arch, right? And toes is affected more than the fingers. If you see the diagram, toes is affected more. In both the slides on the right side, toes is affected more and it is looking like an arch. So we call it as, it looks as though the nails have been pinched away, pinched off. So that is why it is known as pincer nails. So rarely it can be even seen on the nail fingers of the hand. Brittle nails, this you know. So brittle, so as the age advances, so there is brittling of the nails, and some who are working in chemical factories or using the chemical solvents regularly, and housewives over a period of time, so because of house cleaning every day, so when they come in contact with these exposures, they will have brittle nails. This is quite physiological. Terry's nails, so you can see the opacity of the nails there. So the entire nail, right from the nail plate till the eponychium, entirely there is appearance of the whitish color and it is totally opaque. So this you can see it as the Terry's nails. So in CCF condition, in cirrhosis condition. So what we do when it comes to cirrhosis, we will see the scanning report and we'll start to give the medicines. But hardly we observe these things. So we should have to start observing these things. Definitely, if not, at least if 10 patients come, hopefully if you're able to see in one case, at least that feels you happy. Like, yes, there is this I had seen somewhere in my family, or I had seen in my relatives, or I had seen in my
You are not audible, Dr. Dipti. You are not audible. Are you there? I think Dr. Dipti lost her connection. So we will go with our another speaker. Our next speaker is Dr. Arun Chaugule, consultant specialty OPD, Thyro and Endocrinology, KLE Ayurveda Hospital, Belgavi, Karnataka. So I welcome Dr. Arun Chaugule, sir. Associate Professor, Department of Plant Medicine, KLE BMK Ayurveda College, Belgavi, UG and PG teacher, sir. And he is a recognized PG examiner to KLE University, RGHS and Tyrol University, published 11 articles and authors of 3 handbooks. So he has done more than 50 camps in association with Thyrocare Bombay at KLE Hospital. He is having total 40 years of PG and UG teaching experience. So I request Dr. Arun Chaugule sir to start the session. And today's topic is management of alopecia in thyroid disorders. So unmute yourself, Dr. Arun sir. Yeah, yes, sir.
Okay. Thank you. Am I audible, madam?
Yes, sir. Yeah, please
Okay.
continue.
Okay. Thanks to the organizer giving me this privilege of this opportunity to deliver a guest lecture in this E-International Conference. I'm very thankful to the organizer. Now, the current topic given to me is management of alopecia in thyroid disorder. Myself, Dr. Arun Chogle from KLE Ayurveda Hospital. Just a small introduction. Why we have to give importance to hair? Because basically it is a noticeable part of a beauty, and it has got a psychological impact rather than a somatic. It has got a psychological impact which increases your self-confidence as well as self-esteem. Okay, so the hair disorders produces discomfort, not the diseases. That's why Shushruta consider them under Kshudra Rogas. Okay, this is a brief introduction about why we have to give importance to hair. Now, this is some basic introduction regarding the hair. So we are having approximately 1 million hair follicles in our body. In that, 1 lakh hairs on our scalp, and interesting to know that scalp hairs grows 1 centimeter per month. Okay, each hair grows in 3 cycles. Okay, that I want to highlight because from practice point of view, these 3 cycles are very important. The first cycle is the growth phase that we call it as anagen. The second cycle is the transition phase, that is catagen. The third cycle is a resting phase, that is telogen. Now, see, catagen phase lasts for 3 weeks. Telogen phase lasts for 3 months. But the anagen phase, it is different depending upon the side of the body and its related hairs. For example, the duration of anagen phase with respect to scalp area, it is as long as 10 years. That's why after completing the anagen phase, each hair follicle enters into the catagen phase, which is followed by telogen phase. That's why the old hair, however, falls off only after the completion of telogen phase. This is some basic physiological aspect.
You're not audible, sir. You're not audible, sir. You're not audible, sir.
Now, madam?
Yeah, it's okay. I think you lost the connection.
Yeah.
Yeah, please continue.
Okay. At any given time, sorry for the interruption. At any given time, about 90% of the hair on your scalp is in the anagen phase. Anagen phase means they are actively growing. Now, the second phase is catagen phase. When a hair then enters this transition phase, it is also called as a transition phase, during which hair stops actively growing. This lasts about 3 weeks. involves less than 1% of the hairs on your scalp at a time. After catagen phase, the next is last phase, that is hair prepares to shed. It is then pushed out of the follicle and falls out. Typically about 50 to 150 telogen hairs are shed per day. But nowadays more than 100 we consider it as alopecia. Okay. These hairs are then replaced by new growth and the cycle begins again. This is something about a basic physiological aspect of hair and its cycle, its phase in three phases. Now, the topic proper. What the topic given to me is alopecia in thyroid disorders. I don't want to deal with what is alopecia, different causative factors of alopecia, because I am only considering alopecia with respect to thyroid, because n number of causative factors for alopecia means hair loss. N number of causes are there. Now I want to talk only thyroid disorders, how to select the different medication to treat alopecia in case of thyroid disorders. Now, let me clarify how thyroid and hair growth related. When it comes to hair growth, T4 hormone, this stimulates hair matrix. That hair matrix is nothing but keratinocyte production and multiplication. These keratinocytes is a major cell type in the outer layer of the skin. Okay, so there is a relation between T4, hair growth, and keratinocytes. In hair growth, keratinocytes plays an especially important role. They help forming hair follicles and help regulate stem cells of the follicle. That's why there is a strong relation between thyroid and hair growth, because thyroid T4 hormone stimulates hair matrix, that is keratinocytes. If T4 is disturbed, then definitely the keratinocyte production and multiplication is disturbed. Then automatically there is a disturbance with respect to hair growth and hair structure. For example, hypothyroidism. Hypothyroidism is nothing but the underactive thyroid. Thyroid is not active. So in this case, there is an insufficient amounts of T3 and T4. So insufficient amount in turn fails to promote proliferation of keratinocytes and reduces the function of the hair follicle to grow hair. Okay, this is the pathological aspect. Insufficient amounts of T4 definitely fails to promote proliferation of keratinocytes. What the result is? Result is there may be a hair loss, hair thinning, brittle hairs, thin hairs, dull hairs. This is the common amongst the sufferers. This is the most common problem with hypothyroidism patients. This is something pathological. And hyperthyroidism patient. Let you inform that maximum hyperthyroidism patient, there is a less incidence of alopecia in hyperthyroidism patients, because that is related to T4 insufficiency. But in case of hyperthyroidism, there is no insufficiency of T4, there is a excess of T4. That's why most of the hyperthyroidism patients are not prone for alopecia. They are having less number. Okay, still few hyperthyroidism patients are more prone for hair loss. At that time you have to screen for drug history, that the anti-thyroid drugs, that is carbimazole and propyl thiouracil, in rare cases they are leading to hair loss. That's why in case of hyperthyroidism, it's a kind request, first you screen the drug history. If drug history is not so solid or not accepted, then automatically you think of alopecia with respect to hyperthyroidism. See, why there may be a chance of alopecia, that these drugs artificially reduces T3 and T4 hormones, thus impacting the hair growth. That's why alopecia with respect to hypothyroidism much common. Alopecia with respect to hyperthyroidism less common. Okay. In case of hyperthyroidism, alopecia is there. First screen the drug history. If drug history is not so strong, then go for screening thyroid related issues, hyperthyroid related issues. Then few notes. In case of hypothyroidism also, one study has shown that overdose of levothyroxine, a drug for treating hypothyroidism, to compensate for production of TSS causes diffuse hair loss. And that's why dose is very important while treating hypothyroidism. If overdose of levothyroxine, then it may cause hypothyroidism. Alopecia. This is very important to screen. That's why alopecia and hypothyroidism, it is most common. Again, if it is drug induced, then you have to screen drug dosage. Then one more point I want to highlight here, that there is a blood flow and hair regrowth. Okay. In case of hypothyroidism, also Shirobhanga is mentioned. Hypothyroidism and alopecia in Shirobhanga is also mentioned, because blood flow. If you go for Shirobhanga, there may be a chance of increased blood flow towards scalp area. Then minoxidil and finasteride. These are the two drugs usually prescribed in alopecia by the modern physicians. Minoxidil, topical vasodilator drug, nothing but it increases the local circulation. And finasteride, this is a 5-alpha reductase inhibitor, basically prescribed for benign prostatic hypertrophy. Then it is why it is used here, we will discuss in the next slides. See, this is one research I want to highlight, that there is a descriptive study of alopecia patterns and their relation to thyroid dysfunction. Maximum patients, they are having a diffuse type of alopecia compared to alopecia areata or androgenetic alopecia. And the age group is commonly 21 to 40 age groups. Now, this is something about modern explanation, physiological and pathological. Now, come to the Ayurveda. We start with a glance related to Kesha in Ayurvedic text. Now, the first, if you screen the first one, Pitta Prakriti Lakshana, it is mentioned that Kshipra Vali Phalita Kalitya Dosha. These are all points are very important while treating the diseases. Why? How? I will show you in the next slides. You just go through the Vata Prakriti Lakshana. It is clearly mentioned Purusha Kesha. Then Astikshaya Lakshana. It is said that Krapatanam Kesha Loma. And in case of Vataja Nanatmaja Vikara, it is mentioned Kesha Bhumi Sputanam. And coming to the diet concern, Madhur Rasa Karma, Kesha. And Lavana Rasa Atisevana, Kshara Atisevana causes Khalitya, Phalitya, and Vali. These are the some glands related to Kesha. Few more glances, that Mala of Astidhatu, Kesha. Upadhatu of Astidhatu, Kesha. Charaka consider Khalitya as Shiroroga. Shushruta consider Khalitya as Shudra Roga. Okay. One more glance with respect to Kesha. Kesha is Malaja Krimistan. And Kesha is Shonitaja Krimi Prabhava, Kesha Nashana. And Kesha is Parthiva Bhava and Kesha is Pitraja Bhava. I just highlighted because we have, while prescribing some medication by applying few concepts, we should have this knowledge. That knowledge we are using in our clinical practice. Okay. These are the most common diseases of the hair, that is Khalitya, Palitya, Indralupta and Dharma. Though Khalitya is a Tridoshaja Vyadhi, okay, there are 4 types of Vyadhi, Khalityas are mentioned according to Ashtanga Sangrahakara, Vataja, Pittaja, Kaphaja and Sanipataja. But Khalitya is primarily a Pitta dominant 3 Doshajanya Vyadhi. Okay. Kalita is primarily with the dominant tridosha-janya Vyadhi. Remember this one. Now, according to Ayurveda, probable pathology it is mentioned as Khalite with the dominant tridosha-janya, vitiated pitta, that is especially Bhrajaka pitta, along with vitiated vata leads to weakening or withering of hair from the hair roots. And vitiated kapha along with rakta obstruct the hair roots which prevent further growth of the hair. This is the probable pathology of Khalitya as per Ayurvedic parameters. Now, come to the treatment part. How to plan a treatment in the management of alopecia with respect to hypothyroidism. I said in my previous slides, Khalita is pitta dominant. Okay, when the word comes pitta, then the line of treatment is Virechana. Okay, that is classical Virechana. You go for one classical Virechana in case of hypothyroidism with alopecia. And three dosha janya. Okay, here clearly that's why I said remember this word. Three dosha janya. Three dosha janya means understanding is it is Baudoshavastha. Okay, what is the line of treatment for Baudoshavastha? Line of treatment of Baudoshavastha is it is said that Nitya Shodhana. Okay, Nitya Shodhana. So, depending on the patient's availability, you can go for classical Virechana or Nitya Shodhana. So, to correlate this, thyroidism, it is multi-system disorder. So, when it is said that multi-system disorder, then it is correlated with Bhodoshavastha. So, in case of thyroidism with respect to alopecia, to treat pitta dominant tridosha-janya vyadhi, you adopt either classical Virechana or Nitya Shodhana. Okay, that is a better option. Okay, for example, I want to give one example here. In case of hypothyroidism and alopecia, if you want to go for the Nitya Shodhana, you just prescribe Arogya Vardhini. See, Arogya Vardhini, the main ingredient of Arogya Vardhini is Katuki. Katuki is best Bhedana Dravya. Okay, Bhedana means it is nothing but it stimulates Apanavata and fulfills the concept of Nitya Shodhana. And Katuki is also Lekana Dravya. That's why. Kapha Medhara, most of the hypothyroidism patients they are obese in nature. We need Kapha Medhara and Bhedana. Kapha Medhara and Shodhana, Nitya Shodhana or Bhedana. This automatically helps the patient for the root level with respect to Pitta, Kesha and Shodhana. This is the one why we have to go for Virechana or why we have to adopt Nitya Shodhana in the management of alopecia. That's why I said glances. Okay, different glances means different information. Am I audible? Am I audible? Okay. Am I audible, madam? Hello? Hello? Okay. See, now after Pitta, Kesha and Shodhana, now we screened or we glanced the different information of Krimi with respect to Kesha. It is said that Malaja Krimisthana is Kesha, Shonitaja Krimi Prabhava is Keshanashini. That's why you can adopt Krimi Chikissa. You can adopt Krimi Chikissa, any type of Krimi Hara Dravya. Only the thing is, the drug should have property of Krimigna as well as Kaphamedwara. Such drugs you have to select and treat the alopecia patient with respect to thyroidism. Why Kaphamedasa? This is related to obesity and hypothyroidism. For example, I want to give you the best example, that is Vidangaristam. Okay, maximum we are prescribing Vidangarista in the management of Krimi. Vidanga, always for an Ayurvedic physician, uh, it is having a routine prescription. Vidanga means Krimignana. Vidanga, Krimignana. Once you go through Vidangarista, that is Sharangadra Sahinta Madhyamakanda. If you screen the indication of Vidangarista, Gandamala is one of the indication for Vidangarista. This is just I give an example. That's why Vidangarista, Krimi, Kesha, and Gandamala. So you can go for Krimi Chikitsa in the management of alopecia. Next, the most commonly practiced treatment with respect to alopecia, that is Kesha Patana. That's why during my glances or glance screened information, I said Mala waste product of Asti Dhatu, Upadhatu of Asti Dhatu, Astisaya Lakshana is Kesha Patana. That's why if you want to treat Kesha, then as per different Nyayas, Kalekapotanaya, Kedarakulinaya, you have to improve the quality of Asti Dhatu. So what we have to go? We have to prescribe Asti Prasadaka Chikitsa. Or reverse understanding, it is said that Asti compared to bone, Astikshaya compared to osteoporosis, the management of osteoporosis in the modern science, supplementation of calcium. So this supplementation of calcium turned, okay, this supplementation of calcium turned to Ayurveda. When it is turned to Ayurveda, then our acharyas, maximum physicians, they are opting Sudha Varga. Alopecia, maximum the prescribed Sudha Varga. Sudha Varga means all marine products. Sudha Varga, which are rich in calcium. The best example is Kukutanda Tok Basma, Godanti Basma. Why we are prescribing? We are prescribing because calcium. Why we are prescribing calcium? Because calcium is best for bone. Why we are considering bone? Bone and is nothing but the Upadhatu of Asti Dhatu is Kesha. So keeping this basic information in our mind, we go for a reverse understanding with respect to calcium and bone and Kesha. On that sequence, we maximum Vedas prescribed Godanti Basma, Kukutanda Basma in the management of alopecia. Along with that, you have to go for Asti Prasadak Chikitsa. This is one type of supplementation as per the reverse understanding. And you can go for some few Asti Prasadak Chikitsa with Asti Prasadak Dravas. The best Asti Prasadak Dravas are Laksha, Asti Shankala, Arjuna, and Babula. Laksha Gugulu, Abha Gugulu, okay, Babula. These are the four best Asti Prasadak Dravas. That's why you can go for Asti Prasadak Chikitsa or you can go for supplementation in the form of calcium with respect to Sudhavarga. But in case of thyroidism, keep it in your mind. Whenever you are prescribing any calcium derivative from Ayurvedic parallels, okay, before prescribing calcium Sudhavargas in thyroid patient, it is better to ask the patient to go for blood calcium level. Keep it in your mind. Parathyroid hormone controls calcium level. Calcitonin is a hormone related to thyroidism. Hyperparathyroidism, higher blood calcium level. Hypoparathyroidism, low blood calcium level. And keep it in mind, hyperthyroidism, it is also always associated with hypercalcemia. Unnecessary prescribing calcium products in hyperthyroidism patient may end up into some complications. That's why it is a kind request that before prescribing Sudhavargas, check serum calcium level and then decide whether to prescribe Sudhavarga Dravas like Ukutanda Basma, Danti Bas, Godanti Basma, Shanka Basma, etc. or not. This is one more precaution you have to take while prescribing Sudhavargas in the management of hypothyroidism and Kesha. This is third. Okay, the first I mentioned Pitta Kesha Shodhana. Second I mentioned something about Krimi and Kesha. Third I mentioned Asti Prasadaka, Sudavarga, and Asti Dhatu and Kesha. Now, these are some information I want to give. Maximum people practicing Nasya, Nashveta Kapila Akash, Keshaha, Smusrani Va Punaha. So maximum patients are, maximum doctors are practicing Nasya. But if you go through the explanation, Matra Shiti Charaka Sutrastha, if you go through the explanation of benefits of Taila Kandosha, it is said that Na Khalityam, Na Palityam, Na Keshaha, Prapantati. So better to adopt Taila Gandosha in the management of alopecia with special reference. So in that Shirabala Taila works better. You just for information. Now, reverse practice. See, as why we are considering this, because as I am dealing with endocrinology in Ayurveda, endocrinology with respect to Ayurveda is only information is very little. Okay, we don't have any type of information with respect to endocrinology. If you ask me any endocrinological reference in Ayurveda, I can say only one chapter, Ashtanandita Vyadi. Okay, Ashtanindita. Okay, Ashtanindita chapter. Okay, that chapter somewhat dealt with endocrinology. Other than that chapter, it is very difficult to generate different informations. Just we go on considering different hypotheses to treat different endocrinological disorders. That's why we are adopting some reverse practices. For example, we are adopting this practice in our clinical practice with respect to alopecia and thyroid. For example, finasteride 5-alpha reductase inhibitors. This is a drug, the most common drug. It is a dutasteride. This is a drug specially prescribed in benign prostatic hypertrophy. Okay, there is an increase in DHT, dihydrotestosterone. See, what the 5-alpha reductase? This is the enzyme. It converts testosterone to DHT molecules in various tissues like prostate, skin, along with hair follicle. What the DHT molecules does to your hair follicle? They bind to your hair follicle receptors. They block the blood supply of your follicle cells. Okay, then automatically the end product is diffuse hair loss. That's why we consider the patient suffering from alopecia, we consider the patient's DHT level is high. So his increased DHT level, it is related to imbalance of Pitta dosha. Then automatically we are going for one classical Virajana or Nitya Shodhana. The one more information, if you go through the modern information, linoleic acid, oleic acid and lignans, which are well known as a potential 5-alpha reductase inhibitors. Okay, see, here we are using 5-alpha reductase inhibitors. The best 5-alpha reductase inhibitors in as per Ayurvedic parallels, we are having Atasi, Krishnatila, Kushmanda. These are the, as per my practice sense or practice experience. You can use these Atasi, Krishnatila, Kushmanda as a nutraceutical, food as a medicine. You can advise them in a diet or you can use them in your prescription. And one more drug, that is Sapameto. This is not Indian drug. I think it is African or American drug. Sapameto. Nowadays, it is one of the ingredient of capsule ural BPH. I think from Vasu Pharma, where it is one of the ingredient. We are prescribing capsule ural BPH for benign prostatic hypertrophy. Sapameto. You just go through the Sapameto. This is again considered as the best 5-alpha reductase inhibitor. Okay. Just example. Why we are prescribing alopecia and hypothyroidism Varnadi Kashayam. Why? You just go to the one I just highlighted one information that Varuna, which is found to possess a 5-alpha reductase inhibitor activity. This information is sufficient for us to prescribe Varnadi Kashayam in the management of alopecia with respect to hypothyroidism, because Varnadi Gana again kapame dohara. Varnadi again kapame dohara. That's why if you want to go for virechana in case of thyroid disorder with respect to the manifestation of alopecia, better to go for Varnadikrita rather than the other Kritas. Okay, why we are prescribing Varnadikasayam? Why we are considering Varnadikrita? These two consideration, it is one, it is because of Kapamedwara, the next is Varuna is best for 5 alpha reductase inhibitors. That's why we are using in the management of alopecia and hypothyroidism. This is what the why we consider, because not it is not from the classical text. It is for just like a reverse pharmacology. They are doing modern people are studying our drugs with reverse pharmacology. The same phenomena we are applying to them. That's why what you have to plan. Just I given one example. What you have to plan? You have to screen the drugs having 5 alpha reductase inhibitor activity. Such drugs you use in your clinical practice with special reference to thyroidism and alopecia. This is my one suggestion. Now, the second reverse understanding, that is ferritin and hair loss. See, as per my clinical experience is concerned, maximum thyroidism patient, hypothyroidism patient having low ferritin level, either low ferritin level or low vitamin D3. So low vitamin D3, I already we discussed that D3 it is related to calcium. That's why we are prescribing calcium. Already it is over. Now, serum ferritin. This is a newer concept. Maximum patients of thyroidism experiences hair loss. In such patients, if you screen for ferritin level, there is a low level of serum ferritin. This ferritin is a protein that contains iron and is primary form of iron stored inside the cell. That's the essential tissue. It is stored in ferritin is stored in a non-essential tissue. Hair bulb is considered as non-essential tissue. When there is a need, then these non-essential tissues gives its ferritin to essential tissues such as your heart. When ferritin from your hair bulb is leaching, then it is then it definitely cause your hair to shed before it reaches to maximum. That's why this is the one relation between how ferritin causes hair loss. Okay, that's why low ferritin level always experienced. That's why thyroid issues also cause low ferritin level. That's why I am practicing in my clinical practice lower rasayana for the management of best practicing lower rasayana for the management of alopecia and hypothyroidism after screening serum ferritin. Okay, so to treat alopecia and hypothyroidism, alopecia and thyroid disorder, along with your T3, T4, TSH, it is better to screen vitamin D3 and serum ferritin. Then, if it is vitamin D3 is low, at that time you go for Shanka Basma or Sudhavarga plus Asti Prasada. If ferritin is low, at that time it is better to go for low rasayana. So low rasayana, regular dosage in hyperthyroidism cases, as I said, less incidence, maximum dosage in hypothyroidism. So duration is 40 to 45 days because you have to prescribe in a rasayana format, that is one mandala. Okay, giving low kalpas only for 3 days, 4 days, it will not work. Okay, that's why if you want to go for low kalpas, it is better to refer Rasaratna Samuchaya chapters 26 and 28 and also Chakravarti. See, this is the one example I want to give you. Few lower kalpa examples. For example, if you take Dhatri Loa, it is best prescribed in hyperthyroidism with respect to alopecia. If you consider Tapya, it is best prescribed in both the cases, hypo and hyperthyroidism. But in hyperthyroidism, it is a regular dose. In hypothyroidism, you go for a maximum dosage. And Trayushana Diloda, purely prescribed for hypothyroidism and alopecia. Overweight, the dose should be maximum. Now, as well same, it follows purely prescribed for hypothyroidism or BMI should be overweight or obese and maximum. Ayaskriti, same. So, Trayushana Diloda, now as well Ayaskriti, purely restricted to hypothyroidism, overweight or obese people with respect to alopecia. And Saptamrata Loha and Dhatri Loha, better to consider in case of hyperthyroidism with low weight or normal weight individual with regular dosing. Only the tappadilo you have to consider in both the cases hypo and hyperthyroidism. Why we have to give this option to tappadilo? Because Shilajatu is one of the ingredients of tappadilo. The specialty of Shilajatu is if you prescribe Shilajatu in a regular dosage or low dosage, it acts as a brahmana. If you prescribe in a high dosage, Shilajatu acts as a lichen. That's why we are given the both the options for Tapatilo. Only the difference is you have to decide the dosage. These are some few low-kalpa examples. Now, the best is I said Ayaskriti. Ayaskriti is best prescribed in case of alopecia and hypothyroidism because Ayaskriti Kapavatara, Medohara, and Kledhara. You just go through the ingredients. Asana Digana. Again, Asana is best. Kapa Medohara and Kesha. Vasaka Digana. Panchakola. And again, lower as I talked lower sign. Panchakola. Okay. So, Ayaskriti Kapa Medohara. Kapavatara, Kapamedvara, Kledhara. So Ayaskriti, as it is a low kalpa, Ayas means low. So low kalpas are best prescribed if the ferritin level is low. Next is Asanadipata, irrespective of serum ferritin level or vitamin D3. You prescribe Asanadipata in the management of hyperthyroidism and alopecia because if you read Asana as a that's why we can prescribe that for the prescription of Asnadi Quata, no need of screening vitamin D3 or vitamin serum ferritin. Okay, irrespective of D3 and ferritin, hypothyroidism patient suffering from alopecia prescribe Asnadi Quata. Narsimha Rasayana, the best Rasayana, but the format should be Rasayana format. Okay, it is better as I practice that it is better to prescribe 5 to 10 gram whenever you are hungry with milk. Definitely it helps for alopecia. Okay, whenever you are hungry, you have to prescribe. You have to take nursing rasan with milk. But be aware, you have to avoid the nursing rasan in Pitta Prakriti patients because Balatak is one of the ingredient. Avhyadi Modaka. Okay, as I said that Nitya Shodhana is very important. Treating hypothyroidism and alopecia, as I mentioned, Bhodoshnavastha. That's why Abhyadi Modaka, that is reference from Ayurveda Sangra. Okay, I think Jandu or Sandu, they are having these tablets. You go for Nitya Shodhan 1 to 2 tablet, depending on the cost at bedtime. But be aware that Danti is one of the ingredients. That's why Abhyadi Modaka, cost is very important. So these are the few drugs from Bhav Prakash. I don't want to go through details just for your information. Like Vibhitaki flower, Bapuji fruit, Gambari flower, Gunja seeds, Prangaraja, Japa Pushpa, Tila Bija, Estimadi root, Bhallataka Nirgundi, Nili, Saireka, Bijaka stem. Okay, from Bhav Prakash, just for your information. These are the few references that if you want to go for any basti in case of hypothyroidism and alopecia, you can go for Panchatikta Gratakshir Basti, Charak Sahinta, or Shamadonstra Rasayana, that is Gokshura Rasayana, or you can go for Shad Bindu Tailanasya. Okay, Shad Bindu Tailanasya you can go for, but I suggested along with Shad Bindu Tailanasya, it is better to go for Taila Gandusha. Okay. The last slide, that this is a take home message. What the take home message is, that I said how to select the drugs or how to select the principle for treating alopecia in case of hypothyroidism. The first selection I mentioned is something about Pitta, Shodhana and Kesha. The next I mentioned something about the Krimi Kesha. The third I mentioned something about Asti, bone, calcium, Sudha Varga. Okay. And the fourth one, I mentioned something about reverse practices. What are the reverse practice? One is on the based on 5 alpha reductase inhibitor. That 5 alpha reductase inhibitor that is DHT, how it causes. That's why for on the base of 5 alpha reductase inhibitor, we selected why we are prescribing Varnadi Kashayam and why we are prescribing Varnadi Pratham. And the next is ferritin, okay, serum ferritin, screening of serum ferritin. That is concept of using low rasayan in the management of alopecia. That's why you feel it is better to screen Chakradatta. Chakradatta mentioned low rasayana for the management of obesity. That is the beauty of Ayurveda. Okay, serum ferritin, low rasayana, concept of low rasayana I mentioned. So nearly about 5 to 6 different concepts are considered here for the management of alopecia and thyroidism. That's why my take-home message is after screening these 5 different concepts, you don't worry or no worries related to alopecia, especially due to thyroid disorders. I don't want to add here other causes, okay, but no worries of alopecia, especially due to thyroid disorders. They are reversible, okay, definitely reversible, but the need is the patient should enter in your clinic in time, and your approach should be appropriate. With this, I say thanks to the organizer giving me this opportunity. Thank you one and all. सुनने दे रहा था.
Sir, you are continuing the session? Chaubale sir, Dr. Arun sir. Dr. Arun sir, am I audible? Unmute yourself. Unmute yourself. Dr. Arun sir, unmute yourself. Yeah, you are continuing ना sir?
नहीं मैडम, अभी खत्म हो गया मेरा.
अच्छा सर, पाटिल सर आने वाले हैं, शिवानंद पाटिल सर, वो बोले थे मैनेज करूंगा.
मुझे पता नहीं मैडम, मुझे 1 घंटे का
आप बोले 1.5. हाँ नहीं, लेकिन वो अभी 1 बजे तक का आपको टाइम था ना, तो मतलब अभी फिर एक ये हो जाएगा. थोड़ा कंटिन्यू कर सकते हैं 12:30 बजे तक, कुछ डिस्कशन करेंगे.
नो प्रॉब्लम, अभी क्वेश्चन आंसर आप स्टार्ट कर सकते हैं.
हाँ, तो थोड़ा दूसरा जो नेक्स्ट स्पीकर जो है वो 12:30 बजे ज्वाइन होंगे, तो तब तक सर आप थोड़ा कुछ आपके पास अगर नॉलेज है तो आप शेयर कर सकते हैं.
ओके मैडम.
हाँ.
Any doubts? Any doubts from anybody?
क्या आपके तरफ से सर कोई और एंडोक्राइनल इसमें आप एलोपेशिया का भी डेमोन्स्ट्रेट कर सकते हैं कुछ?
डेमोन्स्ट्रेशन कुछ नहीं है.
या मतलब आप कुछ बता सकते हैं और कोई जो भी डिसीजेस है ना एंडोक्राइनल डिसऑर्डर्स में, किस प्रकार से दूसरी जो ग्लैंड्स है पिट्यूटरी या एडिनल वगैरह, तो उसका भी आप रोल बता सकते हैं. आई थिंक देयर आर नो मोर क्वेश्चंस.
The problem is, madam, okay,
हाँ.
I just only brought only this one. I'm in my college studio. Okay.
ओके. या
स्टूडियो में बैठा हूँ, इसलिए कोई इधर डाटा नहीं है, कोई भी डाटा. The time given is for only 1 hour. Okay.
Yeah, so we will discuss some
Yeah.
cases.
Okay.
Leech therapy in alopecia. Leech therapy. Can you say something about leech therapy?
See, I never practiced leech therapy, madam.
Yeah.
I never practiced leech therapy. Maximum I only concentrating on oral therapy rather than external one. Okay. Because maximum cases are due to thyroid disorders only. Okay. As I said, I have to concentrate on T4. Okay. That's why external applications the least bothered in my clinical practice. Okay. I am not using any oil, Brangraj oil. That I am not suggesting any oil. I am not suggesting any leech therapy in case of alopecia with a special reference thyroid disorders.
Hello.
What anything is there, we are concentrating on internally. We have to concentrate on regulate the hormonal level. Okay, madam. और कुछ है तो देख लेता हूँ मैडम, और कुछ है तो और दूसरा प्रेजेंट कर रहा हूँ क्या?
चले सर, हाइपोप्रोलैक्टिनिया में क्या ट्रीटमेंट दे सकते हैं? हाइपोप्रोलैक्टिनिया,
हाइपर और हाइपर प्रोलैक्टिनेमिया में हम लोग सर वी आर कंसंट्रेटिंग ऑन स्तन्य शोधन दशेमनी. ओके, स्तन्य शोधन दशेमनी हम लोग ज्यादा कंसंट्रेट करते हैं मैडम, because स्तन्य शोधन concept is nowhere not much practiced either by gynecological physicians or by pediatric physicians, okay, pediatricians or gynecologists. But I am practicing स्तन्य शोधन in the management of prolactin. This prolactin hormone is related to breast tissue. Okay, then like pata, okay, pata decada. Okay, such concentration, such drugs we are concentrating स्तन्य शोधन along with again depending on the different issues we are going for this one Arogyavardhinivati. Then maximum prolactinemia, it is prescribed on the lines of Avarnavata. That's why we are concentrating Triphala Silajatu.
Yeah.
Like that we are screening the patient. Otherwise into proper hyperprolactinemia is best prescribed or best practiced with Stanna Shodhana, not Stanna Jana, Stanna Shodhana. In that we are considering Pata. In my clinical practice, Pata preparations are best practice.
Yeah, thank you, sir. What will be the treatment oral medicine in hypothyroidism as per Ayurveda?
See, hypothyroidism, it depends on individual physician. The first of all, as we are considering hypothyroidism, it is BMR, basal metabolic rate, decreased basal metabolic rate. So this decreased metabolic rate is compared to Agni. Metabolic rate, basal metabolic rate is compared to Agni. So decreased metabolic rate means decreased Agni. Okay, Agni Mandya. So Agni Mandya, you have to assess either Jatragni Mandya, Dhatagni Mandya, or Bhutagni. Okay, that's why in case of thyroid disorder, you have to concentrate on Dhatwagni Mandyata. Okay, especially now Rasa Dhatwagni Mandyata and Medo Dhatwagni Mandyata. This is the better option. Rasa Dhatwagni Mandyata and Medo Dhatwagni Mandyata. Okay, on that base, it is better to start your treatment with Deepanapachana. Okay, but the effect should be like Chitraka. It is Deepanapachana, but Lekha. That's why. Like that, you have to go on adding your prescription in the management of thyroid disorders. Like you can go for Kanchanara Gugu, Varnadikashaya. Okay. N number of proprietary medicines are there. The approach should be like this. Dhatwagni Mandata, in that Rasa Dhatwagni Mandata, Medo Dhatwagni Mandata. Then you have to assess kapha lakshanas. Okay, raso opishlesh rasa vruddhi lakshanas.
Yeah, yeah.
Because if you screen rasa dushti, rasa pradosha vikara, maximum hypothyroidism symptoms, if you compare hypothyroidism symptoms and rasa pradosha vikara, it looks one and the same. Only the difference is krashangata. Rasa pradosha vikara, krashangata is mentioned, but that krashangata is not in hypothyroidism. That's why rasa pradosha or rasa prasadaja chikitsa along with deepana pachana works better. Okay, then you consider Medo Darpan.
Yeah, yeah, sir. Tapradilo can be used in hypo and hypothyroid.
Now both, madam, because the ingredient of tapadilo is Shilajatu. The beauty of Shilajatu is if you prescribe Shilajatu in low dosage, acts as brahmana. And if you prescribe Shilajatu in a higher dosage, maximum dosage, it acts as a lectin. That's why hyperthyroidism patients are maximum crusher and hypothyroidism stool. That's why in crusher rogi, if you want to prescribe tapadiloa, you prescribe in a lower dosage, regular dosage. Okay. In obese hypothyroidism, tapadiloa you prescribe in a higher dosage. This is my understanding of prescription of tapadiloa.
What about thyroid treatment? Should levothyroxine can be continued?
See, madam, the problem with
Or any Ayurvedic treatment?
Yeah. The problem with adding levothyroxine therapy, it is a rule that if the TSH is more than 10, madam, am I audible?
Yeah, yes, sir. Yeah, you are audible. You are audible. Just be loud. Just be little loud.
If your TSH level is more than 10, okay, then only better to consider levothyroxine. If it is below 10, at that time better to add diet, lifestyle changes along with Ayurveda medication. The problem with thyroid people, hypothyroidism people, if the TSH is 6, 7, they start taking levothyroxine, that is a synthetic supplementation. Then automatically uh, the resistance, they go on suffering with resistance of synthetic hormone. Then after taking 25 mcg, their TSH level remains high. And then they go on increasing the dose. That's why it is a kind request that as in my clinical practice, I never appreciated or never suggested thyroid people or hypothyroidism. If the TSH level is within 10, then I straight away prescribe Ayurveda and we treated with Ayurvedic medication only. Successfully we treated with Ayurvedic medication only. Okay, this is, and the problem is maximum cases are subclinical hypothyroidism. We screen, if you screen in 30-40 cases, maximum people are suffering from subclinical hypothyroidism, not primary hypothyroidism or classical hypothyroidism. See, classical means your T3 should be low, T4 should be low, and TSH should be high. But whenever you screen any patient's thyroid profile report, maximum patients they are having T3 normal, T4 normal, TSH is high. In subclinical hypothyroidism, again we are saying that we consider TSH up to 20. Okay. In a classical hypothyroidism, we are considering TSH up to 10, no medication. We are treated with Ayurveda. In subclinical hypothyroidism, we are considering up to 20 because T3, T4, the most active hormones, they are in a normal places. That's why there is no need of raised TSH.
Can you, sir, just you can you stop sharing so it will be visible all full screen? Stop sharing your PPT so we can lively discuss. Yeah, it's okay now. Yeah. So, what is the best hair rasayana?
What, madam?
Best hair rasayana.
Best hair rasayana?
Yeah.
Kesha rasayana.
Yeah, Kesh rasayana.
Okay. Best Kesha rasayana. See, as we said, Brangaraja, Nilini, it is well known, Madhyantika, it is well known fact. Okay. But in case of thyroidism, we suggest asana as the best case rasana. Asana and Jatamashi. It is
Yeah, one
considered as
question.
the best case. Why
Yeah,
Jatamashi, I will tell you.
yeah,
Okay.
yeah. Okay. Thank you.
See, maximum hypothyroidism patients, they are suffering from raised cortisol level. Madam,
Yeah.
the raised cortisol, this is cortisol is a stress hormone. Okay. This stress hormone, if it go on increasing, okay, automatically the patient starts suffering with nigricans, blackening of the neck, and double chin, hum. These are the few symptoms, signs we are observing. Okay, that is nigricans in nigricans, hump, and double chin. Few opine that it is because of increased cortisol level. Increased cortisol level means it is a type of steroid only, stress hormone. In such, to avoid the stress, we are going for Jyotishmati Rasayana, because Jyotishmati is Ushnavir Pradhana Medya. So Ushnavir Pradhana Medya, it is better to combat or encounter Stulata Kapha as well as Medya. Okay. See, this where if it go, there is an increased cortisol level, in turns increased DHT, as I discussed already. Increased DHT level, increased DHT level end up into alopecia. That's why DH stress related alopecia, at that time Jyotishmati is considered as best Keshara sign. Routine, as a routine, you just go through asana. Asana is considered as a best Keshara sign. Not, I am not considering Brangaraja, Nilini, Madhyantika, Amlaki. Okay, so many routinely practiced, we are not considering in therapist. Madam,
If TSH is normal and suffering from alopecia, what should be the line of treatment?
that's
TSH
why
is
line,
normal. Yeah.
madam. Yeah,
Yeah.
that's why in my in my presentation I mentioned it all depends on yukti and physician's experience. That's why initially I mentioned you can opt nitya shodhana concept. Okay, because alopecia is pitta pradhana त्रिदोष जन्य व्याधि बहुदोषावस्था नित्य शोधन. अगर नित्य शोधन करना चाहते हैं तो आरोग्य वर्ध यूनिवर्सिटी से भी आप नित्य शोधन करवा सकते हैं, because Katukia is one of the ingredient. Okay. The next one I said something about creamy. Okay. So आप क्रीमी कुटार रस भी यूज कर सकते हैं. TSS भी नॉर्मल है तो क्रीमी कुटार रस भी आप यूज कर सकते हैं. बिकॉज वाई क्रीमी कुटार रस, अगर आप क्वेश्चन पूछेंगे तो मलेज क्रीमिस्तान इज केश एंड शोनित क्रीमी प्रभाव इज केशनाशन. ये दो रेफरेंस के बेस पे हम लोग क्रीमी चिकित्सा भी अलोपेशिया में आप ऐड कर सकते हैं. And the third is, that's why I said it is depends on patient's yukti. The third is supplementation of calcium. Why supplementation of calcium? Because हम लोग समझते हैं कि अस्थि धातु क्षय, केश पतन, अस्थि क्षय को हम ऑस्टियोपोरोसिस से कंसिडर करते हैं. ऑस्टियोपोरोसिस में मॉडर्न वाले कैल्शियम देते हैं, वही कैल्शियम को हम आयुर्वेद से देंगे. सो आयुर्वेद से देंगे तो हम लोग सोचते हैं कि चलो शंख भस्म देंगे, कुकुटांड त्वक भस्म देंगे, गोदंती भस्म देंगे. सो कुकुटांड त्वक भस्म अभी दूध पपेश्वर का टैबलेट फॉर्म है, टैबलेट फॉर्म में आ गई. यू कैन प्रिस्क्राइब टैबलेट कुकुटांड त्वक भस्म टू alopecia. This is the third understanding. The first is I said नित्य शोधन से आरोग्य वर्धन यूनिवर्सिटी से करवा लीजिए, नहीं तो कोई किसी और ड्रग से करवा लीजिए. नेक्स्ट कृमि चिकित्सा अडॉप्ट कीजिए. थर्ड, you go for supplementation as per the modern knowledge is concerned. Fourth one is you go for asti prasadaka chikitsa as asti dhatu kshay. You can go for asti srankala, laksha, okay, and babula और अर्जुन ऐसे भी जा सकते हैं. ओके, ये
Yes, sir.
ये रूटीन आप प्रिस्क्राइब कर सकते हैं along with external application. Okay, if TSH is normal, if TSH is above, then I said something else. Other things, many finasteride, alpha reductase inhibitors, serum ferritin, low रसायन, ये सब मैंने बोल दिया, उसको भी आप अडॉप्ट कर सकते हैं, no problem.
Yes, sir. Dr. Rupa Karkhanis is asking about the menopausal age, hypothyroidism and alopecia.
देखिए menopause that because of decreased hormone, okay, there is a bone density कम होते जाता है, बोन से कैल्शियम निकलने लगता है. सो प्री मेनोपॉज और पोस्ट मेनोपॉज में वी आर कॉन्सेंट्रेटिंग ऑन रिच कैल्शियम सप्लीमेंटेशन टू द पेशेंट. अगर रिच कैल्शियम सप्लीमेंटेशन पेशेंट को आप दे रहे हो, ओके, उसी दौरान उस पेशेंट को थायराइडिज्म है, तो मैंने अपने एक स्लाइड में बोला है कि पहले आप पेशेंट का सीरम कैल्शियम चेक करके ले लो. If serum calcium is normal, then only you proceed with calcium supplementation, because parathyroidism, it is related to calcium level, thyroid, parathyroid hormone. That's why precaution लेना चाहिए कि प्री मेनोपॉज हो, पोस्ट मेनोपॉज हो, कैल्शियम सप्लीमेंटेशन से पहले, प्री मेनोपॉज हो, पोस्ट मेनोपॉज हो, वैसे पेशेंट अगर थायराइड है, अगर आप कैल्शियम सप्लीमेंटेशन का सोच रहे हो, तो आपको सीरम कैल्शियम चेक करके बाद में आपको कैल्शियम प्रिपरेशन प्रिस्क्राइब कर सकते हैं.
Okay. Yeah, surely, sir. Thank you. Very great knowledge. So, Dr. Deepak Karasgikar is asking that can we use Laghu Malini Vasant?
In case of alopecia or what?
Yeah, in case of alopecia only. We are discussing
in
alopecia
case of
only.
thyroidism or routinely? In case with respect to thyroidism, Laghu Malini Vasantaras.
Yeah.
Okay. So Laghu Malini Vasantaras, as it is Madhu Malini Vasantaras, it comes under Vasantaras. Okay. Am I right?
Yes, sir. Yes.
Laghu Malini Vasantaras, Madhu Malini Vasantaras, this comes under Vasantarasana. It depicts Vasantarutu, regeneration. Okay. Wherever you need a regeneration phenomena, either internally or externally, it is said that you can go for Vasantarasana. Okay. So Laghu Malini Vasantaras, you can prescribe in hair loss because you have to regrow your hairs. Okay, no problem, you can prescribe, but the preference is as per my because it is Navnita Bhavita Rasayana. Laghu Malini Vasanta and Madhu Malini Vasanta Navnita Bhavana rehta hai. Okay, Navnita, it is Brahmana and Balya. That's why better to prescribe in hyperthyroidism because patient lean rehte hain. Better to prescribe hyperthyroidism patient with alopecia, वैसे में आपको लघु मालिनी वसंत प्रिस्क्राइब कर सकते हैं, और नॉर्मल वेट इंडिविजुअल ओबेज में लघु मालिनी वसंत रस थोड़ा मेरे ख्याल से प्रिस्क्राइब कर सकते हैं, लेकिन नॉट द परत्वम, प्राइमरी नहीं है, सेकेंडरी आप.
Definitely. Yeah. Dr. Sujata Suryavanshi is asking the treatment of alopecia related with obesity and hypothyroidism. If there is obesity and hypothyroidism, what will be the line of treatment?
The maximum hypothyroidism patients are obese only.
Yeah. Yeah, definitely.
Maximum hypothyroidism patients are obese only. Okay. In such cases, obesity, hypothyroidism, and alopecia, the best is you go for asana di kashayam. Okay, asana is kapha medohara and kesha. Okay, then varna di kashayam. Varuna is 5 alpha reductase inhibitors and varna kapha medohara. A simple prescription, or you adopt low abasma is the best lipolytic. Okay, it burns the fat. Best lipolytic drug is लोह भस्म. So लोह रसायन, कोई भी ताप्यादि लोह, शिलाजतु रसायन, हाई डोज ताप्यादि लोह यूज कर सकते हैं. अयस्कृति है, मैंने बोला है आपको, अयस्कृति भी यूज कर सकते हैं आप. और जैसे मैंने लोह रसायन एक्सप्लेन किया, अयस्कृति, असनादि कषायम, वर्णादि कषायम और ताप्यादि लोह हायर डोसेज. आप त्रयूषणादि लोह, ओके, वो भी आप अलोपेशिया, हाइपोथायरायडिज्म, ओबेसिटी. त्रयूषण best for obesity and low supplementation because hypothyroidism patients are more prone for low ferritin level. Okay, you can go for त्रयोशनादि लोह, ताप्यादि लोह, अयस्कृति और असनादि कषायम और वर्णादि कषायम. Okay.
Yes, sir. Dr. Rupa Karkhanes is asking about the diet in hypothyroidism. Diet for
Diet,
hypothyroidism. Yeah.
देखिए हम यूजुअली हाइपोथायरायडिज्म में डाइट लो कैलोरी डाइट, सिंपल लो कैलोरी डाइट एंड अवॉइड ग्वाइट्रोजनस डाइट. ग्वाइट्रोजनस डाइट मींस ये क्रूसीफेरी फैमिली बोल के आता है.
Yeah,
फॉर
yeah.
एग्जांपल क्रूसीफेरी फैमिली आपका ब्रोकोली आ जाता है, आपका गोभी, कैबेज. इन क्रूसीफेरी फैमिली मेंबर्स को हम अवॉइड करते हैं. यूजुअली हम रूटीनली हम सजेस्ट करते हैं कि कैबेज, गोभी एंड ब्रोकोली. इफ यू आर थायराइडिज्म, यू आर हैविंग थायराइडिज्म, अवॉइड करो. देन वन मोर, सोयाबीन. Okay,
Yeah.
soybean also rich in phytoestrogen, but thyroid patient में हम usually सोयाबीन को अवॉइड करने के लिए बोलते हैं. This is, and other than that, as obesity का जो डाइट है, white free diet, okay, white free diet, low calorie diet को हम concentrate करें.
Yes, sir. Yeah, thank you. So, one more question is there. Hyperthyroidism induced irregular menstrual cycle treatment.
बल्य प्रवण, ओके.
झालंय की होतोय का?
आपको क्या है ना, हाइपरथायरायडिज्म में मैडम पेशेंट का क्या रहता है, दे आर हैविंग लो पीएमआई. ओके, am I audible? Am I audible?
Yeah, yeah. Please continue. Just loud, little loud.
Hyperthyroidism patient, maximum hyperthyroidism patient, they are having low BMI. उनका वेट बढ़ता नहीं रहता है और हम लोग उसको ऑन द लाइन्स ऑफ रसक्षय पे लेते हैं. वी हैव टू कंसीडर ऑन द लाइन्स ऑफ रसक्षय लक्षण. रसो अपि रसे रोक्षम श्रमः, शब्द असहिष्णुता, इरिटेबिलिटी ज्यादा रहता है. सब सिम्टम्स सूट नहीं होते, फिर भी हम रसक्षय लक्षण को हम उस पेशेंट को कंसीडर करते हैं. बिकॉज देखिए, यू आर आस्किंग समथिंग अबाउट इरेगुलर मेंसेस.
Yeah, yeah, sir.
That irregular menses is in Ayurveda considered as artava. Artava is considered as upadhatu of rasa dhatu. Okay, जब तक आप रस धातु को ठीक नहीं करते तब तक इरेगुलर मेंसेस कंटिन्यू रहेगा. इसलिए हम लोग रस प्रसाद की चिकित्सा, इट इज बेटर टू कंसंट्रेट इन हाइपरथायरायडिज्म विद रिस्पेक्ट टू इरेगुलर मेंसेस.
Yeah. PCOD with female pattern baldness. Can you tell something about PCOD and female pattern baldness? Dr. Poonam Jagda is asking.
Yeah, madam. PCOD, the another name.
There are so many questions, sir. Yeah, because all are related with the females mostly. Hormonal changes with the age. Yeah.
See, PCOD, madam. PCOD is again insulin. One more synonym of PCOD is insulin resistance disorder. Am I right?
Yeah.
If you go through the synonym of PCOD, it is insulin resistance syndrome. Okay. So insulin resistance means the opposite word of resistance is sensitivity. You have to sensitize the insulin. So here PCOD में अगर आप एंटी डायबिटिक डाइट कंसंट्रेट करेंगे तो डेफिनेटली रिजल्ट बहुत बेहतर रहेगा. बिकॉज जो इंसुलिन इट इज रिलेटेड, दैट्स व्हाई मॉडर्न पीपल जो ड्रग डालते हैं मेटफॉर्मिन फॉर वेट लॉस, दैट मेटफॉर्मिन का आप ओरिजिनलिटी पे जाएंगे तो इट इज अ सेंसिटाइजर. Metformin is pharmacologically considered as सेंसिटाइजर, ओके। वैसे ही हम लोग कफ प्रमेही, ओके, कफज प्रमेय का जो चिकित्सा है, उस चिकित्सा को अगर आप इंसुलिन पीसीओडी में अगर आप अडॉप्ट करेंगे तो डेफिनेटली रिजल्ट आ जाएगा, ओके। Only the thing is, in my clinical practice, we consider two types of PCOD. One lean type and another one is obese type. ओके, ये जो मैं कफज प्रमेय चिकित्सा जो बोल रहा हूँ वो ओबेस टाइप ऑफ पीसीओडी में आप प्रिस्क्राइब कर सकते हैं, ओके। जब भी आप इंसुलिन हार्मोन को सेंसिटिव करेंगे, ऑटोमेटिकली पीसीओडी में आपका अदर रिलेटेड हेयर लॉस जो है, अलोपेशिया, डबल चिन, हिरसुटिज्म, ये सब आपका कंट्रोल में ऑटोमेटिक आ जाएगा, नो प्रॉब्लम।
Yes, sir. Thank you very much. Dr. Krutika Bhanot is asking some question lively. So, Dr. Krutika, please.
Good afternoon, sir.
Good afternoon, madam.
Thank you so much for sharing your valuable knowledge. Thank you, organizers also. So my question is that at the last, we try to treat the patient according to the TSH values or whatever the thyroid profile we are following. What is the best criteria according to you, where you describe that this is the cutoff? Because so many labs are changing the cutoff. In PGI Chandigarh, the cutoff is 4.8, whereas the other labs 5.5. I think we should draw a line according to Ayurveda, sir, where we should clinically diagnose according.
That's why bedside clinical diagnosis is very important. Okay. Nowadays we are giving much more importance to biochemical values.
Yes.
Okay. See.
Similarly, sir, calcium is not needed always because we have seen.
Yeah. That's the problem. If there is a need, that's why you go for serum calcium compulsory. Okay. That's why you have to screen all the details of thyroid for T3, T4, TSH. Maximum people, we do a regular mistake that we only go for TSH.
So people, I mean, I have seen doctors who are treating hypothyroidism just because TSH is 6, whereas it is not needed.
Yeah, that's why I said my limitation. Okay, if the patient is subclinical hypothyroidism, okay,
Yeah.
See,
yeah,
subclinical means T3 is normal, T4 is normal, okay, TSH is high, am I right? High means
Right.
more than 5.
Yeah.
Up to 20, okay, up to TSH 20, I am not considering for modern medication. If the patient is not having any type of symptoms,
Right.
okay, if patient is having symptoms like fatigue, hair loss, excess sleep, etc., at that time I considered up to 50.
So you have also seen, like you said, we are taking these symptoms, but all these symptoms are also related to the stress factor, which is going nowadays, and it is very common also.
That's why see nowadays
clinically, yeah,
that's why I
very
said
typical.
That's why I said you add some Medhadravas to treat thyroidism.
Thank you, sir. Dr. Sangeeta Deshmukh is asking about how to increase Agni in obesity and what is the daily routine in hyperthyroidism for metabolism, better metabolism.
See, hyper means overactive, madam.
Yeah.
Overactive, that's why we ask the patient to take afternoon Divasopna. Okay, Divasopna is the best diet or best lifestyle for hyperthyroidism patient. And Madhur Rasa Pradhana Dravya. Madhur Rasa Pradhana and Snigdha Pradhana Dravyas are best mentioned to hyperthyroidism patient because we have to Lagucha, you just go through the Chikitsa Sutra of Krasha. Gurucha Santarpanam.
Yeah.
Gurucha Santarpanam. Lagucha Apatarpanam. Am I right or not?
Yeah.
Okay. That's why we are suggesting hyperthyroidism patient, although already they are overactive. In such patient, we are asking for Divasapna, we are asking for Madhurasa Pradhana Dravas, we are asking for Guru and Snigdha Pradhana Dravas in their diet. Definitely, it decreases their BMI.
Yeah, Dr. Vasant is asking about the medicine to reduce the weight in obesity.
So there are n number of medication and n number of
definitely.
causes for obesity. Okay,
Yeah.
if it is stress-induced obesity, better to add Ushna Veera Pradhana Medya Dravas. Nowadays, if your stress level go on increasing, serum cortisol level go on increasing. In such cases, better to use Ushna Veera Pradhana. There are two types of Medya Dravas: Shita Veera Pradhana and Ushna Veera Pradhana, according to Veera. And there are two types of Veeras according to Rasa: Tikta Rasa Pradhana Medya Dravas and Madhur Rasa Pradhana Medya Dravas. So, stress-induced obesity, better to concentrate Tikta Katuka Shaya Rasa Pradhana, Ushna Veera Medya Dravas, just like Jatamasi and Tagar. You go for Jatamasi Rasayana and Tagar Rasayana. Even Vacha, only the thing is Vacha excess dosage causes nauseating and nauseating symptoms, vomiting like nauseating symptoms. So if you are using Vacha, dose should be considered.
Yes, sir. Thank you very much. The last question of the session is Dr. Rupali is asking about if all reports are normal and there is a hair loss. So what to do?
Yeah, I already mentioned, madam. All reports are normal. If the hair loss is there, then first you screen the patient's nutritional status. First you screen the patient's nutritional status internally, and next you screen the patient's scalp status, whether the patient is suffering from any issue or what. Okay, if these issues are completely normal, okay, these issues are completely normal, then you go for some krimi chikitsa or calcium sudhavarga chikitsa, or you go for some nitya shodhana, 1 or 2 course of nitya shodhana, or you go for asti prasadaka chikitsa. But all T3, T4, TSH normal, still hair fall is there, better to check the patient's nutritional condition.
Yeah, definitely, sir. So Dr. Sangeeta is asking, definitely. Dr. Sangeeta is asking that many women are suffering from dry skin in thyroid problem. Along with hair, there are also a symptom of dry skin. So what to do with this dry skin in thyroid problem?
Better to dry skin with thyroid problem. We are going for Tikta Rasa Pradhana.
Yeah, Tikta Dipan. Yeah, Tikta Pachan Dipan.
Tikta Rasa Pradhana Gratas.
Yeah.
Okay, Panchatikta Gokul Grata, you just to go through. Otherwise, you don't want to go for Gratas. You are having tablets like Panchatikta Grata Gokul tablet, where it Tikta Rasa controls your clay data of kapha, which is related to Medha or Staula, and Grata regularizes your skin structure, maintains the moisture. That's why Tikta and Grata combination.
Yeah. So there are so many questions regarding. One is asking, Dr. Poonam is asking which shampoo is good for prescribed in this such conditions.
Which shampoo, madam?
Which shampoo is prescribed?
See, that's why initially in my presentation, I think Poonam Jagdash is from KLE, I think so. In my presentation, I said that I never ever used external applications. मैंने कभी एक्सटर्नल एप्लीकेशन इतना मैंने कंसंट्रेट नहीं किया. सिंपल आप स्थानिक अभ्यंग कर लो स्काल्प का टू इम्प्रूव द blood circulation. The motto is to improve the blood circulation. That is enough for hair nutrition, as per my understanding is concerned. Otherwise,
one just last question, sir. One request is there. All reports are normal, and if thalassemia, so tapedilo can we give?
Thalassemia, I don't have that knowledge. Thalassemia, all reports are normal. When you are saying,
Minor. Yeah.
when you
Minor.
are saying all reports are normal, then how?
Which lower can we give? Which lower? Which
When it is, madam, when it is said that all reports are normal, then how come thalassemia? Okay.
Yeah, yeah.
You can Google thalassemia. I think better
Dr.
to
Falguni Thakkar, can you explain what is mean by all reports are normal and patient is thalassemia minor? Yeah, it's okay. Yeah, it's okay. So it's really a good discussion with you, sir. So I think we utilized this time with discussion, and there are so many questions again because the topic is too much interested and related with all endocrinal disorders or all endocrinal glands. So thank you very much, Dr. Arun Chaubule, sir, for this interactive session too. So I welcome now Dr. Nilesh Deshmukh from Transform Clinic, Jalna, Maharashtra, for further session. So Dr. Nilesh is one of my students, as I earlier introduced in yesterday's session, and it's really a proud thing to have a student as a speaker on this platform of Ayush Darpan. So Dr. Nilesh, will you please start your presentation? Please unmute. Unmute yourself.
Yes, yeah. Thank you so much. Thank you so much, Dr. Yerme, madam. And it's a great honor to be on the platform of Ayush Darpan. And thank you for organizing this wonderful webinar. So good afternoon, everyone. I believe yesterday we had a session. Am I audible there?
Yeah, definitely. Just I am sharing your PPT.
Okay.
Okay. Yeah.
All right. So yesterday, due to some technical issues, I was not able to share you the slide presentation for the topic which was there for acne vulgaris. Now I'm going to explain in detail what are the what is.
Is it visible? Is it visible, Dr. Nilesh? Is it visible?
Yes, it's visible. It's visible. Yeah. It's totally visible, ma'am. Thank you so much. So I believe we have discussed about Kshuddha Rogas, and in that acne vulgaris is also one of the issues which has been discussed. The modern aspect of acne vulgaris is been presented over here. And in this, to understand the acne problem, we need to understand what kind of a disorder it is. Yeah. So in this, the particular type of disease what we are discussing is acne vulgaris. It is basically a follicular disorder affecting the susceptible hair follicles, most commonly found on the hair, on the face, neck, and upper trunk. 30 minutes. So it is most commonly encountered skin condition in adolescents and young adults between ages of 12 to 35. Yes. Hello, am I audible, ma'am?
Yeah, please continue. Yeah.
And this in this disorder, both the genders are affected equally, although the onset is early in the girls. So basically, what happens is, due to hormonal changes which are happening in the adolescent ages, the onset of acne is quite earlier in women than men. That is what it says. Now, what is the manifestation of acne? Now, we all know it's a very common disorder, and what presentation it has typically. When it begins with the primary lesions called comedones. So if you have a closed comedone, which is called as whitehead, whitehead is basically the production of sebum, and that sebum is trapped into the skin, and the upper layer of the skin, it actually gets affected because of this. Now, when that comedone, it opens up to the environment, and then there is a formation of a blackish material over there, which is nothing but the debris from the skin, and that is what it goes on to the formation of blackhead. Now there are some pustules, there are some papules which go on when we talk about the grading system of the acne. Ma'am, if you can just go back to the slide, earlier slide.
Is it okay?
The next one. Yes,
Yeah.
sorry. So in when there is a increase in the segments of the debris, and the formation goes on to the inflammation, and this inflammation gets into papule and then pustules when it has been filled with pus pockets and debris. And then finally, you get to get a cyst on the skin side, which is a large pus-filled bump onto the skin, and which is often red in color. And those cysts are basically the bacterial infections, because of the bacterial infections. And these cysts are responsible for formation of the severe form of acne. So these are the manifestations which are generally seen in the acne. Ma'am, on to the next slide, please. Now, the grading system for acne, generally what we do in the clinical practice is we generally keep these grades from 1, ideally from 0 to 4. So in the grade 0, there is nothing, there is just a follicular hyperkeratosis, which is basically the grade 0. Few people even don't consider this into the acne formation, but it's just the beginning of the formation. Hence, it has been, it goes in a simpler words that the person who is having this kind of pimple, small kind of formation onto the skin, that can be graded into 0 category. Then there is a grade 1, the grade 1 and grade 4. This basically are the simple grading systems. They are basically from the, they range from comedons to the highest level, which is the widespread scarring and pustule formation. So if you see in this slide, the grade 1 is basically the comedons and occasional papules. This is the simple grading system, wherein a person is presenting only the comedons, and there is a little bit of papules formation onto the skin that we can term as a grade 1. The grade 2 is the papules, comedons, and few pustules also over there. So pustules are nothing but the pus-filled papules. And papules are generally seen onto the cheeks, then onto the forehead and chin. The presentation typically ranges different in different patients. So few patients will come definitely who will have the papule presentation onto the forehead, and then there will be some comedons onto the cheeks, and then some kind of pustules onto the chin. So it ranges variably. So every grading system which we have over here has got a marking. So if you see 1 to 4 is the commonest practiced grading system. There is another grading system which is called as a global acne grading system. Now this is a little different from what we have in the normal, the common grading system. It's basically the grading system which takes into account the factors like the location of the acne and then the severity value of the acne. So if you see, when you have the acne onto the forehead, there is a factor 2. Where you have a acne onto the cheeks, maybe it's a right cheek or left cheek, there is a factor 2 which is mentioned over here. And on nose, chin, it is 1, and chest and upper back, it is a number 3 factor. So how does it work out? And this is because when you have a factor allocated with the severity. So if you see onto the right side, there is ma'am, the earlier slide, please. Yes, thank you so much. So if you see the severity, if there is no lesion present, the value is 0. Now, what does that mean? If there is no lesion, that means the presentation is not there onto that particular area. If you have got comedons onto some particular area, maybe on a chin, then the value will be 1. If you have papules, the value will be 2. If you have pustules, the value will be 3, and nodules, the value will be 4. Now, this both needs to be combined when we have to have a global acne grading system. So basically, the local score, if you see, it is a multiplication of the factor and grade. So I'll give you an example. If a patient is there who has comedons onto forehead, and then he has got a pustule, just one pustule onto the nose. So according to this grading system, what will be the score for the forehead will be 2 multiplied by 1. So that is the local factor. The local score will be 2 for that particular area. And if he has a pustule onto nose, so that means the score will be 3. 3 into multiplied by 1. So 3, and so the global score which calculated with the summation, with the addition of both the factors. So 3 plus 2 equals to 5. So if you see in grading system, that particular patient will be having milder acne. It's because the grading system says that it is 1 to 18. You have got, if the person is having a score of 1 to 18, it comes into the mild acne form. Now, clinically, if you see this kind of global grading system, it stands a bit backward because we have to have a complete, I would say, that we have to have a complete basis of those acne formation. We need to consider from where the line of treatment should start. So if you have a person who has only this kind of score and the severity of the pustule is more, then we have to use some kind of medication which will definitely attack onto those areas, and it will give the symptomatic, not only the symptomatic relief, but it will also give long-term benefit to the patient. So these are two grading systems which are generally being used in the day-to-day OPD basis. So, ma'am, if you can just move on to the next slide, please. Now, coming to the etiology. The etiology is basically what is the cause of the acne. It can be genetic, it can be hormonal, it can have environmental factors which includes the pollution, which includes the hygiene, proper hygiene, or the how the person is taking care of their entire regime. Whether the person is using cleansing agents to clean their face, whether they are using a shampoo to clean their hair. Dandruff is also one of the cause to get acne, and that is very well seen in the clinical practice that dandruff is also one presentation when it comes to a grade 2 or grade 3 acne. There are cases wherein people are having dandruff and they are being treated for like 2 to 3 years for acne, but still they are not getting the relief because the dandruff is not being treated. So clinical, that kind of manifestations also been seen. Ma'am, if you can just enlarge this slide, I'll be able to see.
Yeah. Just a minute. Yeah, it is okay now.
If you can just make it on slideshow, that will be much better.
Yeah. I just forgot.
Okay.
Yeah.
Thank you so much. Yes. Yeah. So here we have a lot many causes, the causative factors which are responsible for formation of acne. So it is divided into zones of the face. So if you see, there are different zones which have been mentioned over here. So forehead and nose is one zone. Then there is the eyebrow area. There is the cheek. There is the jawline and chin, ears and hairline. Now I'll start with the forehead and the nose area, which is also called as the T-zone. So on T-zone, mostly people come with a problem of excessive oil secretion. So there is a lot of oil which gets secreted onto T-zone and the other skin is normal. Or it is a kind of a skin which has got a combination that the other part of the skin is a bit dry and then the T-zone is quite oily. So this kind of presentation is commonly seen into adolescence, and there are multiple factors which are responsible for this. The presence of oil onto the skin is one of the major cause of formation of acne. And you all know that sebum, the sebaceous gland secretes sebum, and the sebum is getting clogged inside the skin, the upper layer of the skin, and then the formation of acne takes place. So the cause for the T-zone exaggeration into the formation of acne, it can be related to the stress. It can be one of the cause can be improper digestion, irregular sleep, lack of sleep. Insomnia is really a major cause, and that stress which is related to insomnia, lack of sleep, is also one of the causative factors for the acne formation onto the T-zone area. Then poor diet. Now, poor diet implies to various entities over here, because it is not only mean that there is less of protein or there is less of carbohydrates. Mita ahar, what we say in Ayurveda, the mita ahar is basically it involves everything in moderation. So nothing has to be into excessive amount, and nothing should be lesser. So if you correlate with the balanced diet concept, you will definitely understand what that mita ahar is specifically says about. So all the rasas, that mathura, amla, lavan, katu, tikta, kashaya, all these rasas has to be used in moderation. So if somebody is eating more of a tikta or somebody is eating more of a katu, definitely there will be the exaggeration of that particular vyagi in the clinical presentation. So if you consider diet as one of the causative factors, definitely your diet should be balanced. And if the diet is lacking into some nutrients which can cause acne, those diets can be one of the causative factors in the poor diet concept here. Now I'll just go ahead, because the diet is a very large aspect when we consider any formation of a disease. So a balanced diet is very important, and it has to have a green leafy vegetable. The concept has to be really monitored in each case, in each patient, because every patient's diet is different. What they eat and what they are generally taking during their course of their living, it is totally different. So we have to go into final details about asking the typically related to the diet, and then we can understand what kind of a diet is definitely what kind of diet is responsible for formation of this acne. And moving to the next condition, which is hair. If you see the hair condition, that dandruff, which I have already explained, dandruff is also one of the major causative factor, which is clinically manifested in the cases of acne vulgaris. So if a person is having a lot of dandruff, they are prone to get acne, and the acne are more been seen onto the T-zone, particularly onto the forehead and the nose area. There is also a mention of a chemical in the hair care products. Now, basically, hair care products are like shampoos, serums, oils, and there are some kind of creams which people are using nowadays. So that can be one of the causative factor in the formation of acne onto the T-zone. Ma'am, have you moved on to the next screen? Can you please go back onto that causative factor wala screen? Just one more slide, please. Yes. No, yes, this one. So here are more causes. So there are different causes. If you see on the eyebrows area, the hair care products which have been used, then diet is also one of the water intake is also one of the factor wherein you can see there is a presence of acne. You can actually correlate this with the intake or the amount of water what a person is taking during the day. So on an average, a person needs to have almost like 2.5 liters of water in a day. But many people fail to take that much of water. And that can also cause a toxicity in the body, and which comes into in the picture of getting the acne presentation onto that area. On cheeks, yes, nowadays we are having more problems related to the cheeks, and the biggest reason for this is usage of cell phones. Now, it is very well understood that the cell phones, the screen of the cell phones is one of the highest positive factor, even for the transfer of the microorganisms, and the microorganisms which are responsible for causing the acne, they are also being transferred with the help of cell phones. So cell phones, dirty pillows, makeup brushes, these are all the things which are responsible for acne onto the cheek area and the jawline, definitely. And ears, particularly when there is a hormonal imbalance and stress, and there is a bacterial buildup, this can cause acne onto the ears as well. Can we move on to the next slide, please? Thank you. So as I said, the typical presentation of acne, it is on in the form of either whitehead or blackhead. There is a nodule, pustule, and papule. So this can be seen in different variations in different cases. So if a person has got more of whiteheads than the blackheads, then definitely the line of treatment what we will be doing or we will be prescribing will be different than if a person has got pustules and nodules. Next slide, please. Okay, so here I am to just brief about how the protocol will be done with the organic pills. Yesterday I have shown the demonstration of a glycolic acid pill, 25% pill, 25%, and the extent of the acid pills is being used in the not only in the symptomatic relief but also in the structural modification of the acne, particularly when it comes to the cystic or the pustular acne. So on blackheads, we generally use the salicylic acid, can be ranging from 10 to 20%. It can go up to 25% if the severity is more. On the whiteheads, we generally use a glycolic acid pill. A glycolic acid pill is basically a pill which is responsible for cleansing the face. And the pills are, I mean, in detail, if you want to know about the pills, definitely the chemical pills are the organic pills. They are being made from the agents like milk or sugarcane, and these pills are nothing but the acids which are used for the prevention and the treatment protocol of acne. Pustules, we generally go with the masks. If you have got pustule onto some specific area, the mask can work very well onto that, and the mask can range from just a plain hyaluronic acid mask to the extent of wherein there will be a charcoal or there will be a presence of different ingredients which are combined together to get rid of those particular pustules from the area. Papules generally are the reddish in color, and they doesn't contain any kind of pus in it, and they are being treated with niacinamide. And then cystic acne, generally we treat with a combination of salicylic and hyaluronic acid. And hormonal, basically, we generally do a symptomatic treatment in the hormonal acne, and hormonal acne are more seen in women than men because of the early, I mean, if there are early onset of menses, definitely the acne will be presented earlier than the usual age of presentation. But if a person is having a hormonal acne, the line of treatment totally differs because we need to go on to systematic medication as well for that. Move on to the next slide, please, ma'am. Okay, so here I am with the case presentation, and this was one of the cases which we have treated at our clinic. So this patient is 17 years old. coming with a grade 4 acne, cystic nodular, and also had acne scars. Affected areas were cheek, forehead, chin, and upper back. Now, what we have given internally was our Ayurvedic medication, the Mahamanjishta Quad for 15 ml BD, and Guruchadivati twice BD, two tablets BD, and then Gandhak Rasayana 1 BD. And this was maintained for 3 months. And locally, we have done carbon pills. Now, carbon pill is it doesn't come under the regular pills because it's a laser thing. It normalizes the oil secretion, and it also helps in killing the colonies of the bacteria. So it is a device which uses Nd:YAG laser, and the Nd:YAG laser with a wavelength of 1320 nanometers. That I'll explain separately if we get a chance or opportunity to discuss about it. Yes. Then there is a combination of 2 pills which we have done in this particular case. One is salicylic, and then there was a black pill which was used for, which is generally been used for the scars, acne scars, and with 2 weeks interval in between each treatment. So if you see, if you just magnify it a bit, you will be able to see the way the presentation was over there of the acne. There was cystic nodular, and in the 6th sitting, the last sitting which we have done, totally the face is transformed into it's like a new skin, and that is achievable because we have combined the science of modern technology, plus we have combined the internal medication with the help of Ayurveda, so we are able to get that kind of results in this particular case. Ma'am, move on to the next slide, please. Now, this was a case of a female age 23, acne grade 3, predominantly pustular acne, and she had a mild scarring as well. And her affected areas were cheeks, forehead, nose, and chin. So, in this case, we have given her internally Gandhak Rasayana and Mahamanjishta Quad. And then we have done a medifacial for her, which is basically for cleansing the debris of the skin and the upper layer of the skin. And then there were 2 pills which were being used in this case. There was salicylic, and then there was a black pill for the scars. So that concludes the acne topic, which was left over from yesterday's presentation, the live demonstration, I would say. Ma'am, can you just move on to the next one, please?
Yeah, so I have to share today's slide.
Yes, please. Yes, please.
Yeah, okay now?
Yes, ma'am. Thank you. Yes. So as we discussed, today the topic which is given to me is the microneedling for hair loss. Now, microneedling is an advanced procedure. It comes under the cosmetic procedure, and it typically is basically a device which has got some fine needles which goes into the epidermal and epidermal line of the skin and the epidermal layer of the skin, and then it punctures the skin to cause injury. And this procedure is being used worldwide for basically the procedure is meant for in the cases of anti-aging. So it is claimed that this process it actually makes your skin glow, and it makes your fine lines and wrinkles disappear. But recently it has been seen that this also helps in the new hair growth, particularly in alopecia, which is androgenic alopecia and alopecia areata. Now, there are different kinds of alopecia which we deal with, and there the presentation is also being graded, that is into the coming slides. But shortly, I will say that this is it's basically a procedure which involves use of a handheld device with the fine needles, which causes a controlled injury to the skin structure. Now, in the today's topic, we'll be just covering about the scalp skin, because the face it is used for anti-aging effect, and on scalp it is used for regeneration of the new hair follicles. Now, there are still some theories which are still evolving every new day, because this is yet to be justified, or this is yet to be answered, that what exactly is the cause behind getting the new hair follicles. But the accepted theory says that it triggers the growth factors into the scalp cells, and which causes the new hair growth. So, and also it creates it results into the collagen production, and also induces the stem cells, and that causes the hair growth. Next slide, please. Ma'am, next slide, please. Ma'am, can you hear me?
Not moving. Yeah.
Ma'am, can you hear me?
Yes, yes. I am just trying. Why it's not moving? Is it okay now?
Yes, ma'am.
Huh.
Okay, so there are various kinds of devices which have been used, but there are two devices. There are two devices which have generally been used, and those devices are a derma roller and a derma pen. So, what is a derma roller? It's just a handheld device, as you can see in the picture. Now, this particular derma roller, the needle length is 0.5 millimeter, and this can be used in the cases of alopecia areata and androgenic alopecia. Now, there is an advanced device which is called as derma pen, which is used only in the clinics. This derma pen device is a controlled device than the derma roller, because in here you can adjust the length of the needle. Though the needle numbers are lesser, but this can be used in a circular movement, wherein a person can actually, the physician can actually do the control injury onto the targeted areas. It also has got speed control on it, and those speed control can be chosen according to the area of the scalp where we need to do that, and according to the length of the needle which is used. So the adjustment of the needle can be done with the help of the ring which is present in the blue color, and that ring ranges from 0.25 to it goes up to 3. So I have got a derma pen with me over here to just share. I'll just on my video. So the similar device. Yes, ma'am.
Shall I stop sharing?
Yes, yes. I can just show you the device which is here with me.
Yeah,
right
yeah.
now.
Please, you lively show. Yeah.
Yeah, sure. So this is the derma pen. Where is it gone? Yes. So if you can see this device, the similar device which is I have mentioned over there. This is the device which has been used. It has got a cartridge. This is the cartridge which is generally been used. It generally contains 9 to 12 needles in it, and then this particular device is used when you attach the cartridge to the the top of this Darpan. Now, if you can see, there is, I don't know whether you will be able to see the numbers, but there are numbers noted onto this particular ring, and here you can adjust the length of the needle. So in this particular device, it ranges from 0 to, it goes unto 2.5. So that means you need to actually see the extent of that particular needle where it can go. So if for say we are using it particularly on forehead area, so forehead we have to just be cautious because the skin over there is very delicate and soft. For that area, I generally prefer to use it 0.5 to 0.75. But onto the vertex area of the scalp, where you have got if a presentation of alopecia is onto the vertex area, there you can go up to 1.5. You can actually see many videos on YouTube how this device is particularly been used, but there are different physicians and clinicians whose approach is varies as their experiences and their results are different when you use it in that particular manner. Now about this, this is called as Dr. Pen, and this device has got a initiation key, that is the power key over here. So if I press it, it just gets on, and then there is a blinking of this device. So now this is the mode 1. If I just go on to the clicking it twice, then it will trigger faster and faster and faster. And I think that is the last what we can go for this particular device. So this is the device which will be used in today's session, which is called as microneedling. It comes with the attachable battery or detachable battery. Now this battery can be recharged, and once you are okay to start with the session, this device can actually help in getting the controlled injuries onto the targeted area. Ma'am, can we just go back onto the screen, the presentation slide?
I will again share the presentation.
Sure.
It is okay?
So we have, yes. So now this is the worldwide accepted classification of male pattern baldness. So please repeat the needle numbers according to the area of the scalp. Okay, I'll share that when I'm just demonstrating the live on patient, but I will just keep your question noted. So this is the worldwide accepted pattern of the male pattern baldness. Now this is a gender specific classification. There is also a separate classification for female pattern baldness as well, but we are discussing about a male client, hence I am just discussing about this particular classification. Now this is a very typical presentation. If you see on number 1, there is just a receding hairline. There is a U-shape, or you can say a W-shape formation onto the forehead, and then when it goes little behind, it goes into the presentation of a U line over there. That can be termed as a second grade of baldness. Then the extent of it goes into the deeper in the third grade, and then there is also a pattern which is seen, which is called as the vertex presentation. So vertex presentation is, if you can see onto the image which with the number 3, there is thinning of hair from the vertex area as well. So that comes into the complete vertex 3 kind of classification. Then there is a 4th, wherein the receding hairlines are going back towards the vertex area, and in 5th, they are actually meeting each other. And when they meet each other, that means there is only very minimal hair onto the forehead, and the back area is totally, either it is totally gone or it is diffuse hair loss onto that particular vertex area. And in 6th and 7th, those are clinically we cannot actually do the the microneedling processes onto this particular area because they are the people who really need a transplant for hair. They cannot, because the generation of hair follicles will be only possible until the fifth grade, or to, I would say that if there is a diffuse hair loss, or if there is an alopecia areata, wherein you have just a patch of hair fall onto that particular scalp, then we can actually do this microneedling onto that area. I will just move on to the next slide. Yes, thank you so much. So this is the androgenic alopecia when we see in the actual patients. So how does it present? So stage 1, as I said, there is a receding hairline, which cannot be seen in this picture actually. But in the stage 2, now this is the typical presentation of a vertex. Now, if you see in the stage 2, it is actually started diminishing from the vertex area. From stage 3 to stage 5, still there are hair onto the forehead. Still, you can see there is a presentation of there is a presence of the hair onto the forehead area. But on 6th and 7th stage, there are no hair, and the hair are only present in the temporal region. So that means this particular cases we can, if we try, there's nothing harm in doing a microneedling onto that, but the results are not that great in the stage 6 and 7. But up to stage 5, we can actually get fantastic results. I have these slides of the results what we have got in our clinic over here in the next few slides of the presentation. And there you can actually see the visible results of using the microneedling for the hair fall. Now, microneedling, what are the benefits of the microneedling for hair loss? It first gained the popularity as a scar treatment in 1990s because it has started from Western, then it has came down to us, and then it has been studied as a potential alternative or adjunctive treatment for the androgenic alopecia and alopecia areata. Now, there is a difference between alopecia areata and androgenic alopecia, and I think in the earlier sessions, the understanding of alopecia also been clear, but just to explain, androgenic alopecia is basically seen in the men, and it is mostly seen in men. It is not that it is not present in female, but in few cases only it is seen in female. The alopecia which is influenced with the androgenic hormone is called as androgenic alopecia. And the androgenic hormones are the hormones which basically testosterone is the hormone, and that hormone is responsible for the hair loss in the mostly in the middle-aged people. And in alopecia areata, there are patches of hair loss which are being seen onto the scalp area. So in both these cases, microneedling has been very successful. It helps in 3 ways basically. The first one is the collagen production in the skin. Second is it induces the stem cells which are responsible for the new hair growth. And third one, which is the proposed thing, basically that it promotes the absorption of the products used to treat the underlying cause of alopecia. Now, this is it totally depends upon what kind of products we use after the microneedling is being done onto scalp area. So here, generally we use minoxidil as one of the, which is a vasodilator. Minoxidil 5% can be used in men, 2% can be used in women. And there are minoxidil, in market, they are still available in the range of 12.5, or even 15% is also there. But we cannot go beyond 10% because it is not useful to use minoxidil beyond 10%. So maximum limit of minoxidil which can be used is 10%. But generally, we begin with 5% because that shows very fantastic results when we are using it on a regular basis. Ma'am, can we just go on to the next slide, please? Ma'am, am I audible? Yes, thank you so much. So the earlier, sorry, yes. So how does it work? So as I said that the procedure involves using of handheld device, which is either a derma roller or a derma pen, and the needle size ranges from 0.25 to 3 millimeter, roll over the target areas of the in allocated time. So we just do the rolling of the device onto the area, specific area. Particularly when we are doing it in the clinical practice, we apply anesthetic solution almost like 45 minutes prior to the procedure because it causes pain. So when we are putting this device into the skin, it causes pain. So that pain has to be bearable. And we need to be cautious when we are doing it onto the delicate area, like the frontal area of the face, of the head. It is very sensitive because of the sensory nerves presence over there. And hence we have to be cautious when we're using a device. Now there are certain devices which are used at home also, like derma rollers. Now derma rollers are very popular amongst the college going guys because the popularity is very much due to online marketing platforms, and people when they start getting shedding of their hairline, the frontal hairline, the first question comes is Google. So they Google and then just go on doing the test onto themselves with the help of derma rollers, and the lack of knowledge, or I would say there's no enough understanding about these products. They just mess up with their hairline, and it causes long-term problems in their particularly in their growth of the hair. So it's advisable to not to use these devices without getting proper information about this device. And if we're using it in the clinical practice, even in that case also, we have to have a complete thorough knowledge about this particular devices when we're using it on the clients or the patients. Now, how do we do that? Now, there are some techniques which are being used in this. Is the area has target area has to be sterile. It should be used. It should be done with the antiseptic lotion or saline and saline, and then we have to make sure that the area is totally sterile. And when we are using this device, we have to use, we can just use stretch the skin with one hand, and with the other hand, the device can be rolled onto the scalp area. Now, what does it do? It creates small injuries onto the skin, and it provokes the release of the growth factors. And these growth factors are responsible for the stimulation of the follicles, and which in turn promotes the new hair growth. So the question will be how many hair follicles will be activated or how many hair follicles will be generated. Now it is totally dependent on that particular area which we are targeting, because we cannot just go in numbers that how many hair follicles will come out. The nutrition has to be supplied over and again to give a proper kind of I would say the diet to the hair. Now, what is the nutrition? There are so many nutritious solutions are available. Minoxidil is not a nutrition for the hair. Basically, it is just a vasodilator. But what minoxidil does is it increases the supply of the nutrients which we are taking from the food. And if we are combining this treatment with the medicines which we are prescribing, maybe in the form of tablets or maybe in the form of lotions or anything which can be absorbed quickly, it can give you better results. So what in my clinical practice, what I do is I generally use hair tonic, or which we call as a hair combination or cocktail that contains biotin, and there are certain other vitamins in it, and those vitamins are directly been poured, or they are being layered onto the skin of the scalp, and then that can be absorbed easily when we are done with the procedure of microneedling. Can we just go on to the next slide, please? Ma'am, next slide.
Yeah. It's not moving sometimes, so I have to repeatedly share.
There are only 2 or 3 slides left right now. So
Yeah. Yeah, it is okay.
yes. So the actual process can take, it can vary based on the target area, but generally it takes around just less than 20 minutes. And what we do is we generally put up antibiotic ointment or balm post the session to counteract the secondary infection caused by the wounds. Because the wounds are so small, but still they can contaminate, and the wounds can they can flourish into secondary infection. So we have to be cautious when we are doing the microneedling. A topical minoxidil 5% solution can be used post the session immediately, but it causes irritation. So we need to be very cautious while we're using it. Generally, we say that there has to be a gap of either 12 to 24 hours post microneedling if you are having a sensitive skin. But if you're using microneedling at home, the technique is you just do a microneedling once and then use a spray of minoxidil and then again go back and do the microneedling once again at home. That is also been tried worldwide. So these are the things which are important when we are doing a microneedling. So if we're using it, we need to be cautious when we're using minoxidil 5%. But if you're using a hair cocktail, particularly a cocktail which contains biotin and the other multivitamins in it, that can be used directly soon after your microneedling session is over. Move on to the next slide, please, ma'am. Ma'am. Now, what are the side effects? Thank you. So, what are the side effects of this particular treatment? It may cause bruising, redness, and swelling, oozing, and pain as well. Yeah, I got the question. So, I will give you the name of the solution which has been used. So, it's a I'll show you the vial as well when I'm just performing the microneedling over here. There's also a possibility that the wound may develop into scars. So we should not be going so deep into the scalp region. And we need to make sure that the limitations are being there when we are making injuries. Hence, it has to be controlled injury. One should have a proper history of the patient before starting the procedure. I think we have discussed about the procedures which are used, particularly the bleeding disorders. If a person is suffering from some bleeding disorders or delayed wound healing, like which happens in cases of diabetes, so those cases should not be. They shouldn't be a part of the your patients to whom you are performing a microneedling. Secondary infection caused by the unprotected wound can also be a side effect if you are not giving a proper antibiotic coverage post the microneedling session. So we have to give a stronger antibiotic, which can be used for 3 or 5 days, depending upon the intensity of the wounds. So, and then application of a local antibiotic ointment is also advised. Next slide, please. What are the contraindications? If a person has a history of eczema, psoriasis, or any other scalp disorder, if a person is coming with untreated dandruff or seborrheic dermatitis, condition that slows healing like diabetes, as I discussed. Now, in dandruff also, you can do microneedling once the dandruff has been properly cured. But if there is the recurrence of dandruff, if you have done a microneedling, then we should be immediately stopping. We should stop the microneedling onto that particular patient. It may lead to exaggeration of the underlying disease. So if the person is also having some kind of his own blood thinners or similar other medication, they shouldn't be given the microneedling treatment. It is not indicated for pregnant women, and if there is a history of thalassemia, all major and minor. We shouldn't be doing the microneedling in those cases. Next one, please. So what is the post-care? Immediately after microneedling, a protective cap should be provided as the scalp becomes sensitive to sunlight. And if required, a broad spectrum sunlight lotion is advisable. Hat can be also used when a person is going outdoors, because the sun rays can, your scalp becomes basically sensitive to the sunlight. So ideally a sunscreen lotion should be used. No bath should be taken, particularly above the neck region, because water should not be entering the wounds which are being caused because of the needles. So we should be skipping the head bath particularly for 48 hours post the procedure. And no excessive sweat, particularly you shouldn't be doing kind of exercise or something which can cause you sweating, because your scalp is sensitive to everything. Maybe it's a dust or sweat or water or anything because of the wounds over there. So you should be taking antibiotic coverage for minimum of 3 days and maximum up to 5 days, depending upon the wounds which are being created with the microneedling. The next one, please. Now, what is the treatment protocol? Ideally, 6 to 8 sittings are required to see the desired results, and interval between 2 sittings totally depends on the length of the needles used. Now, as I said, the length of needle for the home devices generally 0.25 to 0.5 mm is the advisable. If you are doing it in the clinical practice, we can go from 0.5 up till 2.5, but 2.5 is hardly used because it can damage the follicles of the hair. So we shouldn't be using 2.5. We can go up till 2, but that 2 also has to be used in very rare cases. So 1.5 is the maximum depth of the needle which we can use in the microneedling. And if you're using 1.5 length, then your areas, I mean particularly the length of the treatment or the interval between the 2 sittings can be 2 to 4 weeks. So case-to-case basis, we can do that. Here, what I practice is, if I have used 1.5 millimeters length microneedling, I advise post 4 weeks. And if I have used 1 millimeter, then I advise to go for every 2 weeks. That can be done. So it's simple thumb rule that the greater the length of the needle, the greater should be the interval. So that is how the treatment protocol is there, set for microneedling. Next slide, please. Okay, so I have got fantastic use of, results with the help of the onion juice. I mean, it is on YouTube also, you will see there are people who are just using onion juice and they have got results with the hair gain. Now, hair growth, hair regrowth, and thickening of the hair, these are very different topics altogether. Hair growth is basically related to the length of the hair, which is visible or you encounter within a specific duration. So our hair, they generally grow 1 centimeter in 1 month on an average. So these are basically the scalp hair I'm talking about. And the hair, if you apply the onion juice every fortnight, like every 14 days, so that gives that boost up your hair growth, and it will increase by 0.2 to 0.5 centimeters. It may vary from patient to patient, but it will increase the growth. It will make the hair follicles stimulate faster the growth of the cells of the keratinocytes basically, and your health, the shaft will be longer. So application of onion juice, I've got fantastic results when people are using it thrice in a week, and when there are sessions going on with the microneedling. So what the onion juice does is it is rich in sulfur and zinc, which are the main ingredient of your hair shaft follicles, and it is the cause behind why onion juice is quite effective in the hair regrowth. So one can try it if somebody is having a receding hairline or they are having a lot of hair fall. You can just use the onion juice, apply it, and just leave it for 30 minutes, and then rinse it off with normal lukewarm water or just plain water. And if you do it twice in a week, you can actually see the hair loss is reduced. It's a visible hair loss which you can encounter that it has been reduced. It's also found that the onion juice may help in the collagen production, which in turn helps in the production of the healthy skin and hair. So definitely the zinc and the sulfur, they are the ingredients. What is the experience of onion oil application? Okay, I'll tell you my own experience because I also started getting hair fall, and onion oil, it has helped me, I would say just partially, because onion oil, it cannot go beyond certain barriers. So because juice is watery in nature, and oil has got certain limitations over the juice, because I haven't combined it, particularly in my case, but in patients to whom I have prescribed the onion oil, there are few patients who have got very good results, but few patients who are not so satisfied. But onion juice, it has got really good results, and there is still gray area. Okay, so onion pest, shirolep, yes. Now shirolep and with the help of onion pest, it is really worth, because in shirolepa we are using the same technique. Your onion oil, onion juice, and the onion which has been used in the form of pellets has also got the similar role in formation of the new roots. And I'm getting a lot of questions right now, so I'll definitely answer them, but we have to go one by one. So let me explain what happens when you're applying the onion onto the scalp and to scalp which is having a hair fall. So firstly, in hair fall, definitely you can actually stop the hair fall, or you can reduce the hair fall with the application of the onion juice or onion pest. Both are same actually, because in onion pest also you're putting the same ingredient onto the areas of the scalp, and in the onion juice application it goes the same. Only exceptional factor is that if you have got thicker hair, you should actually go with the onion juice application rather than going for the the pest application, because it may, I mean, the application might be a little difficult when you're applying directly onto the dense hairs. Now, this is the slide which I would like to share. This is the result of 4-month treatment before and after. You can see this is just done with the help of microneedling, and the person was using a minoxidil weekly twice. Okay, which type of onion? Okay, now you get 2 categories of onion, and to be honest with you, I have got very good results with the white onion than the red one. So the white onion which we get in the market, it is more beneficial in controlling the hair fall than the red onion. So maybe we can say the zinc content in white one is larger or greater than the red one. This is a case of 29-year-old showing a diffuse hair loss, and it was treated at our clinic, and he had got a lot of hair fall prior coming to the clinic, and there were multiple factors which are responsible, but it was androgenic alopecia. So in androgenic alopecia, as I said, the role of microneedling is very, very important, and it causes, not only gives the triggering or boosting to the hair follicles, but it also increases the collagen formation, and that collagen formation is also responsible for new hair growth. So this is one of the cases, and particular relation of the onion juice. Okay, yeah, Pitta Prakriti, particularly in the Pitta Jvati, it definitely works better than the Kapaj and Vataj, because if there is a hair loss and you are applying onion onto this, So, okay, so these are the results of 6 months treatment before and after. And that's all for the presentation. I will share the answers and the queries if possible, because I have a very limited time and I have my patients waiting outside. So I cannot give you answers of questions right now, but definitely I will collect all your questions from ma'am, and I will answer all of these queries.
So, shall you go for needling, micro needling procedure?
Yes. So I have got
Yeah,
the.
so it will be better. So
Exactly. So we have got a lesser time, so we'll
Yeah,
just do that.
it's nice
Just allow me.
presentation, Dr. Nilesh. Congratulations. Well going.
Thank you. Thank you so much, ma'am. It's with all your support. Thank you so much.
Thank you. So please continue.
I will just stop the video for a while. Let me take you to the.
Yeah.
Yeah.
Yeah, just
IPD
for 2
area.
minutes. Yeah, 5
Just
minutes.
for 2 minutes. Just 2 minutes.
Yeah, no problem. Yeah, just continue talking. So we will be in touch.
Sure, sure, definitely. I'll do that.
Yeah.
Doctor, yes, we are set to go. Okay, got it.
So Dr. Nilesh is preparing for the live demonstration of microneedling, and I think it will be a really interesting to see lively about microneedling in recent era. All these techniques are used in alopecia or in the treatment of hair losses. So it's really a wonderful session to have a live demonstration of this microneedling procedure, and I really appreciate your efforts, dedication, and I know it's really a task, or it needs efforts to show lively.
A bit more up, or is it okay? Yeah, a bit up. So I am here with my patient, and I'm just making him comfortable on the Dhamma chair. The session will involve usage of ointment. I generally prefer to use Xalogen 5%. And the cleansing, for cleansing of the scalp, we need to use a saline along with betadine. Betadine solution is ideal. And then usage of
Yeah, you
gloves.
can on your video now.
Sure, ma'am. I can.
Yeah. So we can see all the procedure and what are the equipments and what are the materials you are using.
Just 1 second.
Yeah. So I think it's really great. We are going with this international e-conference, which are going or which are it's live on Facebook, and people are watching from all over India and abroad too. So this is Ayush Darpan platform, which is a global platform. Yeah.
So I guess we are able to see.
Yes.
So I'll show you what the things which have been used prior. So I have got this Xalogen jelly. It's a 5% Xalogen, which has been applied almost like 45 minutes prior. 45 minutes prior, I have applied to the scalp of, and then this one is the topical application which I was talking about. Is basically 5% minoxidil, betadine solution, general antiseptic and antibiotic ointment, and then I generally use the red white to take out the application which has been done onto the scalp area. Now, since it is already 45 minutes, I would directly go with the procedure. You can actually use various methods of cleansing the scalp. We can use the betadine, we can use saline mixed with betadine. Direct application of betadine is always preferred because it will not only kill the bacteria, but it will also keep the area sterile. The complete area would be sterile. Am I audible, ma'am? Ma'am, am I audible?
Yes, continue, yes. Audible,
Yeah,
visible.
sure. So I wanted to see to take a closer look at the scalp of the patient.
Yeah, it's visible clearly.
Okay. So if you see, this is a grade 4 alopecia, and it is androgenic alopecia for sure. And we have taken the complete history of the patient, and the patient has started losing his hair from 6 to 7 years. And he has not used any of these ingredients before, but we have done a test of minoxidil. And generally what we need to do is we need to just see whether the person is tolerable, whether he is able to tolerate the minoxidil in the on the skin area. So the test is like a patch test. There shouldn't be any kind of irritation. And to do that test, what you have to do is you can actually use the spray onto the post-temporal area and see if there is any kind of irritation onto that area. So if there is irritation, the person is not eligible to use minoxidil topically. Then we have to think of some other alternatives. But trust me, if a person is not even using a minoxidil, they can still get the results. And the reason behind this is the controlled injury onto the scalp itself is one of the medicines for alopecia. So right now what I'm doing is I'll be just using the needles. There will be a bit of pain when we are doing this to the patient, and to ease the pain we have actually applied the anesthetic solution locally. I'm just trying to adjust the. Okay, so here's the microneedling device, and I'm just keeping the needles onto the very minimal range for the forehead, which is 0.25, and see what is the response of the patient. So let's start with this. Is it painful?
Not
that much. Okay, slightly.
Yeah.
So patient is well tolerating, and we can easily do this procedure onto the frontal area. As I said, the frontal area is more sensitive because of the presence of the nerves. We have to be very gentle. So right now what I'm doing is I'm actually using this device in circular manner onto the area where we want to regenerate the growth of the hair follicles. Is the video visible? Ma'am, am I audible? Can we correlate this with Rakta Mokshana? Okay, so in Rakta Mokshana, yes, we can. We can definitely correlate with this with Rakta Mokshana. But to be honest with you, I haven't tried Rakta Mokshana in cases of androgenic alopecia, but yes, it is more useful, Rakta Mokshana, and that too the leech therapy is more useful in an alopecia areata. So it acts like a local corticosteroid.
alopecia areata. In the cases of alopecia areata, we can use leash therapy, and that works wonderfully. So we have patients treated with the leash therapy, not in this clinic, but in my previous clinic where I used to practice purely on the basis of Ayurvedic medications. So there I have done this, and fantastic results we have got with leash therapy. So Jalauka Charan is really good in alopecia areata, and in androgenic alopecia, this technique, the microneedling technique, is really wonderful. It works very well. So a closer look to the device. Now I'm adjusting from 0.25 to 0.5 when I'm going to the cortex area. Pain ho raha hai? Thoda sa. So now the patient is actually experiencing a bit of pain onto the cortex area. So we need to be very mindful and careful when we're using it on the temporal and frontal area, because it's dense with the nerves. So the nerve supply is really, really higher in that area. So if you see this particular portion, there are very delicate and fine hair. So the hope of getting hair follicles regenerated in this area is higher than this area, because this area, he doesn't have any hair growth. But here, he already has hair. So what I'm doing right now is in circular motions. I'm just using this device. This helps in regeneration of the growth factors. It helps inducing the stem cells, and it also helps in formation of the collagen. So if you see, I don't know whether you will be able to see those fine spots onto the scalp.
Yeah, it's visible. Yeah, yeah.
It's visible.
Very nice.
So
Yeah.
there is a bit of spots.
This view is
spotted
perfect.
bleeding.
This view is perfect. Continue.
Okay. Okay. So I'm just continuing with the treatment over here. Now, as we are going behind, as we are going back, I'm gonna increase the length to 0.75. Now, since this is the first session, I'm not increasing beyond 1, because certain areas of the scalp, they will not be able to tolerate the pain. And when we are doing this particular technique, it can be done in various ways. You can actually do a pinpoint like this. There are doctors who recommend to do it in the pinpoint ways, but it is little painful to the patient. And when we are doing it in a circular fashion, if you have a less hair onto the area, then definitely it doesn't give that much of pain, but it actually works in both the ways. So whichever technique you use, it is good. Now I'm going to just increase the speed of the device. I'm just making it a bit faster, because this area needs to be covered. And now this is the vertex. So in vertex area, the skin is a bit thicker. So I'm going to use 1 millimeter thickness of the needle. Patient might feel a bit of pain. Pain हो रहा है? बहुत कम है ना? Okay. So it's well tolerated by the patient. Hence we are continuing with 1 mm. So our idea is to cover the scalp area, which has got a very less amount of hair. So if you see, even onto the temporal region also, the hair are low. The vertex is the main area where the hair are low. I mean, less in number. I'm not going forward with, to the frontal area with 1 mm because it is, as I said, it is very sensitive. But this entire area, which is onto the sides, the parietal side, this can be covered with 1 mm because even there also the thickness is much higher whenever we compare the skin thickness. So almost we have covered the entire scalp now, except this particular area because I have left it for the last. That is the most painful area, believe me, because people will experience more pain in this frontal area. So I'm just doing that now. So when you have hair which are in good length, and if you're using a derma roller at home, you need to be cautious because now this is not a derma roller. This is a derma pen, and the company is called Dr. Pen. So this device is used in the clinics, and the derma rollers that can be used at home. They generally come in various lengths from 0.25 to it goes until 2.5 mm. So at home, if you wanted to use, you can start with 0.5 and go up to 1.5 maximum. And 1.5, you need to be cautious when we're using. You have to just use only the temporal area. And in the frontal area, you can use up to 1. So those who are having or experiencing shedding of hair from the frontal hairline, it's a better way to go ahead with the derma roller, and that can be used twice in a week. And it's good if you use this along with minoxidil. We can definitely use our Kesha Dravyas. Asti Poshak Vati has got very good results. If you are giving or if you are taking along with this, Asti Poshak Vati can be taken twice. 2 tablets BD or maybe 3 times if you're doing if you're experiencing a very huge amount of hair loss. Preferably, Asti Poshak can be taken with milk because milk can be a better carrier for Asti Poshak Dravyas. And then along with that, if you're using Vatajatadi oil, Vatajatadi has got very good results, particularly in women. If they are using Vatajatadi, they can get denser hair, longer hair, and thicker hair. And it can also stimulate your hair follicles. Also, I have tried in my practice the castor oil. I generally advise people to use the castor oil every fortnight, every 15 days, because castor oil also does the same. It irritates the scalp, and irritation, any kind of irritation, whether it's a mechanical, chemical, or it is with the help of any organic substances, it helps in regeneration of the collagen and formation of the new cells. So stem cells are very important, and we need to do that. Now we are done with the microneedling, particularly over here. Now what we have to do is, I'm just taking the phone aside. Now this area needs to be completely sterile, where before we apply minoxidil, I will not advise him to apply minoxidil directly. We'll wait for 12 hours minimum, and then he can apply it, because this is the first session, and if it is well tolerated, then from next session onwards, we can use the minoxidil directly onto the scalp area soon after the procedure. So right now I'm using antimicrobial ointment. Now the area is completely sterile.
I generally use jet pump to cleanse this because it helps, it goes into the deeper areas and it penetrates. So in my practice, I also use, apart from minoxidil, there is one ingredient, there is one hair tonic which is available with only few chemists. And I would like to show you that. Just allow me a moment. Yes. Oh. So I generally use this hair cocktail. It's called MCCM. It's not Indian made, but trust me, the results are really good. It's from Barcelona, from Spain, and this hair cocktail it has got biotin, pentathenol, and the phenoxyethanol. Now the role of biotin is very crucial in androgenic alopecia, and which any alopecia you can consider because biotin builds up the stem cells of the hair. So we can use the hair regimens which are available in the market, and of course we can add on to our Ayurvedic formulations, which can be used particularly. Onion juice, I haven't tried it soon after because soon after it might irritate the scalp because onion juice contains a lot of zinc and it also contains a lot of sulfur. So we should avoid for the day, and the next day we can ask the patient to use the onion juice if the wound healing is proper. If wound healing is not proper, it's better to wait for at least 3 days post microneedling. But after 3 days, definitely the person can apply onion juice, and it has to be applied only for 30 minutes, and then we just need to rinse off the scalp. So onion juice can be applied, castor oil can be applied. Castor oil also has got very good role in regeneration of the follicles. There are people who also use garlic juice. Now garlic juice is again a controversial thing because garlic it is a bit hot in nature, and the role is the same. But if you see the mechanism is still the same, because in garlic juice also it irritates the scalp, and then again there will be a regeneration. So anything which can irritate the scalp or the cells or stimulate the cells over there, I would prefer more saying stimulating the cells than irritation, because irritation is a mechanical process, but stimulation is internal, the cellular. It goes into the cellular level. So in that case, definitely we can use onion juice, we can use castor oil, and Asiposhak Dravyas and the Godamti Basma, Pravar Basma, they also have a really good role in even Jasad Basma for that matter, because Jasad is zinc. So zinc is the potent, I would say, the cellular building matrix. So we can use the traces of zinc in the medicine. So it can, because your average generally intake of zinc as per RDA is almost 40 milligrams.
but in our preparations, we generally use 200 to 250 milligrams, which is okay. I mean, the excessive of zinc can be excreted through the with the help of urination, so we can use that, but only up to 40 milligrams will be utilized by the body during the day. So we can try different products, and the protocol for this particular therapy is you can do this treatment every minimum 15 days gap has to be there in between two, and maximum we can go up till 4 to 6 weeks, depending upon the length and depth of the needles, the micro needles. I guess I have shared enough about microneedling today. I'll get all your queries from Dr. Shilpa ma'am, and I will try to put it on Excel sheet, and then I will send you the answers of individual queries. So thanks for watching me, and it was really great to see you all over here on this platform. And thank you so much, organizers, especially Shilpa ma'am. Without you, it wouldn't have been possible. And I'm glad that I met all of you. And we'll keep in touch for future. If you have got any kind of queries, and definitely I'm going to answer all those queries shortly. But I have restriction of time. There are a couple of patients who are waiting for me.
Yeah, really.
So,
thank you very much, Dr. Nilesh. It's really nice and wonderful to be with you with live demonstration. I have said that it really needs great efforts. So really, thank you very much for your time, everything. So Dr. Naveen Joshi sir, are you there?
Thank you so much.
Yeah. Dr. Naveen Joshi sir, are you there? So moving further with our next speaker, so I warm-heartedly welcome our next speaker, Dr. Nirmala Suwal from Nepal. So I think Dr. Nirmala is one of the great viewer of this Ayush Darpan, and we are missing nowadays. I think she is busy in practicing trichology and cosmetology. So she is one of the favorite viewer of this Ayush Darpan and the great Vaidya practicing in Kathmandu, Nepal. I request Dr. Joshi sir to introduce Dr. Nirmala madam. Dr. Joshi sir, are you there? Dr. Naveen Joshi sir? So Dr. Nirmala Suwal is the Dr. Nirmala madam is from Kathmandu, Nepal, and she has completed her BMS from Nepal also, and in this Tribhuvan University of Nepal, and now she is practicing there Kundalini and Triphala Ayurveda clinic. She has been working in this health and wellness field from last 10 years, and she chose this preventive aspect of Ayurveda with relationship of healthy food and lifestyle. She started her career from the health and wellness hospitality of. So I think we are here with Dr. Nirmala Suwal madam, who is practicing for female wellness in various ways. So I heartily welcome Dr. Nirmala Suwal madam on this platform of Ayush Darpan, and I request madam to start the session. Unmute madam.
Namaste.
Yeah, namaste.
Namaste. Myself, Dr. Nirmala Suwal from Kathmandu, Nepal, the country of Himalaya. So I'm very glad to be here on the international platform, from being the best viewer and again to the speaker. So I would like to thank our Naveen Joshi sir, Ayush Darpan team, of course, Shilpa madam, my guru, Dr. Sivananda Patil sir, and the most favorite Dr. Uma Shankar Nigam sir, by listening to whom I am always inspired to practice more and more on Ayurveda. So here for today, I am going to talk about the hair spa. So I have been in this wellness field for last 10 years. So many therapies I have introduced, and along with that, some Ayurveda production I have introduced. So we will be talking about that. So shall I continue? Shall I start the
Continue.
screen sharing, ma'am?
Yeah, please. Yeah.
Is it visible, ma'am?
Yeah. It's visible. Just make it full screen.
Okay, ma'am. So let's know about the some history about the hair treatment. So Ayurveda text reveals that during the Vedic period, women used to oil their hair with the coconut oils, which is scented with the jasmine, rose, and sandalwood. But nowadays, we love to have the dry hair without the oils, and we love to visit the parlors and the hair treatment done in the parlor. But these treatments all are full with the chemicals which are damaging our hair, scalp, and the body. So mainly in the parlors, ammonia, bleaching agents, and some keratins are being used, widely used. But these parlors or the parlor treatment, or let's say the modern hair treatment, they have never forget to mention or give the tag herbal or Ayurvedic for their process. So let's know what are the common treatments done in the parlor for the name of herbal hair treatment. So mainly they do the bleaching. So bleaching, it is used to take out the original color or pigment out of the hair. So this bleaching, it changes the color, the structure of the hair, making it weaker and resulting in breaking of the hair, and hairs also falls out very easily. So the second very common treatment done in the parlor is highlight or semi-permanent dyes. So to make the color or to make different types of hair color, we use the semi-permanent dyes or different dyes. So it helps to change the internal structure of our hair. Then palms are also very widely used. So these are very harsh chemicals. So this weaken the hair, and it also dry, dull, and makes the hair very weak over the time. Again, during the parlor hair spa, we do the curling. So in the curling, so irons or blow dry processes are used. It helps to dry the hair. Sometimes it can also bond the hair along with the hair follicle. So it may give the irreversible damage to the hair and our look. Again, every kind of heat applied to the hair will temporarily damage the hydrogen bonds, which bind the our hair together, and it will weaken and it will helps in the dullness of the hair or the falling of the hair. So let's know what are the hair spa. So actually this hair spa is combination of some Ayurvedic therapies which we use in our Ayurvedic practice in Delhi. So in our day-to-day practice. So let's know what are the hair spa and what are its important. So mainly the hair spa, it is necessary to maintain our hair health. It prevents our hair from falling, graying, and thinning. Again, this hair spa, it strengthens the hair follicles, it recovers the hair damage, and then it is also required to maintain the oil balance in our scalp and in our uh, hair follicles. So this hair spa, it helps to remove the impurities from the scalp and the hair roots. Again, it helps to boost the blood circulation and reduce the stress. And finally, it helps to maintain the natural color of our hair. So let's know what are the steps of the hair spa. So the first one is the Zero Ovenga. So we are very familiar with the Zero Ovenga, then Zero Pichu, scientific combing. This can be very new to our fraternity. Then the Zero Swedana, Talam, Tala Podichila, Kesa Dupana, and Kesa Prakshalana. So let's know about this in details. So Siro Ovenga. So Siro Ovenga is very famous in our day-to-day practice, and even for many types of diseases, we use this Siro Ovenga for insomnia or for any type of hair fall or mental stress. We use Siro Ovenga with coconut oil or with sesame oil or any kind of herbal oil. So let's know in detail what is Siro Ovenga for the hair spa. So generally, this is the application of oil over the scalp region, followed by the massage in specific manner. So it helps to stimulate the murmur points on the on our head and the scalp, and some of the strokes can be used over here. So like the Garsana Hasta hand picking strokes, or flat palm strokes, finger strokes, or pressing can be done. And another important thing is in head massage or Shiro Ovyanga, we need to do the air massage also. So the importance of the Shiro Ovyanga is it prevents the baldness, the early graying of the hair and the falling of hair. So that means we are supposed to do, or we need to do the Shiro Ovyanga on our regular basis. Then it helps to strengthen the hair roots, and the person will get good sleep and balanced mental status due to the Shiro Ovyanga. That means, so many of the former speakers, they have mentioned that the sleep and the mental status is the main cause for the hair fall. So for maintaining the sleep and good mental or balanced state, we need to do Shiro Ovyanga on regular basis. So let's know about the therapeutic effects of Shiro Ovyanga. Shiro Sulam na jayate. That means it prevents and cures the headache due to different causes. So when we do the Shiro Ovyanga, so our first benefit will be headache. So if there is patient of headache or migraine, so we prescribe this Shiro Ovyanga. So from today point of view, the trichology point of view, so mainly the therapeutic effects are no khalitem. That means the Shiro Ovyanga prevents and cures the baldness. Drita Mulam Dirga Krishna Kesa. So that means desirable in person who wish to have firm, long, and dark hair. So when we define the beautiful woman, so long dark hair is also the term used for the beautiful woman. So to make the long form and dark hair, Shiro Ovyanga is required. Then another therapeutic effects is na palitam. That means Shiro Ovyanga prevents and cures premature graying of hair. So the premature graying of hair, the graying of hair is very burning issue, alarming issue nowadays due to our lifestyle, due to our work habit, and of course due to the stress in our lockdown also. So this pallidum or the premature graying of hair has become a very important issue, very important problem. Then another point is not kesa prapanticha. So that means it is very effective in curing the hair fall, any kind of hair fall. Then nindra laba, it induces the sleep. So sleep being the very important factor of our life, and even for our hair and skin practice, this nindra lava is very important. Then it cures the dryness of the scalp, cleans the hair and cures the itching problem of the hair, including that many types of dermatitis or skin problem can be also cured by this Shiro Ovyanga. So let's know about the oils used accordingly. So for any kind of hair fall like the alopecia areata or this telogen effluvium, we can use the different types of hair oil like the Yastimadu Taila, the Bringaras Taila, the Nili Bringaras Taila, it can be used. And then another important problem is the dandruff. So in every 3% among 5% has this dandruff problem. So either it can be the dry dandruff or it can be the wet dandruff. So this dandruff problem is very common. So we can use the Nalapramadi oil, or we can use the Eladi oil, or this Durdur Patradi tel, or this Trifala tel can be used. So here this Durdur Patradi tel is very effective, and this the main constituent over here is the Dhatur, which is antifungal and which is very vasodilation in action. So another thing is for graying of hair, we can use this the Proponda Karaki tail or the Nili Bringaraj tail or the marigold tail. So marigold tail, or I think it is called genda full in Hindi. So this oil is also very effective in the hair fall. So now I'm going to present the process of this Siro Ovenga. Put the oil over the scalp region by the help of this cotton very slowly, and we will be using very different kinds of strokes so that the oil can enter inside the hair follicle. So now we have to keep the normal point here. So the normal point will be on the forehead. Like this. This will be the normal point. We call it one another. From here, this point we have to go 2 finger forward and 2 finger backward. So at this point, we are getting some pressure, gentle pressure. The normal point. And release. Again, the back point of the normal, gentle pressure, and release. Gentle pressure, release. So this step we will do it for 5 times. Gentle pressure, release. Gentle pressure, release. So this part is called Mahara. So now we do the partition again.
Your mic is muted. Dr. Nirmala, your mic is muted.
Ma'am?
Yeah.
So about the, I was talking about the seropichu. So the mode of seropichu will be the sneha of seropichu will be absorbed systematically by our central nervous system, and this seropichu, it has effects on the master gland, the pituitary gland, and the hypothalamus gland, which is associated with the many physical and mental functions. And then it revitalizes the CNS by enhancing the blood supply and nutrition of the nutrition to the brain, so that it will help in the hair fall or graying of the hair problem. Ma'am, can you hear me?
Yeah. Please just be little loud.
Okay,
just little.
So for the seropichu process, the patient is made to sit comfortably in the chair. Then, so you could see the process in this picture. So the patient is made to sit in the comfortable chair. Then we have to tie a cotton cloth over the ear on the forehead, so that the oil doesn't drop out. Then we have to take cotton swab, which is jacketed by the gauze. So it should be like the size should be like the 16 centimeter into 16 centimeter. Then we are supposed to take the required oil according to the condition of the patient. Then we can pour the oil from above. So the cotton pad, the gauze pad or the cotton pad should be on the vortex of the head, so that we can apply the oil over it. So here is the video for that. So we can help this picture for 30 to 45 minutes. So during the time, the patient can take proper rest by sitting in the chair. So this picture is very good nutrition for the hair, any kind of hair problem, or if there is headache, any insomnia problem, or any problem with the nerve or paralytic problem, the seropichu help. But generally, in the hair spa, we perform the seropichu for the better nutrition of the hair and preventing from the graying of the hair. So we just watched about the video regarding the seropichu. Now let's know about the scientific combing. So scientific combing is a very simple way of combing our hair to make it stronger and healthier. So generally we use different types of combs. So especially we use the plastic combs to comb our hair. And nowadays it is also seen that it is also observed that many of us, they don't comb the hair, or even the males, they don't get proper time to comb and to take proper care of hair, which is also a cause of the hair fall and graying of hair. So by doing the hair combing, we can do the proper vasodilation. That means the blood flows vigorously under our scalp, and it will give the good nutrition to our hair follicle. So we are supposed to do the proper combing every day. So let's know what is the scientific combing. So it is just a way of combing the hair to make it stronger and healthier. So what we have to do, so we have to take a comb which is made up of natural or organic, like it can be the nimbato comb, or it can be bamboo comb. So in Nepal we can find both the nimbato comb or the bamboo comb. So it can be used. So you have to hold the comb and you have to just comb from the front of the forehead. So 5 times like that. 1, 2, 3, 4, 5. So you have to address each and hair, and again from the left to right you have to take 5 times, and right to left, you have to take the 5 times. So it will help in the vigorous blood circulation in our scalp and helps to maintain the health of the hair by maintaining the strong hair follicle. So I will show in the video more about this. So now the third step of our hair spa will be the scientific combing. So in ancient time, we used to use the comb made up of the neem or from the bamboo. Okay? So that will be very organic and very natural. So in scientific combing, we are supposed to comb the hair from front to back for 5 times, and from left to right and right to left for 5 times. Okay, so this is the proper way of the scientific combing. We have to just put the mild pressure. So every hair you should address and comb properly. So the patient will feel the proper pressure. He will feel the blood flow inside the scalp. So then from right to left. So in case of female, we have to manage the hair. Okay. So it will be like this. 4, 5. 1, 2, 3, 4, 5. I hope my person is covering the field. Then from left to right again. 1, 2, 3, 4, 5. So we were watching the scientific combing. So we can comb our hair from front to back, and again from the back to front, also from right to left or left to right 5 times. So it can be done on daily basis as well. So now let's know about the fourth step, that will be the Kesa Swedana. So Swedana process we do in the form of Nadi Swedana, or in different types of Swedana on daily basis in our patient of the Vaman Virejan and the Vasti. So here we are doing it for our hair. So the Kesa Swedana. So some cassia herbs, just like the Triphala, Yastimadu, Nimba, Vringaraj, many herbs can be mixed together in certain amount of water. Just like here I use this Triphala, Yastimadu, Nimba in 4 liters of water, and I made a decoction. So in that decoction, we can just soak the towel, the head towel, and it can be soaked well and wrap around our hair and the scalp after this scientific combing. So this towel, this hot towel can be used for 3 to 4 minutes. So these all the herbs which I have used, these are antibacterial and antifungal in action, which will help to take out the fungal infection like the dandruff in our hair and in our scalp. So it will be very good to open the pores. So the Swedana process will help to open the pore of our hair and and the scalp, and it will make a proper medium to enter the essence of the oil and herbal paste inside the hair follicle. So actually it is very soothing to the hair and the scalp, and also this Kesa Swedana, it helps to relieve the increased vata and kapha. So now this is the process of Swedana. We are going to give Swedana to the hair. So this step is so this is our step for the Kesa Swedana or Swedana. So I have soaked this towel in the decoction of the herbs. So this is very soothing very warm therapy. So it will help to open the pores of the scalp and help to enter the essence of the herbs and oil into the hair follicles. Thank you. So after this Swedana, give Swedana. Thank you. We are going to. So after the Swedana, the Talam process will follow. So the Talam process is the simple process of application of the medicated paste over the scalp for the specific period of time. So according to the condition of the our hair pathology, we can use it for 45 minutes to 90 minutes. So the general indications for this Talam process are the hair fall, graying of hairs, dandruff, headache and migraines, any kinds of skin disease related to the scalp. And the main thing we have to look after is the contraindication. So any common cold period or the acute asthma period or fever period, we are not supposed to do this Talam process. So in the Talam process also, the patient is made comfortable to sit down in a chair. Then we can so the mixer, the paste is made from the different varieties of the cassia herbs according to the condition. Then we can mix that paste with the buttermilk. So the paste can be applied over the vertex of the head. So it should be about 3 to 5 centimeter thick. While doing the process, we can also gently massage the body to make the patient more comfortable towards the therapy. So after certain period of time, after the 30 minutes, we can remove the paste from the head and rub in the vortex with a dry cloth. So here we can use different varieties of cassia herbs like the mandista, sariva, yestimadu, triphala, neem, currants, amlaki churna. So they can all be mixed together with the buttermilk. So here now I am going to show the process of sirotalam. Fifth step of our hair spa will be the application of the paste, that is the talam process. So here I have taken the powders of the triphala, nimba, estimadu, ringaraj, manjista, musta. So all these herbs have been mixed with the buttermilk. So this will help to nourish the hair from the root level. So we need to apply this talam paste over the vertex of the scalp. So we have to make it thick, around 2 to 3 centimeter thick, and the patient can hold it for 30 to 45 minutes. It should be lukewarm so that the patient can wear it for a longer time. Thank you. Fifth step. So now another step is the Talab potential. So this is also similar to the Talab process. So the difference over here is, so we apply the medicated paste over the head, but it should be covered with the aranda leaf or lotus leaf. But in the middle of the vortex, we won't be applying the paste. We will apply the oil, medicated oil over the vortex. So the materials intake should be just like the Talam process. So here the main process includes we will be applying the mixture on the scalp initially on the front part, the right and the left part, leaving a small central portion. So the small central portion we will leave there. So in that area we will be pouring the warm medicated oil in the central portion. Then we will place the aranda leaf or the padma leaf over the paste so that it can fully cover the head except the center. So after this process, we can completely remove the paste from the head and rub over the vortex with a dry cloth. So after this process, the patient should avoid sitting on the fan or AC or the place where there is the movement of air, breezy air, and cold environment should be avoided. So now the final process will be the Kesa Dhupana. So the Kesa Dhupana process, so here we will be fumigating the required herbs over the hair. So here the Kesha process, it will help to prevent the fungal infection over the scalp due to the over oiling or due to the hyperactive sebaceous gland. So during the daily oiling process, or some people, especially the cough personality, they have the oily hair. So if the oil remains for a longer time, then it can induce the fungal infection. So it will be better if that type of personality or who have the oily hair, they can do Kesha on regular basis to prevent the fungal infection. So by this Kesha process, the hair cuticle becomes fungus free. It also prevents the dandruff. So here, what we can do is we have to take the Dhupan yantra and we can put the powder of Triphala churna, Yastimadu churna over the Dhupan yantra and burn it properly. When we can see the fumes, we can apply over, or we can just roll around the hair and the hair follicles. So it is also mentioned that in our Samhitas, cow dung has also been mentioned. So by burning and fumigating the cow dung also, we can make our hair fungal free or dandruff free. So here now I'm going to show the process of Kesa Dhupana. So now our step will be the Kesa Dhupana. So here we will give Dhupana or fumigation to our hair. So if there is any oil content, so this oil content can create some fungus infection. So this fumigation or the Kesa Dhupana will help to take out that fungal infection. So we have to mix different varieties of herbs according to our situation. So here my patient, she has some problem of the thinning of hair. So I have used the herb Yastimadu, Triphala, Ringaras, Musta, etc. So we watched about the Kesa Dhupana process. So the final one is the Kesa Prakshalan. So Kesa Prakshalan is simply the washing of the hair by the herbal decoction. So what we can do is we can take some Kesha herbs like the Amala, Sikakai, Triphala, Yastimadu, Musta. It should be taken in equal quantity, but the Rita should be taken in very less quantity, because Rita, it can irritate our cuticle. So we have to make the decoction of this all herbal powder, and from this decoction we can wash our hair properly. So the thing here is that this herbal decoction, it can act like the cleansing medium to clear our to clear and make clean our hair. So we can use it on daily basis also. So here the thing is that we can instead of daily using this shampoos and other conditions, if we become able to use this type of herbal decoction, then there will be decrease in there will be vast decrease in the problem of hair or graying of hair or baldness that can be seen. So this process will help to give the proper nutrition to the scalp and the cuticle also, and it will make a proper environment to grow the hair, because most of the time when we look the hair fall patient or bald patient, most of the them are they have the problem of the shampoo or any type of the hair formula like the spray or the gels. So they are creating some problem with the hair, with our hair health. So it's better to do the Kesa Prakshalana by this herbal decoction, and it will help to make the hair live again. So this type of this process, this hair spa, it will, if we can conduct it in a time basis, it will help to maintain our proper health, so that proper health of the hair, so that we won't be we won't have the problem of hair fall or baldness or graying of the hair. So instead of visiting the parlors or the spa parlors, it's better to do this type of herbal hair spa in the Ayurvedic clinics or Ayurvedic spa. So now I'm going to show the Kesa Prakshalan. So now our final step will be the Shira Prakshalan. So here I have made the decoction of different.
Dr. Nirmala, can you please explain the procedure lively? So it will be more interactive.
Herbs, including Triphala, Mahabringaraj, Amala.
Dr. Nirmala?
Yes, ma'am.
Yeah, just lively, you can explain.
This process.
Yeah. So it will be more informative, as the voice is very less.
Okay, ma'am. So here in this process, I have taken the decoction of Triphala and Estimadu. So I will give this decoction to the guest to wash the hair properly.
What is this solution?
So this is the decoction of the Triphala and Estimadu. So this I have given to the patient to wash the hair.
Yeah, it is in Kwatha type, Kada type.
Yes, this is decoction. Yes, this is quarter of Yestimadu and Triphala. So this is
in which proportion? In which proportion?
So same quantity, ma'am. So I am using this formulation instead of this shampoo and other hair cleanser. So it can it has very good results in the hair fall patient.
Yeah, how many times we can follow this procedure in a month?
So so it can be done, it can be followed 2 times a week, ma'am. 2 times a week.
Yeah, it's very nice, really interesting.
So now we are going to talk about some culprits used for the hair fall. So my previous speakers, senior speakers, they have already mentioned about these things. So I won't be going in detail. So here, what are the herbs used for the thickness of the hair? So we can use Amala, Kumari, Bringaraj, Narikel, Haridra, Musta, Yestimadu. So it can be taken in the form of the hair shampoo, or it can be taken as the decoction for washing the hair, or it can be taken for making the hair oil or any type of creams or gels. And then for any type of alopecia, we can use the dhatur seeds, gunja seeds, bringaraj flower and seeds, ginger rhizome, kumari pulpa, nimba bark or nimba tok, and then the onion seeds or rosin that can be used for the any type of alopecia. Then for the complete baldness, we can use the onion juice, ginger, rosin, nimba, kumari gel. So these all the formulations, so the herbs we are using in our clinic in day-to-day practice for in the trichology. And then for the graying of hair, we can use the dhatur, haridra, parpat bees, chandana, japa, mandista, nilini, bringaraj. And then for dandruff, we can use the nirgundi patra, mustamul, dhatur seeds and leaves, currants fala, nimbatok, bringaraj leaves, haridra kanda, and the triphala. So this can be used, so all these herbs can be used in the form of the decoction for prakshalan, or in the form of the paste for the talam, or for the potichil, or it can be also used as decoction for washing the hair properly on the time to time to do the hair spa on our own. So now here I will be talking about some important here, how to analyze our hair from the Vata, Pitta, Kapha, or from the basic physiology of Ayurveda. So generally 3 types of hair has been described in Ayurveda. So the Vata hair, Pitta hair, and Kapha hair. So how to identify these 3 types of hair? So the vata hair, they are relatively very thin type of hair. So from the picture, you could see very relatively thin type of hair. It can be curly or it can be straight also. It grows very quickly, but it's very frizzy and it's very difficult to manage. That is the vata hair. So when the vata hair or vata person gets out of balance, so the hair will be dry, frizzy, brittle, and lustrous, and the hair thins and falls very easily, and the hairs also become very shorter. So it is very difficult to grow out. There will be, we can see the splits in very easily. So most of the females, they suffer from the hair loss and the splitting of the hair. So it can be due to the imbalance of vata also. So how do we manage this vata hair? So main vata means so dryness. So for dryness, we have to do oleation. So we can apply different varieties of oil according to the condition. And with the oil, we can use some herbs like the palandu, the kunja, yastimadu, devdaru, Krishnatila, Saidayak, Ashwagandha, Satavari. So these herbs, these cassia herbs can be used in the form of the decoction for prakshalan or for talam or dhupan. So in different forms we can use. Then let's know about the pitta type here. So from the picture, you could know the pitta personality. They have very soft, straight, or very predictable, easily manageable type of hair. So they are very moderate in thickness and they have very fine, very beautiful hair. But the problem with the pitta hair, or when the pitta is out of balance, they have the problem of premature graying of hair or falling of hair is very common in them. So the excess heat in the hair follicle can damage the hair. So baldness, graying is very common in pitta type of personality. So how to balance this pitta hair? So we can use yasti madhu, japa, kamal, nimba, lodra, currants in different types of our hair spa process. Then about the copper hair. So how can we identify the copper hair? So from the picture, you could see the very healthy blackish color, very lustrous type of very thick copper hair. So this is the typical copper hair. So when there is excess of copper or imbalanced copper, so mainly there will be the oiliness of hair will be seen, heaviness and thickness in the hair will be seen. So most of some of the female, they also complain about the oily hair. So this oily hair can be the copper hair as well, the imbalanced copper hair. So in our hair spa, we could use the different herbs like the gunja, grapeseed, kusta, methi, kapura, Jyotismati or Devdaru in the form of different process of our hair spa. In this way, we can treat this Vata, Pitta, Kapha hair in a proper, we can treat and we can keep the varieties of hair in a proper condition. Thank you. Ma'am?
Yeah. Uh,
So I finished here, ma'am.
Yeah. Thank you very much, Dr. Nirmala. It was really beautiful presentation. So you are really going great with your Triphala and Kundalini. You are the owner of these firms. So really great. I think Ayurveda has a lots of things. We forget about such things like very simple things, combing and dhupana. But I really say thank you for reminding us such beautiful things we can do easily at our home. We always go for something fancy in beauty clinics. I think it's really great to have such simple remedies which are practiced from the ancient beauties like Ranis and Maharajas. They used to do such type of procedures. And I really think that today also we have to use such type of some procedures in our day-to-day life. So really, it's a great presentation. Thank you very much, Dr. Nirmala. Thank you.
So much, ma'am. Thank you.
Next, moving further with this webinar, and today's our last session is of Dr. Harish Patankar sir. Once again, I welcome Dr. Patankar sir on this platform of Ayush Darpan. And we have recently a course. We have yesterday we have launched this course and notification on our platform, and it's really a great pleasure to have once again Dr. Harish Patankar sir. So without wasting much time, as sir is busy and he's traveling, but thank you very much for making it possible. So thank you, sir. So continue with your session.
Yes, thank you. Thank you very much, madam. And thank you, Nirmala ji. It was a very nice session by you. Okay, so I'm just sharing my screen. Is it visible to all? Let me know, please.
Yes, sir. Just make it full screen. Is it visible? It is visible.
Yes. Yeah. Okay. So welcome all. Ayush Darpan, myself, Dr. Harish Patankar, Director of Kesha Ayurved, Smriti Ayurved, and Kaya Ayurved India. So maybe due to traveling today, you may feel some connection issue, but I think all of you will enjoy the lecture. Okay, so that's why I will directly start today's. As all of you know, in this era, hair and skin diseases in increasing ratio. If you just want to practice on skin and hair only, you can practice out. Skin is the first organ of our body, as you know, and hair is the largest attraction, we will say, rather in all the youngsters, even in from childhood to up to the last, because everyone want a beautiful hair. If you just on the TV, you will see the 70% advertisements are on hair and skin related products only. So almost 70% advertisements. So in business also, you will get the 70% in your clinic from skin and hair related. And Ayurveda have the beautiful solution for all the skin and hair diseases. So we should move towards Ayurveda for this all the solutions. So whenever you are going to think about the Ayurveda for the skin and hair diseases, I have already told you in Ayurveda, don't think there are only 5 types of hair diseases. Yeah, I know. In Ayurveda, explain only Kalitya, Palitya, and Lupta as a 5 hair diseases. But with the sutras of Ayurveda, with the texts of Samhita, by making the Sutra Vistar, you can elaborate this topic to a big grantha. That's why a grantha of Kesha Ayurveda is created with the Sutra Vistar of the shlokas given in Sutra Sthan. This is very important for our diagnostic and treatment validation. Systematic Granthota approach is very much necessary for this. Always remember, Ayurveda have given us a Trisutri, Hetu Linga Aushadha Jnanam Swastadur Pranam, Trisutram Shashwatam Punyam Bhugdeyam Pitama. Yesterday already I have told you this Trisutri, so never forget it. Yesterday I have told you 3 plus 7 plus 3 plus 5 plus 6 plus 11 pattern. So never forget that pattern also for doing the Sutra Vistar. If you are able to do Sutra Vistar of such pattern, then you can on Kesha Ayurveda, Ayurveda, Garbha Ayurveda, Yakurta Ayurveda, whatever in your life, if you want to make something different from the ancient text, I have already told you, the Brahma Samhita was present of 1 lakh shlokas. Okay, but see, today's Charak Samhita is present of only 12,000 shlokas. So ऐसा कहा जाता है कि 1 लाख का 12,000 करने का ट्रेनिंग ही आयुर्वेद को दिया गया है. एक्चुअली उल्टा ट्रेनिंग चाहिए. ये धंधे में घाटे का ट्रेनिंग नहीं होना चाहिए. ट्रेनिंग कैसे होना चाहिए? 12,000 का 1 लाख कैसे करे, ऐसा ट्रेनिंग होना चाहिए. Now this is our duty to make the 1 lakh shlokas of whatever 12,000 shlokas in our hand from the Charak Samhita. So we have to understand the Sutra Vistar, how to do the Sutra Vistar of Grantha Shlokas. For example, see one shlok here, Darshana Sparshana Prashnehi Parikshetata Roginam. This is the Sutra by Ashtanga Hridaya Sutrasthan. So you can use any latest instrument for the Darshan Pariksha. That is skin and hair analyzer or dermoscope, or you can use the lens, or you can use the specs also. If you want to see the Pratyaksha thing in a more visualized form, then you have to use latest visualized techniques. Okay, if you are not able to see with the naked eyes, then what you will do, you will see the same thing with the specs. If that thing is not able to see with the specs, then you will use the lens. If it is not visible with the lens, then you will use the simple microscope. If not with the simple microscope, you will use the compound microscope, then stereoscopic microscope, and so on. So प्रत्यक्ष ही अल्पम अनल्पम अप्रत्यक्षम, हमारे ग्रंथकर्ताओं ने बहुत ही अच्छी तरीके से हमें बताया है कि प्रत्यक्ष चीजें जो हमारी आंखों को दिखती है वो बहुत ही अल्प होती है। अनल्पम अप्रत्यक्षम, अनल्प जो है अप्रत्यक्ष चीजें बहुत है, तो उनको भी देखने के लिए हमने एडिशनल माइक्रोस्कोप्स, एडिशनल दृष्टि हमें लेनी चाहिए, और वो एडिशनल दृष्टि हमें स्किन एंड हेयर एनालाइजर से मिलती है, डर्मोस्कोप से मिलती है, लेंस से मिलती है, कंपाउंड माइक्रोस्कोप से मिलती है, इलेक्ट्रॉनिक माइक्रोस्कोप से मिलती है, आगे जाके स्टेरियोस्कोपिक माइक्रोस्कोप से भी मिलती है। We are feeling proud as a Vaidya that we have a laboratory having the more than 15 lakh rupees microscopes. So आपको भी इस प्रकार का सपना देखना चाहिए कि अपने क्लिनिक में, जो भी आपका स्किन का क्लिनिक हो, हेयर का क्लिनिक हो, या जो भी आप आगे जाके, जैसे मैंने आपको एक छोटा सा मोटिवेशन दिया है, आगे जाके आपको नेत्र आयुर्वेद बनाना है, यकृत आयुर्वेद बनाना है, गर्भ आयुर्वेद बनाना है, ओके, वृक्क आयुर्वेद, काम करना शुरू करो। One idea, make that idea your life, think of it, dream of it, you on that idea, let the muscles, brain, nerves, each and every part of your body be fulfilled of that idea, then see you will do a marvelous work. Already stated by the Swami Vivekananda. अगर आपको कोई भी चीज में आप इतना कंसिस्टेंटली काम करते रहेंगे, तो अल्टीमेटली आप एक दिन उस फील्ड के डॉन बन जाएंगे, और वो आपको बनना है। तो चलिए सूत्र विस्तार हम देख रहे हैं। दर्शन स्पर्शन प्रश्न ही परीक्षा दातरोगिणम, दर्शन परीक्षा के लिए जो जो टूल्स इस्तेमाल कर सकते हैं वो हमने देखा। अब हम देखते हैं कि स्पर्शन परीक्षा के लिए हम क्या क्या यूज कर सकते हैं। तो स्पर्शन परीक्षा के लिए ऑलरेडी मॉइस्चर एनालाइजर होता है, वो एक मॉइस्चर एनालाइजर आप ले सकते हैं, उसके जरिए आप आसान जाता है रुक्षता या स्निग्धता का स्टैंडर्ड डिटर्मिनेशन करना। उससे फायदा क्या होता है, मान लो हमारे 108 सेंटर से, या फिर आपके एक 10 वैद्य है, और 10 वैद्यों को मिलके एक परिभाषा में बात करनी है, कि अगर आप मुझे या किसी को फोन करते हैं और बताते हैं कि सर ये पेशेंट के हेयर थोड़े ऑयली है, कोई कहेगा नहीं नहीं थोड़े ड्राई है, कोई कहेगा थोड़ा ऑयली है, कोई कहेगा नहीं ड्राई है, तो इसमें जो कंफ्यूजन आता है वो कंफ्यूजन निकलते हैं आपने मॉइस्चर एनालाइजर लगाने का और बताने का कि सर 1+ है, 2+ है, 3+ है। तो इस प्रकार से आप एक ही चीज को सिस्टमैटिक वे से बता सकते हैं। मैं हमेशा कहता हूं कि अगर आज चरक जी होते और जोर निदान का अध्याय सिखाते, और वो सिखाते समय अगर कोई अग्निवेश जैसा स्टूडेंट बीच में उठ के बताता कि सर मेरे पास थर्मामीटर है और मैं एग्जैक्ट टेम्परेचर बता सकता हूं इससे, तो चरक जी ज्यादा खुश होते, ना कि वो उसके ऊपर नाराज होते, वो ज्यादा खुश होते। वो बोलते कि वेरी नाइस, दिस इज द एग्जैक्ट इंटरप्रिटेशन ऑफ द अंशांश कल्पना, क्योंकि 0.01 सेल्सियस टेम्परेचर बता पाएंगे थर्मामीटर से, तो ये अंशांश कल्पना हो गई ना। तो जिस प्रकार से संप्राप्ति घटित होती है, वो संप्राप्ति घटित होने के बाद जो उसके परिणमन होते हैं, ज्वर के भी जो बताए हैं, तो ज्वर के अलग अलग संप्राप्ति जब आप देखेंगे तो अंशांश संप्राप्ति आप डाल सकते हैं ना। तो ये चीज बहुत इंपॉर्टेंट होती है कि अगर आप लेटेस्ट इंस्ट्रूमेंट्स को यूज करके आयुर्वेदिक ज्ञान को, आयुर्वेदिक लिटरेचर को अपनी परिभाषा में डालेंगे, तो उसका डेफिनेटली डायग्नोस्टिक वैल्यू एडिशन हो जाएगा, और डायग्नोस्टिक वैल्यू एडिशन ऑलवेज लीड्स टू द ट्रीटमेंट वैल्यू एडिशन। इसलिए प्रश्न परीक्षा में हमने केश आयुर्वेद में स्पेशलाइज्ड ऑटो डायग्नोस्टिक सॉफ्टवेयर भी बनाया है। अगर आप आपके यहाँ पे अभी कभी कहीं पर भी होंगे तो आप जस्ट गूगल प्ले स्टोर से केश आयुर्वेद का एक ऐप डाउनलोड कर सकते हैं, और वो ऐप डाउनलोड करके डायग्नोस्टिक भी है, आप देख सकते हैं। कोई भी रिमोट वाला पेशेंट होता है तो वो बस उसके फ्रॉम फ्रंट साइड, लेफ्ट साइड, राइट साइड, टॉप साइड, ऐसे वो फोटो खींच के भेजता है। और इतने ऑनलाइन पेशेंट मैं आपको बताता हूँ कि इतने बढ़ गए ये डायग्नोस्टिक सॉफ्टवेयर यूज करने के कारण। अब आप कहेंगे कि इसका क्या फायदा? वैद्य को अगर लेटेस्ट टेक्नोलॉजी उसके हाथ में आ जाए और उस टेक्नोलॉजी को अच्छी तरीके से इस्तेमाल करे तो फायदा ही फायदा है ना। अभी हमने पूरा लॉकडाउन में देखा, सब लोगों के क्लिनिक बंद थे, लेकिन केशव का क्लिनिक चालू था। लोग मोबाइल ऐप पे गूगल प्ले स्टोर से ऐप डाउनलोड करते थे केश आयुर्वेद का, खुद के 5 फोटोज भेजते थे, 4 फोटोज जो उसमें सिस्टम है, क्वेश्चन आंसर इजीली फिलअप करते थे, सेंड करते थे, हम देखते थे उसको, ट्रीटमेंट एडवाइस करते थे। तो क्लिनिक भी अगर आपको ऑनलाइन, अभी जमाना ही ऑनलाइन की तरफ जाने वाला है। आज देखो दर्पण फाउंडेशन, आयुष फाउंडेशन के कारण हम ऑनलाइन ही तो बात कर रहे हैं ना। तो ऑनलाइन नॉलेज हम बांट सकते हैं, ऑनलाइन हम डिस्कशन कर सकते हैं, ऑनलाइन हम कंसल्टेशन कर सकते हैं, ऑनलाइन हम अगर अच्छी तरीके सिस्टम बनाएंगे तो सिस्टम बनाओ, उसके ऊपर काम करो, उसके ऊपर विचार करो। आज से कभी भी ये मत देखो कि मेरे पास ये नहीं है, वो नहीं है, ऐसा कभी सोचना नहीं है। जो है उससे काम आपका शुरू होना चाहिए। आपके पास केवल मोबाइल भी रहेगा आपका तो उस मोबाइल के ऊपर आपका क्लिनिक शुरू होना चाहिए। बस ये चीज आप ध्यान में रखिए, इसको भी हम सूत्र विस्तार कहेंगे। और जितनी भी छोटी चीज आपके पास है उसको बड़ा करेंगे, मतलब आप सूत्र विस्तार करेंगे। तो ग्रंथ में तो ऑलरेडी दुष्यम देशम बलम कालम अनलम प्रकृतिम वयः सत्वम सात्वम तथा आहारम अवस्थाश्च पृथक विधा। कल मैंने 3+7+3+5+6+11 का पैटर्न आपको सिखाया। तो वो उसमें से जो 11 है वो फिर से यहीं पर भी आने वाला है। बालों के प्रॉब्लम्स जो होते हैं या केवल बाल भी जो होते हैं वो प्रकृतितः अलग है, धातुतः अलग है, मलतः अलग है। ये तो दोष धातु और मल का तो आपको अभी पता ही चल गया है। उसके साथ हर एक देश, रशियन के लेडीज के बाल अलग है, जापानीज के अलग है, चाइनीज के अलग है ना। हर एक कंट्री में आप देखेंगे कि देश का महात्म्य भी होता है जो बालों के साथ जुड़ा होता है। तो अलग अलग जगह के अलग अलग बाल हमें देखने को मिलते हैं। इसी प्रकार से हर एक व्यक्ति का बल अलग है, उसके बालों का भी बल अलग है। बहुत से जो लोग होते हैं गिनीज बुक ऑफ वर्ल्ड रिकॉर्ड में अपना रिकॉर्ड करते हैं, बालों से ट्रक को खींचते हैं, बालों को सबसे ज्यादा लंबे बाल किसके होते हैं उसके ऊपर एक गिनीज बुक ऑफ वर्ल्ड रिकॉर्ड होता है। तो ऐसे अगर आप देखेंगे तो केवल बालों के बल का परीक्षण करके या फिर वो डेवलप करके भी आप ऐसे लोगों को स्पेशली सर्व कर सकते हैं ना। वो आपको मुंह मांगी कीमत देने को तैयार होंगे अगर आप उनके बालों का ख्याल रखेंगे तो हमने जाते जाते इस प्रकार से भी देखना चाहिए। आप कभी भी किसी को मिलते हैं, कहीं पर जाते हैं, तो आपने ये चीजें भी देखनी चाहिए। तो आपने ये चीजें भी देखनी चाहिए कि किस प्रकार से आप आपका जो बिजनेस है वो अलग अलग जगह पे देख सकते हैं आयुर्वेद के सिद्धांतों को लेके, जैसे देश, बल, काल, अणल, प्रकृति, वय, सत्व, सात्म्य। अभी आपको ये पता है तो अभी ये सूत्र विस्तार में ज्यादा नहीं करूंगा और आगे जाऊंगा। एक नई चीज, इंटरेस्टिंग चीज मैं आपको बताने जा रहा हूँ। सुनते रहेगा, कहीं पर भी मत जाइएगा। ये देखिए केश एंड त्रिदोष परीक्षण। ये उम्मीद है कि 3+7+3+5+6+11 तीन दोष, सातु, तीन पंचमभूत और एकादशविद भाव परीक्षण फिनिश। ये जो चीज वो अगर हम किसी भी चीज में कोशिश करेंगे तो ये ऑटोमेटिकली 36 पॉइंट्स का सूत्र विस्तार हो गया आपका। आर यू गेटिंग मी? दिस इज द बुक लिखना चाहते हैं आप, किसी भी सब्जेक्ट के ऊपर आप कुछ लिखना चाहते हैं तो दोष धातु मलामूलम ही शरीरम, दोषों के बारे में लिखो, धातु के बारे में लिखो, मल के बारे में लिखो, सूत्र विस्तार के ऊपर आप विचार करो। फॉर एग्जाम्पल मैं आपको यहाँ पे सूत्र विस्तार सिखाता हूँ कैसे किया जाता है। अब हमने वाग्भट में पहला श्लोक सीखा है कि वायु पित्तम कफश्चेति त्रयो दोषाः समासतः। तो हम सबको पता है कि ये 3 दोष है, वात पित्त और कफ, 3 दोष समासतः हमारे पूरे शरीर में है। लेफ्ट साइड को आप देख रहे हैं किस प्रकार से हमारे पूरे शरीर में वात पित्त और कफ आदि मध्य और अंत बैठे हैं। और ग्रंथों सूत्र है कि वयोः रात्रि भुक्तानां ते अंत मध्य आदि का क्रम। अब अंत मध्य और आदि यही विचार अब हमें सूत्र विस्तार करना है केश के बारे में। ओके, आर यू गेटिंग माय पॉइंट? अब हमें केश के बारे में इसका सूत्र विस्तार करना है। तो आप क्या करेंगे, केश शरीर निकालेंगे, है ना। फुल बॉडी शरीर हो गया। अब आप क्या करेंगे, केश शरीर निकालेंगे। केश शरीर निकालो, वहां पे एक हेयर निकालिए, हेयर फॉलिकल, ओके, और हेयर रूट, शाफ्ट और टिप आपने निकाला। यहाँ पे दिख रहा है मेरे ख्याल से आपको। अब हेयर रूट, शाफ्ट और टिप में आप देख रहे हैं कि उसको अभी ये श्लोक लगाओ, वायु पित्तम कफश्चेति त्रयो दोषा समासता। तो समासता 3 दोष है, वात पित्त और कफ। सेल इज द स्ट्रक्चरल एंड फंक्शनल यूनिट ऑफ आवर बॉडी। एट द सेम वे दोष धातु एंड मल इज द स्ट्रक्चरल एंड फंक्शनल यूनिट ऑफ आवर आयुर्वेदिक क्रिया शरीर। ये कभी भी आपने भूलने का नहीं। आयुर्वेदीय क्रिया शरीर का स्ट्रक्चरल एंड फंक्शनल यूनिट दोष धातु और मल है। तो बस हर एक शरीर के हर एक अंग से, हर एक छोटे छोटे बॉडी पार्ट से आप इसका कोरिलेशन शुरू करो। फॉर एग्जांपल केश के साथ उसका कोरिलेशन आपको करना है, तो आपको सूत्र लगाना पड़ेगा, वायु पित्तम कफश्चेति त्रयोदोषा समस्तता। तो एक बाल में भी 3 दोष होने वाले हैं। फिर दूसरा सूत्र, वयोः रात्रि भुक्तानां ते अंत मध्य आदि का क्रमात्। तो अंत में आएगा टिप, मध्य में आएगा शाफ्ट, आदि में आएगा रूट। तो रूट, शाफ्ट और टिप को आप डिवाइड करेंगे तो पता चलेगा आपको कि टिप में पूरा वात का डोमिनेंस होता है, शाफ्ट में पूरा पित्त का डोमिनेंस होता है, और रूट में पूरा कफ का डोमिनेंस होता है। अब आप डिसीजेस देखना शुरू करो, आपको ऑटोमेटिकली पता चल जाएगा। इसलिए स्प्लिटिंग टाइप ऑफ हेयर, स्प्लिटिंग टिप, वाई शेप टिप, ये सभी टिप के जो ट्राइकोप्टिलोसिस से लेके जो अलग अलग प्रकार की बीमारियां होती है, या जो भी हम कहेंगे कि हेयर टिप के डिसऑर्डर्स होते हैं, ऑल द हेयर टिप डिसऑर्डर्स आर विशेष प्रकार से आप देखेंगे कि शाफ्ट के ऊपर मैक्सिमम दोष डिसीजेस हमें देखने को मिले, जैसे डिस्कलरेशन के सभी डिसीजेस आपको हेयर शाफ्ट के ऊपर देखने को मिलेंगे। और रूट जो होता है वहां पे कफ का आवरण होता है, इसके कारण कफ भी वहां पे आता है और बालों का है। तो रूट लेवल पे आप ज्यादातर कफ के डिसीजेस जो है वो आपको देखने को मिलेंगे। तो इसलिए ये सूत्र विस्तार की एक छोटी सी आइडिया आपको दे दी। अब आप वहां पे गर्भ डालो, गर्भ शारीर लिखो, वहां पे नेत्र डालो, नेत्र शारीर। आप वहां पे फुफ्फुस डालो, शारीरिक, वृक्क डालो, वृक्क शारीर लिखो। तो कोई भी ग्रंथोक्त जो ऑर्गन है उसका सूत्र विस्तार बहुत इंपॉर्टेंट है। सूत्र स्थान को बहुत लाइटली लेते हैं, इतना लाइटली नहीं लेना चाहिए। हमने उस सूत्र स्थान को सूत्र रूप में सब बताया है, कोडिंग को डिकोडिंग करना है, वो डिकोडिंग की लैंग्वेज हमें याद रखना है। सूत्र विस्तार का और एक दूसरा एग्जांपल मैं आपको इजी करके दे रहा हूँ। फॉर एग्जांपल, इफ यू आर टेकिंग द क्रॉस सेक्शन ऑफ द हेयर, यहाँ पे आप देख रहे हैं वी हैव टेकन द ट्रांसवर्स सेक्शन ऑफ द हेयर मेडुला। If you are able to take the transverse section of the hair medulla, then you will find this type of layers: innermost layer, middle layer, and outer layer. So ultimately our shloka will reminds us why ahoratra bhuktanam te anta madhya adhika kramat. So the anta layer, outermost layer is cuticle, middle layer is cortex, and innermost layer is medulla. So we will convert this in Ayurvedic terminology. Cuticle belongs to Anta, cortex belongs to Madhya, medulla belongs to Adi. So ultimately what will happen? Cuticle belongs to Vata, cortex belongs to Pitta, medulla belongs to Kapha. See the beauty of Ayurveda? Then there is no need to understand or no need to learn the allopathic science also. It becomes easy to understand, it becomes easy to learn the allopathy science with the Ayurvedic methodology, because Ayurveda is Shashvat science. All the other sciences are developing sciences. So if you are able to do the decoding of our own shlokas, then it will become very easy for you to understand all allopathic concepts. That's why I always say Shakespeare is equal to Charak. Too many students always laugh with me why Shakespeare is Charak, because I say Shakespeare says नाम में क्या लिखा है, और चरक भी वही कहते हैं नहीं चरक भी कहते हैं कि नाम में क्या है, शेक्सपियर भी कहता है नाम में क्या है, लेकिन हमें शेक्सपियर याद रहता है, चरक। हालांकि शेक्सपियर से पहले चरक है, तो हमने चरक जी को रिस्पेक्ट करना शुरू करना चाहिए, और हर एक चीज को आयुर्वेदिक एंगल से देखना और पढ़ना शुरू करेंगे तो अंडरस्टैंडिंग भी बहुत इजी हो पाएगा। ओके, मुझे आशा है कि ये त्रिदोष का जो सिद्धांत है वो आपको समझ में आया होगा, जो मुझे बताना है। अब उसको पंचमहाभूत में डाल दो। ग्रंथ का श्लोक क्या है? वात पित्त कफ, ये जो तीन दोष है वो पंचमहाभूतों से ही बन गए हैं। अब पंचमहाभूतों से ये जो तीन दोष हमारे शरीर के बन गए हैं, आकाश और वायु, वायु महाभूत से वात बन गया है, तेज और आप महाभूत से पित्त बन गया है, ओके, और पृथ्वी और आप महाभूत से कफ बन गया है। अगर इन चीजों को हम आयुर्वेदीय परिभाषा से समझेंगे, जैसे क्षाम्भु क्षाम्भु तेजा क वायु अग्नि गोनि, कल भी बताया था मैंने किस प्रकार से इसको आपको सूत्र विस्तार करना है। अब इस चीज को देखो कि हमारे शरीर में भी, यहाँ पे आपको लेफ्ट साइड को एक कॉमन मैन मैंने निकाला है, उसको पृथ्वी आप तेज वायु और आकाश, हमारे फुल बॉडी में भी किस प्रकार से वो सिचुएटेड होते हैं, ये भी एक सूत्र विस्तार है, द्वितीय अध्याय से लिया है, ये सूत्र विस्तार कर सकते हैं। हमारे पैर देखिए पृथ्वी महाभूत प्रधान होते हैं, जिससे हम पृथ्वी के ऊपर खड़े होते हैं। उसके ऊपर आप थोड़ा आएंगे तो आपको वाटर का स्टोरेज मिलेगा, ब्लैडर वगैरह सब मिलेंगे, वहां पे पूरा वाटर स्टोरेज होता है बॉडी का, आप महाभूत। उसके ऊपर थोड़ा आइए, आपको तेज महाभूत मिलेगा जहाँ पे डाइजेशन होता है। उसके ऊपर थोड़ा आइए, आपको वायु महाभूत मिलेगा जहाँ पे एयर इन एंड आउट होते हैं। और उसके ऊपर आप आइए, आपको आकाश महाभूत देखने को मिलेगा, जो हमारे कर्ण है, नासा है, मुख है। और डिसीजेस कैसे होते हैं? डिसीजेस इसी प्रकार से होते हैं, एक महाभूत का दूसरे महाभूत के स्थान में जब अतिक्रमण होता है तो ऑटोमेटिकली क्या होता है, डिसीज फॉर्म होते हैं। इसलिए आपको अभी पता चलेगा कि किडनी स्टोन कैसे बनता है। कोरोना में वायु स्थान में कफ आके बैठता है, मतलब क्या होता है, वायु स्थान में पृथ्वी और आप महाभूत ज्यादा होता है, तो ओपेक ग्लासी अपीयरेंस HRCT स्कैन में आना शुरू हो जाता है ऑटोमेटिकली, तो उससे कोविड स्कोर दिया जाता है। तो हमें ट्रीटमेंट क्या करनी है, वायु स्थान में वायु महाभूत चाहिए, आप स्थान में आप महाभूत चाहिए, पृथ्वी स्थान में पृथ्वी महाभूत चाहिए, तेज स्थान में अग्नि चाहिए, फिनिश हो गई ट्रीटमेंट। यही ज्वर चिकित्सा में भी बताया है, मिथ्याहार विहाराभ्याम दोषा ही आमाश्रयाश्रया बहिर्निरस्य कोष्ठाग्निम ज्वरदास्यो रसाणुका। अगर उस कोष्ठ से, उस जठराग्नि से अग्नि बाहर निकलता है, कोष्ठ से शाखा में चला जाता है, तो ज्वर निर्माण होता है। वही चीज हो रही है, आपको एकदम सिंपलेस्ट फॉर्म करके बता रहा हूँ कि डिसीज कैसे फॉर्म होता है। अब आप कहेंगे कि हमें पंचमहाभूत सिखा रहे हैं, आप त्रिदोष का कोरिलेशन सिखा रहे हैं, हमें एक शरीर में केश में भी वात पित्त और कफ कैसे होता है वो बताया, लेकिन इसका प्रैक्टिकल एप्लीकेशन क्या है? और आपको तो पता है मैं तो प्रैक्टिकल बंदा हूँ, क्लिनिक में ही सबसे ज्यादा ओपीडी करता हूँ, 10,000 से ज्यादा हेयर एंड स्किन के पेशेंट्स हो गए हैं, तो मैं तो आपको क्लिनिकल नॉलेज ही दूंगा, क्लिनिकली ही बोलूंगा। फॉर एग्जांपल देखो, प्रैक्टिकल अप्रोच ऑफ द पंचमहाभूत सिद्धांत। मान लो आपके पास 2 पेशेंट आए हैं, एक पेशेंट जो है उस पेशेंट में जो बालों की दुष्टि है वो एक्सटर्नल टू इंटरनल हुई है, मतलब टिप से लेके रूट की तरफ दुष्टि हुई है। उसके कारण अलग अलग हो सकते हैं, वो 2 व्हीलर पे जाता है या स्विमिंग करता है या और कुछ करता, बालों का ख्याल नहीं रखता है, एक्सटर्नल केयर टेकिंग करता नहीं है, इसलिए उसके जो बालों की दुष्टि है वो फ्रॉम टिप टू रूट हो गई है। आर यू गेटिंग माई पॉइंट? आई रिपीट, टिप टू रूट। आपको एक पेशेंट में दुष्टि मिल गई, पेशेंट नंबर 1 ए में, और दूसरा जो पेशेंट है पेशेंट नंबर बी, उसमें जैसे अभी मॉर्निंग में भी सर ने लिया था, सब रिपोर्ट्स नॉर्मल है, लेकिन फिर भी बाल गिर रहे हैं। अब क्या है, तो उसका न्यूट्रिशनल वैल्यू देखो। न्यूट्रिशनल वैल्यू अगर हम देखते हैं तो हमें पता चल जाएगा कि उसको अंदर से ही पोषण नहीं है। हम बोलते हैं ना, बालों को अंदर से पोषण की जरूरत है। अगर उसको अंदर से ही पोषण नहीं है, अंदर से पोषण नहीं मतलब इंटरनल न्यूट्रिशन उसका हैम्पर हुआ है, उसके कारण रूट टू टिप, यहाँ पे दृष्टि कैसे देखने को मिलेगी, फ्रॉम रूट टू टिप। अभी आपको दो डिसीजेस पता चल गए हेयर में, फ्रॉम टिप टू रूट डिसीज ट्रैवल, ये एक संप्राप्ति मिलेगी। दूसरी संप्राप्ति मिलेगी, डिसीज विल ट्रैवल फ्रॉम रूट टू टिप। सो यू कैन थिंक फॉर दैट सेम डिसीज, फॉर these two diseases, in one form you will find the disease from internal to external traveling, and in another you will from the disease is traveling from external to internal. The same way, if you think about the Pancha Mahabhutas, which I have already told you, Prithvi, Aap, Tej, Vayu, Akash in one hair sample. So whenever you will find the Mahabhuta Dushti in hair sample from Prithvi Mahabhut to Akash Mahabhut, from internal to external, and you want to work from internal to external, then think for the coconut oil, because it travels from Prithvi Mahabhut to Akash Mahabhut. Are you getting my point? Then think for Narikel, because it travels from Prithvi Mahabhut to Akash Mahabhut. And whenever you will find the Dushti in the hair from external to internal, from Akash Mahabhut to Prithvi Mahabhut, then you have to select the drug having the potency, having the gamitva to travel from Akash Mahabhut to Prithvi Mahabhut, and that is, we know, Vata Vruksha. That's why the Vata Jatadi tail always acts very nicely whenever there are diseases from external to internal. Whenever you want to treat the hair from external to internal, whenever there is a disease from tip to root. Are you getting my point? So if you want to work on the hair from root to tip, then think for the coconut oil. And if you want to work on the hair from tip to root, then think for the Vata Jatadi tail. So like these clinical applications will give you the 100% success in the selection of hair oil, in the selection of shampoos, in the selection of internal medicines, for the selection of external medicines. That's why already in whole day we are learning too many drugs which are working on the hair. We will now understand or try to understand the logic behind it, how to use that drug. Okay, now for example, yesterday I have already told you about the scalp photography. Okay, now see the beauty of Ayurveda. Just do the sutra vistar of your scalp. Okay, if you are doing the sutra vistar of your scalp also, you will get this beauty. In scalp photography, look in this patient, you are seeing, if you are looking towards your patient from top region, then how it will be look, and if you are looking from the lateral side, then how it will look. I have given you the two images over here. Okay, now what is the previous shloka? Vayu Pittam Kapha Chetrayo Doshaha Samata. What is the additional shloka? Vai Ahoratri Bhuktanam Te Antam. Now apply the two shlokas on the scalp photography. What you will get? You will get of Vata. So the Kapal part, Anta part belongs to Vata. So can you see me? So this part belongs to Vata, this part belongs to Pitta, and this back portion of our hair scalp belongs to Kapha. Very simple. Adi, Madhya, Anta. This is the Adi part, this is Madhya part, this is Anta part. That's why we called it hair margin. Okay. So Adi, Madhya, Anta. अब इसको आप शिरशूल के साथ थोड़ा जोड़िए तो आपको पता चल जाएगा. Whenever we have a headache, देखिए कभी भी, whenever we have Vataja Shirashul, we sit like this. It is due to stress, it is due to the increased Vat. We always keep our head like this. Oh, there is a pain. Okay, the typical Vata Shirashul. Whenever we have a Pitta Shirashul, then माथा गरम हो जाता है, यहाँ से दर्द करता है जोर से, और ये पूरा गर्म हो जाता है. पित्त स्थान में आपको शिरशूल महसूस हो जाएगा. And whenever there is Kafat Shirashul, तो वो हमेशा ऐसे पीछे से आता है। आपको कोई बहुत बड़ा, आप पर्टिकुलरली फीमेल लोग क्या करते हैं, ओढ़नी से लेके उसको अच्छी तरीके से बांध के रखते हैं, तो उनको अच्छा लगता है, एक टिपिकल कफज टाइप ऑफ शिरशूल. So you will see the Vataj, Pittaj and Kafaj Shirashul also as per these locations. See the beauty of Ayurveda. Vataj, Pittaj, Kafaj Shirashul also you are getting in these locations. And you have to find out the types of Khalitya in this scalp photography. So in from lateral view also you are seeing. So अभी आप अलग अलग देखो, जो कफ के लोग होते हैं, एकदम जाड़े होते हैं, ढोले होते हैं, बड़े होते हैं, हमेशा देखो उनके कफ के ही बाल केवल बचते हैं, वात और पित्त के पूरे निकल जाते हैं. तो आपको अभी पिक्चर के कैरेक्टर्स भी याद आते होंगे जो मैं कह रहा हूँ. आप थोड़ा आपके ब्रेन को स्ट्रेस करना शुरू कीजिए, तो आपको ऑटोमेटिकली वो सब महसूस होंगे. आप बहुत ही इजीली आइडेंटिफाई कर पाएंगे कि ये वातज खालित्य का है, ये पित्तज खालित्य का है और कफज खालित्य का है. जो भी ब्रेन वर्क करने वाले होते हैं, साइंटिस्ट होते हैं, जो भी होशियार होते हैं, देखो पित्त का काम ज्यादा होता है, इनके यहाँ के बाल पहले चले जाते हैं. यहाँ पे उनको पहले इस सेगमेंट में क्या होता है, हेयर फॉल उनका हमें देखने को मिलता है, पित्त स्थान में वो हेयर फॉल हमें देखने को मिलता है. तो अकॉर्डिंग टू दिस सूत्र विस्तार ऑफ वाग्भट, वायु पित्तम कफश्चेति त्रयोदोषा समासता एंड वयो रात्रि भुक्तानाम ते अंत मध्यादिका क्रमात्, you can apply the sutra vistar for the scalp photography and you can make a pattern of your patient like this. हमारे क्लिनिक में तो इसका एक रिपोर्ट बनता है, पेशेंट को अच्छी तरीके से रिपोर्ट ही प्रिंट करके दिया जाता है. नेक्स्ट अनदर ब्यूटी, देखो अभी स्काल्प एनालिसिस में भी कल मैंने आपको स्किन एंड हेयर एनालाइजर सिखाया था. बहुत से कल स्टूडेंट्स के फोन आए, सर वो कहाँ मिलेगा, कैसे मिलेगा, कितने रुपए को होगा, ये वो. अब हमने तो, अब ये जो चीजें हैं, ये चीजें आपको कहीं पर भी मिलेगी. इंपॉर्टेंट ये है कि उसको यूटिलाइज कैसे करना वो हमने सीखना चाहिए. बहुत लोगों को गाड़ी तो बहुत बड़ी बड़ी लेते हैं लेकिन चलाना ही नहीं आता, चलाते ही नहीं है, तो उसका कुछ यूटिलाइजेशन ही नहीं है ना. आप अगर एप्पल का 1.5 लाख का फोन भी परचेस करेंगे और आप केवल उसको फोन लेने के लिए और बंद करने के लिए यूटिलाइज करेंगे, तो उसका कुछ फायदा ही नहीं है. आजकल वही हुआ है, एज अ स्टेटस सिंबल लोग चीजें लेना चाहते हैं, लेकिन उसका जो अंडरस्टैंडिंग है वो सीखना नहीं चाहते. मतलब स्किन एंड हेयर एनालाइजर परचेस करना चाहते हैं, लेकिन स्किन एंड हेयर एनालिसिस कैसे करे वो सीखना नहीं चाहते. अब इसको क्या कहेंगे? ओके, तो मैं आपको सिखा रहा हूँ. यहाँ पे आयुर्वेद में है, सूत्र विस्तार में है, बहुत ही इजी है, सरलता से सीख पाएंगे. स्काल्प एनालिसिस, ओके, केश भूमि परीक्षण नंबर 1, उसमें से ए नंबर आप हम देख रहे, 1 नंबर देख रहे, हाउ टू डू द स्काल्प एनालिसिस. तो यू आर लुकिंग हियर स्काल्प एनालिसिस. अभी मैंने आपको लोकेशंस बताए, वातज, पित्तज और कफज. ओके, यहाँ पे कैन आई नोट समथिंग हियर, आई थिंक यस. ओके, या दिस इज वातज एंड दिस इज कफज. ओके, okay, so I have corrected it. So if you see from top side or from lateral side also you will get it. So whenever you want to do the scalp analysis, or according to Ayurveda, if we want to do the Kesha Bhumi Parikshan, तो हमने क्या क्या करना चाहिए? स्थानतः देखना चाहिए, रूपतः देखना चाहिए, है ना. केश की भूमि कैसी है, पंचभौतिकतः देखना चाहिए, उसमें पार्थिवत्व कितना है, आपीय तत्व कितना है, तेज तत्व कितना है, वायु तत्व कितना है, आकाश तत्व कितना है. जैसे मैंने अभी आपको बताया, मॉइस्चर एनालाइजर लगा के भी देख सकते हैं. तो इसी प्रकार से आप उसका जो पैटर्न है, आपका जो पेशेंट आया है उसका पैटर्न आप स्काल्प एनालिसिस से वातज, पित्तज या कफज है वो देख सकते हैं. और क्या कर सकते हैं, उसको हमेशा 2 अटैचमेंट्स मिलते हैं. ओके, उसको हमेशा 2 अटैचमेंट्स मिलते हैं. वेयर इज माय स्लाइड? ओके, ओके, या सॉरी. तो उसको हेयर फॉलिकल एंड त्रिदोष परीक्षण. अब देखो आप स्काल्प एनालिसिस कर रहे हैं, फॉर एग्जांपल कल मैंने जो आपको मशीन बताया था स्किन एंड हेयर एनालाइजर का, उसमें से अभी 200x वाला आपने लेंस उसको लगाया है, एंड नाउ यू आर डूइंग द स्काल्प एनालिसिस. सो व्हाट यू विल गेट फर्स्ट थिंग, नंबर ऑफ हेयर पर हेयर फॉलिकल. इससे आपको जो डेंसिटी ऑफ द हेयर है वो पता चल जाएगी पर्टिकुलर हेयर फॉलिकल में। फॉर एग्जाम्पल वातज, पित्तज और कफज में कैसे होता है? हमने ग्रंथ में श्लोक तो सुना। ग्रंथ में श्लोक क्या है? सुस्निग्धा बहवा मूला नैक मूलाः स्थिरः कचः, नैक मूलाः स्थिरः कचः, ऐसे वाग्भट जी बोलते हैं। कच मतलब केश, नैक मूलाः मतलब उसके मूल कैसे है? अधिक है, अनेक है। अनेक मतलब कैसे होते हैं? दो से ज्यादा। दो से ज्यादा मतलब कितने? 3 या 4। सो नॉर्मल हेयर फॉलिकल कंटेन्स 3 to 4 hair. Are you getting this point? Normal hair follicle, normal single hair follicle always have more than 2 to 3 hair in bulb in one hair follicle. That is, you can look here in kapha. Okay, you can see here in this. You are getting this. So in kafaj Kesha Bhumi Parikshan, you will get Naika Mulaha appearance as per the Grantha. ग्रंथ में जो नैक मूलाहा अपीयरेंस दिया है वो आपको कफज केश भूमि परीक्षण में देखने को मिलेगा। इफ यू वांट टू कोरिलेट इट विद द मॉडर्न साइंस देन यू कैन से द नंबर ऑफ हेयर पर हेयर फॉलिकल आर ऑलवेज more in kafaj prakriti patients, always medium in pittaj prakriti patient, and always less in vata bahula prakriti patient. Now, are you getting me? So you will get 1 to 2 only number of hair per hair follicle in vata. You will get only 2 in pitta, and you will get more than 2. Okay, you will get more than 2 in kapha type of patients. So you have to see the number of hair per hair follicle as per the vata, pitta and kapha conditions. The same way, if the patient belongs to kapha prakriti and if their appearance is like single hair per hair follicle, then you can easily identify the dosha dushti in that particular patient. सो वातज प्रकृति में किस प्रकार का हेयर फॉलिकल पैटर्न होगा, पित्तज प्रकृति में किस प्रकार का हेयर फॉलिकल पैटर्न होगा और कफज प्रकृति में किस प्रकार का होगा, ये आप बहुत इजीली इससे तय कर सकते हैं। दूसरी बात, और यहाँ पे क्या देखने को मिलता है, बहुत ही इंटरेस्टिंग है, ये चीज भी ध्यान से देखिएगा, सुनिएगा। फॉर एग्जाम्पल ये देखो, मैं यहाँ पे 3 पिक्चर ड्रॉ कर रहा हूँ। ओके, अब ये जो पहला है इसमें हम देख रहे हैं कि आपको लो डेंसिटी देखने को मिलेगी। ये जो है इसमें आपको जो घनता है वो मीडियम देखने को मिल रही है। एंड नाउ द थर्ड पैटर्न आई एम ड्रॉइंग हियर। नाउ यू विल सी हियर very dense hair in per 1 square centimeter. Are you getting this? Now नंबर ऑफ हेयर पर स्क्वायर सेंटीमीटर कितने होते हैं, इसको हेयर डेंसिटी कहा जाता है। मॉडर्न साइंस में भी हेयर डेंसिटी निकाली जाती है। तो वातज प्रकृति में नंबर ऑफ हेयर पर स्क्वायर सेंटीमीटर आपको हमेशा लेस देखने को मिलेंगे। पित्तज प्रकृति में नंबर ऑफ हेयर पर स्क्वायर सेंटीमीटर हमेशा आपको मीडियम देखने को मिलेंगे। ओके, एंड कफज प्रकृति में आपको एकदम डेंस अपीयरेंस देखने को मिलेगा। कफज प्रकृति में आपको एकदम डेंस अपीयरेंस देखने को मिलेगा। नंबर ऑफ हेयर पर स्क्वायर सेंटीमीटर आर ऑलवेज मोर। नाउ इट बिकम्स इजी टू अंडरस्टैंड which type of hair follicle belongs to which type of prakriti. So simple. And if you know the prakriti, you can easily identify the vikruti. Without knowing the prakriti, how can you identify the vikruti of the hair and hair follicle? My dear students, without knowing the prakriti, how can you identify the vikruti? That's why it is very important to utilize the modern devices, to utilize the latest technology, latest softwares to identify the vata, pitta and kapha conditions in given scalp, in given hair, and for deciding the disease of the patient or for the decision of the prakriti. Okay, I think now the concept is clear. With this pattern, you can easily identify the number of hair per hair follicle and the density of hair per square centimeter. These two things you have to see by skin and hair analyzer, and many more things. You can see the different types of diseases. Today is not too much time for me to take all the detail of skin and hair analysis, but I have given you the insight, I have given you the light, how to do the Sutra Vistar, how to do the decoding, how to think about this. Okay, now we'll see the next. Yeah. Oh, itne aa gaye isme. Okay. Just a minute. जो भी मैंने अभी यहाँ पे ड्रॉ किया था शायद वो उसी के ऊपर रह गया है. आई एम नॉट एबल टू इरेज इट एनीवे. Okay. Yeah, just a minute. I think I can. No, erase. Okay. Yes. Now we will go towards next. Okay. So after learning the relation between the Vata, Pitta, Kapha, Prakriti, number of hair per hair follicle, how to identify the density of the hair, okay, how to locate the Vata, Pitta and Kapha in scalp analysis, Kesha Bhumi Parikshan, we will go towards our next we will go towards our next thing, Kesh and Saptadhatu. See, this is very, very, very interesting and very, very important point I am going to take, my dear friends. It is very important. With these 7 types only, we treat lot of patients in our clinic. For example, we will start from one by one. In Rasadhatu, see, I have already told you, Dosh, Dhatu and Mala is the structural and functional unit of our body. So it means Dosh, Dhatu and Mala is the structural and functional unit of a hair sample also. A single hair belongs to 3 Dosh, Sapta Dhatu and 3 Mala. Dosh, Dhatu and Mala are always associated with the single hair also. So if you are going to find out what are the roles and functions of particular dhatu in that particular hair, then you will see the function of rasa dhatu is function of prenan, and prenan is the basic function of rasa dhatu. For in hair, it will give you a little bit luster to the hair. Okay. जिसको हम कहते हैं कि ना एकदम चमकदार बाल इसके हो गए, इंस्टेंट जो है वो प्रेरण करता है. मैं हमेशा कहता हूं कि जब अब हमारे इस शिल्पा मैडम है, बाकी के सब लोग हैं, आपको भी पता होगा, आप जब सब्जी खरीदने के लिए जाते हैं तो वो सब्जी वाला जो होता है, जैसे आपको देखता है उसके सब्जी के ऊपर वो पानी मार देता है. तो पानी मारने से क्या होता है, पानी ये रस महाभूत का प्रतीक है. इंस्टेंट प्रेरण होता है. इंस्टेंट प्रेरण होता है तो बालों को पोषण बहुत जल्दी मिलता है. कोई भी हमारे घर में गेस्ट आते हैं या हम कहीं घूम के बाहर जाते हैं तो हम भी क्या करते हैं, थोड़ा बेसिन के सामने जाते हैं, थोड़ा पानी लगाते हैं बालों को और बाहर आते हैं. तो उससे क्या हो जाता है, इंस्टेंट बाल जो है, जो ज्यादा ड्राई हुए थे वो एकदम अल्प स्निग्ध दिखने शुरू होते हैं, क्योंकि उसका प्रीणन हो जाता है. और ये जो कार्य है वो रस धातु का कार्य है. तो आपको अभी आपके पास पेशेंट आने के बाद ऐसे ढूंढना है कि इस पेशेंट में रसक्षय तो नहीं हुआ है, रक्तक्षय तो नहीं हुआ है, मांसक्षय तो नहीं हुआ है. और वो कैसे ढूंढना है वो मैं अभी आपको सिखाने वाला हूं. और उसके अकॉर्डिंगली हमारे मेडिसिन भी चेंज होने वाले हैं. जैसे अभी अपने मैडम जो थे नेपाल से, उन्होंने भी बहुत अच्छे तरीके से लेक्चर लिया. उसी प्रकार से आप देखेंगे एक एक धातु के क्षय और वृद्धि के हिसाब से आपके मेडिसिन कैसे चेंज होते हैं, या फिर आपका जो पेशेंट को आपको आहार और विहार देना है वो भी चेंज हो जाता है. एंड इट ऑल डिपेंड्स ऑन द रस वृद्धि और रसक्षय. तो बालों में रस वृद्धि से भी प्रॉब्लम आएंगे, बालों में रसक्षय से भी प्रॉब्लम आएंगे. तो क्या प्रॉब्लम आए हैं उसके हेतु देखने के, रस धातु रसव स्रोतस के दुष्टि के हेतु किस प्रकार के हमें मिल रहे हैं, और उस हेतु अगर मिल रहे, फॉर एग्जाम्पल रसवाहिनी दुष्यंती चिंतनाम चति चिंतना, तो जो व्यक्ति ज्यादा चिंतन कर रहा है, ज्यादा चिंता कर रहा है, तो उसको ड्राइनेस तो बहुत जल्दी आएगा, ड्राइनेस आएगा तो उसके बाल भी जल्दी ड्राई हो जाएंगे, ड्राई हेयर की ट्रीटमेंट आपको देनी पड़ेगी, वहां पे रसक्षय की संप्राप्ति आपको देखने को मिलेगी। तो रसक्षय में आप पीआरपी भी करेंगे तो भी आपको फायदा जाएगा। ओके, अब वो कैसे करते हैं वो मैं कभी ऐसे ही समय मिलेगा, नया लेक्चर और एक होगा तो उस समय मैं बता दूंगा आपको कि व्हाई आई हैव प्रेजेंटेड अ पेपर ऑन रोल ऑफ पीआरपी इन रसक्षय जन्य खालित्य। आर यू गेटिंग माय पॉइंट? रोल ऑफ पीआरपी इन रसक्षय जन्य खालित्य। वी नेवर यूज पीआरपी इन रस वृद्धि जन्य खालित्य। रस वृद्धि जन्य खालित्य में पीआरपी नहीं करनी है, रसक्षय जन्य खालित्य में पीआरपी करनी है। उसी प्रकार से अगर किसी पेशेंट में रक्त धातु का क्षय हो गया तो हम बोलते हैं ना कि बेजान बाल हो गए हैं। तो बेजान बाल मतलब उसमें जीव नहीं है। जीवन कार्य किसका है? रक्त धातु का कार्य है, वो बालों को बढ़ाता है। तो अगर हमें बालों को बढ़ाना है तो हमें वहां का जो रक्त धातु का जीवन कार्य है वो अच्छी तरीके से करना है। और तो वहां पे आप लीच लगाएंगे, वहां पे आप अलग अलग प्रकार के खरजूर है, गर्जर है, रक्तवर्धक चीजें हैं, वो आप खाने को देंगे तो ऑटोमेटिकली क्या होने वाला है, बालों के मतलब हेयर रूट को ब्लड सप्लाई होने के कारण बालों की वृद्धि ज्यादा अच्छी हो गई और बालों में जान आएगी। तो बालों में जान नहीं होना ये अलग सिम्टम है, बालों में लस्टर नहीं होना ये अलग सिम्टम है। उसी प्रकार से मांस धातु क्षय अगर हो गया बालों में तो नंबर ऑफ हेयर उतने ही रहते हैं लेकिन जो नंबर ऑफ हेयर उतने ही होते हैं लेकिन उसका जो साइज है वो कम होता है। मैं यहाँ पे आपको ड्रॉ करके दिखाता हूँ, एक मिनट। तो अगर आप यहाँ पे देखेंगे कि किस प्रकार होता है, फॉर एग्जांपल ये पिक्चर ए है और ये पिक्चर बी है। ओके, ए एंड बी। अब ए पिक्चर में मैंने ये 5 हेयर डाल दे और बी पिक्चर में भी मैंने केवल 5 ही हेयर निकाले। ओके, देखिए ए में भी 5 है, बी में भी 5 है, लेकिन एक से ज्यादा बी की डेंसिटी आपको ज्यादा लग रही है। क्यों डेंसिटी ज्यादा लग रही है? नंबर ऑफ हेयर ज्यादा नहीं है। If you will do the scalp analysis of this particular patient, then you will find the same. You will find the same number of hair per square centimeter. There is no increase in the density of the hair as per the square centimeter in counting of the number of the hair. But there is definitely increase in the thickness of the hair. That's why the picture B is looking very dense. So it depends on the मांस धातु। अगर सिंगल बाल, एक एक बाल जो होता है उसका अगर मांस धातु अच्छा है तो उसकी जो जाडी है वो अच्छी रहती है और उसकी विड्थ अच्छी रहने के कारण जो हम कहते हैं ना कि केशिनी भी उसकी बहुत अच्छी तरीके से होती है, बड़ी होती है। या फिर पेशेंट आके बोलेंगे आपको मेरे बाल बहुत पतले हो गए हैं, उसमें कुछ बचा ही नहीं है, बाल गिरते नहीं है लेकिन पतले होते चले जा रहे हैं, तो आपको समझ में आना चाहिए कि वहां पे मांस धातु का क्षय हो गया है। तो अभी रस रक्त मांस मैंने आपको सिखाया तो मैं इसकी मेडिसिन भी बता देता हूँ आपको। आपको अगर रस धातु की दृष्टि है और बालों की दृष्टि है तो आपको क्या करना है, आपको शतावरी जैसी चीजें हैं जो रसवर्धक भी है, केश्य भी है, वो देना है। रक्त धातु की दृष्टि है और बालों की दृष्टि है तो आपको मंजिष्ठा जैसी चीजें हैं, ताप्यादि लोह जैसी चीजें हैं, मंडूर भस्म जैसी चीजें हैं जो रक्तवर्धन भी करेगी, केश्य भी काम करेगी। मांस धातु की दृष्टि हो गई, मांसक्षय है तो आपको जटामांसी जैसे द्रव्य है जो केश्य है और मांसवर्धक है वो आपको देने। अभी आपको पैटर्न एकदम सिंप्लीफाई हो गया। ग्रंथ में जब हमें द्रव्य सिखाते हैं तो उनको केश्य भी सिखाया जाता है और उनका गामित्व भी बताया जाता है कि ये रसगामित्व है, ये रक्तगामी है, मांसगामी है, मेदगामी। तो आपको मैंने केवल एक महाभूत का एक पैटर्न सिखा के आपको मैंने ग्रंथ को सूत्र विस्तार करने की एक अलग दृष्टि दी है, जिस दृष्टि के साथ आप इलॉबरेट कर पाएंगे कि कोई भी श्लोक, कोई भी मेडिसिन, कोई भी ग्रंथ में बताया हुआ जो ड्रग है, ताप्यादि लोह है, गंधक रसायन है या फिर सूक्ष्म त्रिफला है, कैशोर गुग्गुल है, लाक्षादी वटी है, ओके, पुष्याणुक चूर्ण है, पुष्याणुक वटी है, शुक्र स्तंभक वटी है, लाक्षादी गुग्गुल है, तो कहाँ पे यूज करने का है ना। अब देखो रस धातु का क्षय है, शतावरी घनवटी देंगे, रक्त धातु का क्षय है, हम वहां पे लघु मंजिष्ठ आदि घनवटी देंगे, मांस धातु का क्षय है, केश और मांसवर्धक, हम वहां पे जटा मांसी घनवटी देंगे, मेद धातु की दृष्टि है, मज्जा धातु की दृष्टि है, तो आप क्या कर सकते हैं, मज्जावर्धक और केश्य क्या क्या है आपके पास, यष्टि मधु है जो मज्जावर्धक है केश्य है, आपके पास जटा मांसी है जो मज्जावर्धक है केश्य है, वो आप दे सकते हैं। शुक्र क्षय और उसके कारण बालों का झड़ना है, तो आप क्या कर सकते हैं, शुक्रवर्धक प्लस केश्य दे सकते हैं, जैसे पुष्प धनवावटी है, जैसे वृक्ष योग है, जैसे शुक्र स्तंभक वटी है, जो शुक्रवर्धन भी करेगी और केश्य भी कार्य करेगी। तो देखो शुक्र का कार्य हमें लगता है केवल गर्भोत्पादन करना, ऐसा नहीं है। मैं हमेशा कहता हूँ, मजाक में कहता हूँ, शुक्र का कार्य है बाल बच्चे पैदा करना, तो वो बाल भी पैदा करता है और बच्चे भी पैदा करता है। तो हमें आयुर्वेद को आयुर्वेद की परिभाषा में भी समझना चाहिए। प्रीणनम जीवनम लेपहा स्नेहोदाहरण पूर्णे गर्भोत्पादश्च धातूनाम श्रेष्ठम कर्मत क्रमात् स्मृतम। देखो फिर से ये ग्रंथोक्त श्लोक है और उस श्लोक का सूत्र विस्तार हमने यहाँ पे लिया है कि प्रीणनम जीवनम लेपहा स्नेहोदाहरण पूर्णे गर्भोत्पादश्च धातूनाम श्रेष्ठम कर्मत क्रमात् स्मृतम। तो ये प्रीणन जीवन लेप, ये 7 धातु के 7 महत्वपूर्ण कार्य केश के साथ कैसे निगडित होते हैं और उसको आप किस प्रकार से एक एक धातु का क्षय या वृद्धि हो गया तो अकॉर्डिंगली उसके आप किस प्रकार से मेडिसिन दे सकते हैं, वो हमने यहाँ पे क्या किया है, अच्छी तरीके से देखा है। मैं आशा करता हूँ कि आप लोगों को ये भी पसंद आया होगा। ओके, नाउ वी विल गो टुवर्ड्स द नेक्स्ट। तो यहाँ पे मैंने सब आपको एक जगह पे रेडी टू ईट प्लेट सर्व किया है। तो इस प्लेट में आपको रस, रक्त, मांस, मेद, अस्थि, मज्जा और शुक्र में ड्राई हेयर, कर्ली हेयर, रफ हेयर, उसकी स्ट्रेंथ कैसी है, ब्रिटल कहाँ होते हैं, ग्रेइंग कहाँ होते हैं, अनहेल्दी कहाँ होते हैं, हेल्दी कहाँ होते हैं, अट्रैक्टिव कहाँ होते हैं, लेस अट्रैक्टिव कहाँ होते हैं, डैमेज कहाँ होते हैं, लेस लस्ट्रस कहाँ होते हैं, वो सब एज पर द धातु यहाँ पे आपको दिया है। आप इसका स्क्रीनशॉट निकाल सकते हैं, आप उसकी इंफॉर्मेशन आपके पास रख सकते हैं। ओके, इसी प्रकार से हम यहाँ पे देखेंगे, इसी प्रकार से हम यहाँ पे देखेंगे कि धातु संबंध में भी एक यहाँ पे आपको आइडेंटिफाई होने के लिए मैंने केवल एक फोटो दिया है स्किन का और उसमें एक हेयर फॉलिकल है। देखो उस हेयर फॉलिकल में आप देखेंगे, अब आप ढूंढो रस धातु कहाँ है। आप समझ रहे हैं मेरी इस बात को? यू से आई विल हेल्प यू टू ट्राई। देखो रस धातु, अब आप देख रहे हैं यहाँ पे, अरे हाँ बालों में तो रस धातु जाता है। रक्त धातु जाता है क्या बालों में नरिशमेंट करने के लिए? यस, रक्त धातु भी बालों में जाता है। मांस धातु है क्या? यस, उसके साइड में भी है इरेक्टर पिली मसल जो बालों को खींच के रखती है। तो बालों के अंदर भी मांस धातु होता है और बालों को पकड़ के भी मांस धातु बैठा हुआ होता है। ओके, मेद में ही तो, इस फैट में ही तो ये पूरे हेयर एम्बेडेड है, तो मेद धातु भी वहां देखने को मिल गया। अस्थि धातु, अब अस्थि का और बाल का संबंध बताने की जरूरत ही नहीं है क्योंकि उसी अस्थि धातु से तो केश बन गए है ना, तो वो भी उसमें है। इनर मेडुला भी डिपेंड होता है अस्थि धातु के ऊपर। उसके अंदर का जो पार्ट होता है कॉर्टेक्स, क्यूटिकल और मेडुला जो मैंने बताया आपको, तो वो मेडुला बिलोंग्स टू द मज्जा धातु और नया बाल निर्माण करना है शुक्र धातु का कार्य है। मतलब आप केवल सिंप्लीफाई भी करेंगे तो आप बहुत ही अच्छी तरीके से इसको सिंप्लीफाई कर सकते हैं। ओके, तो यस, मैं पहले इसको इरेज करता हूं। तो हमने सिंपल तरीके से ये जो रस, रक्त, मांस में अस्थि, मज्जा, शुक्र है 7 धातु में, वो हमने देखा है। इसको आपको और पढ़ना है और ज्यादा आपको इंटरेस्ट डेवलप हुआ है तो सारता परीक्षण में जाओ और हर एक की सारता देखो। मतलब त्वक सार किसको कहा है? तत्र स्निग्ध श्लक्ष्ण मृदु प्रसन्न सूक्ष्माल्प गंभीर सुकुमार लोमा। तो त्वकसार वही होता है जो रससार होता है, और रससार में सुकुमार लोम बताए हैं। तो हर एक सारता परीक्षण में बाल कैसे बताए हैं वो भी आप ढूंढेंगे तो आपको ऑटोमेटिकली जो है ये इसकी दृष्टि पता चल जाएगी। उसी प्रकार से रक्त धातु और हेयर का संबंध जो मैंने अभी बताया आपको वो आप ढूंढेंगे। मांस धातु और बालों का संबंध देखो आपको पिक्चर में अभी देखने को मिलेगा, छोटे 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 माइक्रो हेयर स्ट्रैंड होते हैं, बहुत से होते हैं, उससे एक हेयर बन जाता है और उसका एक बहुत बड़ा बंडल बनता है, जैसे वायरिंग होता है ना, सेम उसी प्रकार से। तो इससे भी आपको मांस धातु और बाल का संबंध पता चल जाएगा, है ना। अस्थि धातु और मेद धातु और बाल का संबंध क्या होता है? मेद इज ऑलवेज इनवर्सली प्रोपोर्शनल टू योर हेयर, मतलब जो जो मेद के स्थान है वहां पे बाल कम रहेंगे। मेद के स्थान क्या है? ग्रंथ में दिया है मेद वृद्धि के स्थान क्या? स्फिक्स तणुदर लंबनम 36 24 36, ये आइडियल ब्यूटी शेप है 36 24 36। अगर ये बढ़ गया तो ब्यूटी जाती है, अगर ये कम हो गया तो भी ब्यूटी जाती है। ब्यूटी इज ऑलवेज डायरेक्टली प्रोपोर्शनल टू मेद धातु, दैट्स व्हाई आई ऑलवेज सेज रियल ब्यूटी इज हिडन इन मेधा। ओके सो देखो 36 24 36 का पैटर्न किसने दिया है? मैंने नहीं, वाघभट जी ने दिया है। स्पिक्स तणोदर लंबनम, स्पिक्स तण और उदर का लंबन हो गया, ब्यूटी गई। और स्पिक्स तण और उदर के यहाँ पे बाल होते नहीं है, दैट्स व्हाई मेद इज इनवर्सली प्रोपोर्शनल टू केश एंड अस्थि इज डायरेक्टली प्रोपोर्शनल टू केश। तो जितना अच्छा अस्थि होगा उतने अच्छे बाल होंगे, लेकिन जितना ज्यादा मेद होगा उतने बाल जल्दी झड़ेंगे। इसलिए प्रेगनेंसी पीरियड में, इंस्टेंट वेट गेन में, इंस्टेंट वेट लॉस में आपको हेयर फॉल ज्यादा देखने को मिलता है। मज्जा धातु भी मैंने ऑलरेडी आपको लिया था, क्यूटिकल कॉर्टेक्स और मेडुला मैंने आपको एक्सप्लेन किया था वात पित्त और कफ के हिसाब से। अब यहाँ पे आप देख रहे हैं मज्जा धातु के हिसाब से जो इनर मोस्ट मेडुला होता है, जो पूरण करता है, पूरण पोली हम कहते हैं ना कि पोली के अंदर जो डाला जाता है वो पूरण होता है। मज्जा का कार्य होता है पूरण करना, और वो पूरण करने का कार्य मज्जा धातु करता है। बालों को अंदर से पोषण करने का कार्य मज्जा धातु करता है, इसलिए इस मज्जा धातु को हमने सीखना चाहिए। शुक्र धातु को अगर हम सीखना चाहते हैं तो एनाजन, कैटाजन और टिलोजन फेज जो मॉडर्न साइंस में बताई गई है वो फेज हमने सीखनी चाहिए, तो जाके हमें पता चलेगा कि कैसे टिलोजन के बाद एनाजन फेज आ जाते हैं। उत्पत्ति, स्थिति और लय मतलब एनाजन, कैटाजन और टिलोजन। एनाजन रिफ्लेक्ट्स टू उत्पत्ति, कैटाजन रिफ्लेक्ट्स टू स्थिति एंड टिलोजन फेज रिफ्लेक्ट्स टू द लय। देखो कितना इजी हो गया। मॉडर्न साइंस एकदम इजी होता है अगर हम आयुर्वेद के प्रिंसिपल पे उसको सीखें। तो उत्पत्ति, स्थिति और लय के अनुसार, और उत्पत्ति करने का कार्य किसको दिया है शरीर में? शुक्र धातु को। नए सेल निर्माण करना, नए परमाणु निर्माण करना, बाल बच्चे पैदा करना, किसको कार्य दिया है? शुक्र धातु को कार्य दिया है। तो ये भी चीज भूलनी नहीं है। देखो स्किन एंड हेयर आर ऑलवेज टुगेदर, इसलिए देखो 2 दिन के लेक्चर भी कैसे स्किन एंड हेयर, व्हाई? बिकॉज स्किन एंड हेयर आर ऑलवेज टुगेदर। यहाँ पे आपको मैंने 2 सिलेंडर दिखाए हैं, तो हमारे पूरे बॉडी के ऊपर देखो जहां जहां स्किन है वहां वहां आपको हेयर देखने को मिलेगा, बिकॉज स्किन एंड हेयर आर ऑलवेज टुगेदर। तो जहां जहां केश आयुर्वेद है वहां वहां आपको काया आयुर्वेद देखने को मिलेगा, दैट्स व्हाई केश आयुर्वेद एंड काया आयुर्वेद आर ऑलवेज टुगेदर, बोथ आर ओन बाय आवर ओन ब्रांड। ओके, तो इसी प्रकार से एक मेरी रशिया की पेशेंट थे, वहां पे जब मैं गया था तो डॉक्टर विताली थे वहां पे, और वो जो पेशेंट है उसका राइट फेलोपियन ट्यूब ब्लॉक था और एक्टोपिक प्रेगनेंसी हुई थी, तो वो ट्यूब निकाल दी थी, एक ही ट्यूब उसकी बची थी, और ओवम आगे नहीं आ पा रहा था क्योंकि फेलोपियन ट्यूब में जो सीलिया थे, माइक्रोविलाई थे, वो ज्यादा नहीं थे, वो कम थे, तो वो ओवम ही आगे नहीं जा पा रहा था। तो वो परेशान हो गए, तो और उन्होंने सोचा था कि अब जब तक वो सीलिया वहां पे आते नहीं अच्छे से, ओवम आगे जाता नहीं, तब तक आप ट्रीटमेंट मत, तब तक आप प्रेगनेंसी का चांस मत ले लो, क्योंकि फिर से आप एक्टोपिक प्रेगनेंसी रह गई तो ये भी आपकी फेलोपियन ट्यूब चली जाएगी एंड यू विल लूज योर यूटेरस एंड होप फॉर द बेबी परमानेंटली। तो वो वेट कर रहे, तो उनको किसी ने तो बताया रशिया में कि पुणे से बहुत बड़े वैद्य आने वाले हैं, आप उनको एक बार दिखाओ। तो वो केस मेरे क्लिनिक में आ गई, रशिया के क्लिनिक में। मैंने पेशेंट आने के बाद जब देखा, और गायनेक की बट ऑब्वियसली केस थी, तो मैंने देखा और मैं हंसने लगा। तो डॉक्टर विताली सर बोले कि आप क्यों हंस रहे? तो मैंने कहा सर ये गायनेक की केस नहीं है, ये तो ट्राइकोलॉजी की केस है। सर बोले ऐसे कैसे? मैंने कहा सर बाल ही तो बढ़ाना है, चलो चाहे फेलोपियन ट्यूब के अंदर क्यों ना हो, हम बढ़ा सकते हैं वहां के बाल। तो सीलिया तो बढ़ाने थे फेलोपियन ट्यूब के अंदर के, तो उसको गर्भाशयगामी रसवह स्रोतस्गामी, आर्तवह स्रोतस्गामी, केश्य, इस प्रकार की औषधियां दे दी। विद इन 3 months वहां पे सीलिया बढ़ गए, ओवम आगे जाने लगा। जब मैं नेक्स्ट फॉलोअप को 4 या 4.5 महीने बाद वहां पे रशिया में गया था, तो वो पेशेंट सोनोग्राफी का रिपोर्ट लेके आए थे और प्रॉपरली एम्बेडेड फीटस इन द यूटेरस, ये रिपोर्ट लेके वो आए थे। सो देखो, दिस इज द ब्यूटी ऑफ आयुर्वेदा। सो केवल गायनेकोलॉजिस्ट नहीं, ट्राइकोलॉजी से आप गायनेकोलॉजी की भी केसेस ट्रीट कर सकते हैं। इसलिए सूत्र विस्तार करना सीखो, सूत्र विस्तार को समझो। आप कोई भी जो डिसीजेस है, जैसे अभी फॉर एग्जांपल यहाँ पे केवल एक वाग्भट जी का श्लोक है, संस्त्रव्यास वेदस्वाप सादरुक्तोद वेदनम। अब इस सूत्र को अगर हम हेयर शाफ्ट डिसऑर्डर्स में विस्तार करेंगे तो पिली टॉर्सी, मोनिलिथ्रिक्स, ट्राइकोरेक्सिस इनवजानाटा, ट्राइकोरेक्सिस नोडुजा जैसे कितने हेयर के डिसीजेस हमें सीखने को मिलेंगे केवल एक सूत्र विस्तार करके। वात व्याधि के संस्त्रव्यास वेदस्वाप सादरुक्तोद वेदनम का सूत्र विस्तार करके। So my dear friends, always try to do the sutra vistar of our own shlokas. Always try to do the decoding of the code language given in our grantha. So you will enjoy the Ayurveda. As our sir says, live Ayurveda, love Ayurveda, and learn Ayurveda. So with the same note, I'm going to stop here, see the successful cases from our clinic and enjoy. Okay. Thank you. Thank you very much. Thank you, Shilpa ma'am. And thank you, Naveen sir. And thank you, my dear elder brother. Thank you very much for inviting me here. I'm in traveling, so I am leaving now. Okay, so we will not keeping the question and answer session. Sorry for that. But thanks you all organizers for giving me this platform to express my views. Thank you. Thank you very much.
Thank you very much, Dr. Patankar sir. Really, it was great. So I think we are here in this closing ceremony of International E-Conference on Skin and Hair Saundarya. So I think from last day we are discussing about hair and skin only, as just sir said that skin and hair always go similarly in combination. So it's really great. We are discussed various numerous aspects of skin and hair, but I think so much are also left to discuss. There are this area is very much wide, so really it was a great. I am thankful to all the speakers from first station, Dr. Patankar sir, Dr. Zaugule sir, Dr. Nirmala Suwal madam, Dr. Dipti Godbole, all the speakers, Dr. Nilesh Deshmukh, who has an interactive session with live demonstration. So really thankful to all, Dr. Sarika madam. So really thankful to all. So now I request our organizing president and founder of Ayush Darpan, Dr. Naveen Joshi sir, for vote of thanks.
So very nice workshop, wonderful workshop in which many practical sessions conducted very successfully. I am thankful to Dr. Harish for your very nice lecture, an impressive lecture, and all the other speakers, Dr. Nirmala Suyal and others. आप सभी को बहुत बहुत धन्यवाद। आपने बहुत अच्छा आयुष दर्पण के इस प्लेटफॉर्म पर एक बहुत अच्छा लेक्चर आपने दिया और प्रायोगिक दिया, आपने प्रैक्टिकल दिया। सबसे बड़ी बात यह है कि लोगों ने उसको देखा और काफी मोटिवेट हुए। हमारा यही उद्देश्य है कि हम आप सभी को एक मंच प्रोवाइड करें जिससे कि विभिन्न विषयों के विशेषज्ञ, लोग कोई सोच भी नहीं सकता है कि ट्राइकोलॉजी स्किन पर इतनी 2 दिन की एक श्रृंखला चल सकती है और वो काफी अभी भी काफी लोगों को बहुत कुछ कहना रहा होगा, वो समय के अभाव में वो उतनी डिटेल्स में नहीं दे पाए होंगे, पर फिर भी बहुत सफल रहा। हम आप सभी का बहुत बहुत आभार और अभिनंदन करते हैं और हम उम्मीद करते हैं कि इसी प्रकार आपके द्वारा आयुष दर्पण के इस मंच से जो है ज्ञान की जो गंगा है वो बहती रहेगी और लोग इसमें आपके जैसे बहुत सारे फॉलोअर्स हैं वो भी, और यहाँ जो हमारे दूसरे स्टेट्स के हैं वो भी इसको देख रहे हैं और वो भी इसको फॉलो करेंगे। हमारे साथ जो नेपाल से डॉक्टर निर्मला सुयाल जी जुड़ी हैं, वो काफी दिनों से आयुष दर्पण के प्लेटफॉर्म पर विभिन्न लेक्चर्स देखती हैं। हम आपने उनको एज ए स्पीकर बुलाया, ये बहुत अच्छी बात है। ऐसे ही जो हमारे स्टूडेंट्स हैं कल को वो भी स्पीकर्स बन सकते हैं अगर आप इसी प्रकार से अच्छा अपना एक कार्य करते रहेंगे। आप सभी का आभार और अभिनंदन। नमस्कार।
धन्यवाद सर, धन्यवाद।
जी
Thank you,
डॉक्टर
sir.
जी। तो कार्यक्रम को यहीं समाप्त करें डॉक्टर शिल्पा जी।
कोर्स के बारे में बोल देते तो अच्छा था।
हाँ किस हाँ को होस्ट जो है डॉक्टर शिल्पा येरमे जी।
नहीं कोर्स
अच्छा
कोर्स
कोर्स जो है वो अभी हमारे जो है वो अभी डॉक्टर शिल्पा येरमे जी ने बताया जैसा कि एक बहुत ही अच्छा कोर्स यहाँ पर लॉन्च किया जा रहा है, जिस कोर्स के बारे में आपको डिटेल मैंने यहाँ पे मैसेज बॉक्स में भी डाला है। ये हेयर स्किन और ट्रैकोलॉजी सब्जेक्ट पर है। जो लोग इसको ज्वाइन करना चाहते हैं, मैंने कल भी बताया था, वो लोग इसको ज्वाइन कर सकते हैं। सीखने का बहुत अच्छा अवसर है। You can register by filling the Google form and following the criteria whatever given in the Google form. So I hope that maximum of the young graduates who want to build your career on this cosmetology, trichology, hair and skin, they can join these sessions, and these sessions will be available on the social media platform of Zoom, but you can interact with your experts speakers by joining this course. So I hope that if you want to the details, the detail is available in the same the chat box, as well as the details is also put it over the Ayush Darpan Journal's Facebook page, a wall post. So you can go there, and if you want to any information regarding these courses, you can call at 9410379397. This is the phone number. I am again repeating it, 9410379397. So you can call or you can message. We will send the Google form as well as the detail of the link to your message box. Thank you, Dr. Silpa ji.
Yes, sir. Thank you. Yeah.
So
Shall
now,
I end? Yeah. I will end.
So now we are just ending the session. Thank you, and again come with the next again the new webinar. Most of you are asking that when the new webinar. So just watching, keep watching the Ayush Darpan Journal. You will get the informations and other details.
Yeah, tomorrow is another session in this series also, recent advancement of skin and hair treatment. We are introduction one series also. So stay tuned for tomorrow also 3 PM. Unwanted hair growth पे एक सेशन हम ले रहे, तो उसकी भी एक सीरीज चलेगी, तो ये भी इसी रिलेटेड है वेबिनार के. सो आई एम जस्ट अनाउंसिंग इट आल्सो. So thank you, sir. Thank you.
Thank you.